Good evening, everyone. Welcome to the presentation of Patheya National Seminar, a new platform with great pleasure. This national seminar presentation is an amalgamation of various topics. There's a lot of knowledge that we know and don't know in our Ayurvedic science. This Patheya National Seminar presentation is to bring this knowledge to everyone in a short period of time and to enable everyone to speak for the growth of Ayurvedic science. At the beginning of third day of Patheya National Seminar, I would like to invite our paper presentation coordinator, Dr. Aishwarya. Dr. Aishwarya?
Yes, hello. Am I audible?
Audible, doctor.
Thank you, Dr. Sabin. Good evening, everyone. Honorable panel members and dear participants, a very warm welcome to our final day of Patheya National Level Paper and Poster Presentation by Team Ayurapta. And on behalf of Team Ayurapta, I welcome our eminent panel members. First of all, I would like to invite our Agatandra panel, Dr. Aishwarya S, Dr. Jayaprasad, and Dr. Shalini. Next, I welcome Panchakarma panel, Dr. Mohan Kumar, Dr. Anjana Mishra, and Dr. Mahesh Raj. I welcome our Dravyaguna panel, Dr. Vikas Sharma, Dr. Sridevi, and Dr. Shija. Now I invite Kaumarabhritya panel, Dr. Pankaj Verma, Dr. Remya, and Dr. Ansiba. I invite Samhita panel, Dr. Veena Vijayan, Dr. Rashmi, and Dr. Krishnapriya C. Now I invite Nidanatantra panel, Dr. Adarsh Arora, Dr. Nitya R, and Dr. Arya K. Now I invite Prasuditantra panel, Dr. Supriya, Dr. Kavita, and Dr. Ashwani. Now I invite our Swastavrita panel, Dr. Vandana Sharma, Dr. Shilpa, and Dr. Kirti. I welcome Kaya Chikitsa panel, Dr. Nidesh Pande, Dr. Vinita, and Dr. Surya Chedar. Let me invite Manasika panel, Dr. Nitin Darade, and Dr. Uma Jadhav. And now I invite Shailatandra panel, Dr. Sandeep Pande, Dr. Ravinder Singh, and Dr. Vaishnav. I invite December Shija panel, Dr. Arunlal K. and Dr. Preeti. Now I would like to invite Shalakitantra panel, Dr. Akanksha Keshri, Dr. Devika Pratap, and Dr. Cyril. I invite Physiology panel, Dr. Kiran Kumati and Dr. Ramya. And finally, I invite Dr. Ramya Bhushan and Dr. Divya Prabhaji. Dear participants, the webinar is streaming live on YouTube and the copy will be saved in the broadcast website. So don't unmute unnecessarily, and we have a tight schedule. So please do follow the time limit. Your allotted time period is maximum 8 minutes. And I wish all the very best to all the participants. And now let's start. First, I invite Dr. Aishwarya Laxmi Hegde for the paper presentation. I invite Dr. Aishwarya Laxmi Hegde.
Hello, Dr. Aishwarya. Aishwarya Laxmi.
Yes, ma'am, I'm there.
Doctor, please share your screen.
Your screen is visible, doctor. Please start.
Good evening, everyone. Myself, Dr. Aishwarya, first year PG scholar, Department of Rasa Shastra and Bhashaja Kalpana. My topic of presentation is Lokanatha Rasa under the guidance of Dr. Ghazala. Coming to introduction, Lokanatha Rasa is one of the Sagandha Sagni Murchita Yoga of Bharata. In the name of Lokanatha Rasa, we have Lokanatha Pottali, Lokeshwara Rasa, Lokesha Pottali, and such references are available in the classical text. And here, Kapartha is one of the important ingredients in Lokanatha Rasa, and it's mainly indicated in GIT diseases like Atisara, Amlapitta, Grahani, Yakrit, Liha Roga, and also in the respiratory disorders like Shaya, Kasa, Shwasa. And coming to references, in total we have 19 references available in the classical text of Ayurveda, and these are Sharangadhara Samhita, Rasayoga Sagara, Bharata Bhaisha Chiratnakara, Rasa Prakasha Sudhakara, Yoga Ratnakara, Rasaratna Samuchaya, Rasamanikya, Bhaisha Chiratnavali, Rasa Chandamshan, Rasendra, Sara Sangraha. And in some of the texts, there are more than one method of preparation of Lokanatha Rasa. Coming to the method of preparation, according to Rasendra Sara Sangraha, and it's mentioned under Liha Chikitsa. Paradam Gandhakam Chaiva Samabhagam Vimartaye. Parada and Shuddha Parada and Gandhaka are taken in equal quantity and it's made into Kachali. And to this, Mritabhram Rasatulyam Cha Punas Tatraiva Martayet. To this, Mrita Abhra is added in the quantity equal to that of Parada taken, and Mardana is done. And to this, Loha and Tamra Bhasmas are added, twice the quantity of Parada taken. And to this, Bhasma Varatika Bhasma is added, thrice to the quantity of Tamra taken. And all this are to all this, Bhavana is given with the Nagavali Svarasa. And once it's done, it's made into it is given Putta, and it's Gajaputta is given, and after Svangashita, and it's taken out, and Mardana is done. And this is called Lokanatha Rasa, and it's mainly indicated in Yakrit, Liha, Udara, Gulma, Shvayatu. And it is advised to take along with Pippali, Madhu, Guda, Haritaki, Gomutra, and also Jiraka. And according to Rasa Ratna Samuchaya, and this Varatika Purana method is said, which is the commonly followed method of preparation of Lokanatha Rasa. Here, one part of Shuddha Suta is taken and it's added with 4 parts of Shuddha Gandhaka, and Kajali is prepared out of it, and it is filled in a Varatika Garbha and sealed with Tankana paste, and it's dried and it is placed in a Sharava, and some Putta is made, and this is given with Putta. And after Svangashita, this Varatika along with whatever is inside, it's made into powder, and this is called Lokanatha Rasa, and it's taken along with Madhu, and dose of it is 4 gunja. And Anupana is advised as Kashaya of Nagara, Ativisha, Devadaru, and Vacha, and this is mainly indicated in Atisara Roga. Yes, as I've said, there are total 19 references, and tabulating it, we have Putta Paka method of preparation, where the ingredients are Shuddha Parada, Gandhaka, Kapartha, Tankana, Shanka. Here we can see the ingredients are same, but the ratios are different in both the columns. And also the Bhavana Dravya is Gokshira in one, whereas it is Jambira Rasa in the other. According to that, the indication also differs a bit. It is indicated in Atisara, Kshaya, Aruchi, Grahani, Mandagni, Kasa. In the first one, whereas in the second method, it is Rakta Pitta, Sarvaroga, Pushti, Virya Bala, Oja, Vardhaka. And other method of Puttapaka preparation, the ingredients are Shuddha, Parada, Gandhaka, Abhraka, Bhasma, Loha Bhasma, Tamra Bhasma, Shuddha Varatika, and Bhavana is given with Kakama Chirasa. Even here the ingredients are same, but ratio is a bit different, and also the Bhavana Dravya in the second column is Nagavalli Rasa, and according to this, the indication also differs a bit. There is also a mentioning of Pupi Pakva method of preparation where Shuddha Parada and Gandhaka are taken in equal quantity and Kajal is prepared out of it, and Bhavana is given with Hasti Shundi and Hingu Patri Rasa. And it is kept in Valuka Yantra for 12 hours and until we get Pita Varna Bhasma. It's mainly indicated in Agnimandya, Jvara, Vrishya, Udara. Kalviya method of preparation is also mentioned where Parada and Gandhaka are not said. Here, Kaparda Bhasma, Mandura Bhasma, and Maricha Churna and Bhavana is given with Nagavalli Swarasa. And Kaparda Purana method, this is the commonly followed method of preparation for Lokanatha Rasa. And in Rasa Yoga Sagara, they have mentioned Shuddha Swarna Parada, and it's kept in Budhara Yantra. And after that, Gandhaka is added and Bhavana is given with Chitraka and Adraka Rasa. It's mainly indicated in Raja Yakshma. Coming to the articles, I have got the article Review of Lokanatha Rasa by Dr. Sangeeta Rao, Dr. Vikram, and Dr. Ravindra Angadi. And in this is an article where literature review of Lokanatha Rasa is done. And here they have tabulated mainly the method of preparation, indication, dose of Lokanatha Rasa according to different authors mentioned in the classical text. The second one is preparation of preparation and physiochemical analysis of Lokanatha Rasa, herbo-mineral preparation by Grishma Raj, S. Tara Laxmi and Kiran Sharma. Here the method of this Lokanatha Rasa is prepared using the reference of Sharangadhara Samhita, and its analytical parameters are checked. A maximum of 750 degrees centigrade temperature was given. Discussion, there are in total 19 references for the preparation of Lokanatha Rasa, and this stabilizes and potentiates the bond between the constituents, thus providing higher therapeutic efficacy with minimal dose, but its practical usage is very less. The important ingredient of this Lokanatha Rasa mentioned by different authors are Kaparda, Shanka, Parada, Gandhaka, Tankana, which has the action of Krimikna, Rasayana, Vyavai, Vikasi. Hence, it's indicated in GIT disorders like Amlapitta, Atisara, Grahani, Kshaya, and Kasa. Concluding this, Potali Kalpana is one among the 4 Murchita Parada Yogas. This stabilizes the bond between the Parada and Gandhaka. Hence, it provides a compactness between this and we get a unique formula with enhanced physicochemical properties and also drug efficacy in the treatment. And it is mainly indicated in Kshaya, Ajirna, Aruchi, Atisara, Liha, Arshas, Kasa, Raktasrava, Nidranasha, Jvara, Grahani, Charti, Rasayana, and Mutrakachra. Thank you.
Thank you for this wonderful presentation, Dr. Aishwarya. So next I invite Dr. Thanusree and Nair. I invite Dr. Thanusree.
Good evening, doctor. Am I audible?
Yes, doctor, you are audible.
PPT is visible, right?
Yes, doctor, please start.
Shri Gurubhyo Namaha. Om Dhanvantaraya Namaha. As we all know that stress is the way human beings react both physically, mentally to changes, events, and situations in their lives. People experience stress in different ways and for different reasons. When a body feels stressed by something around, it reacts by releasing chemicals into the blood, which gives the body more energy and strength. This can be a good thing if the stress is caused by physical activity. Similarly, it can be a bad thing when stress is in response to an emotional instance and there is no outlet for this extra energy and strength. In today's presentation, we are going to discuss about what is stress, what are the different stages of stress, stress management, role of Ayurveda and yoga in stress management. Moving on to the introduction, India has the 14th position in largest stress country in the world. The survey shows that in India, nearly 51.2% of IT sector employees are the victim of stress. Globally, around 33% of people report feeling extreme stress. Among that, 77% of people reports that this affects their physical and mental health negatively. Work and financial issues are the two major reasons why people stress in India. It is gradually affecting even the college students and adolescents too. And so, only the suicidal tendency, depression, drug abuse, etc. are becoming common even among school and college going students. According to WHO, India is the most depressed country. This suicidal tendency, depression, anxiety disorders, etc. are mainly due to the lack of awareness, poor familial and social contact, and improper lifestyle. Stress can be well controlled by the intervention of yoga and Ayurveda. So, what is stress? Stress is primarily a physical response. Stress is your body's natural response to a real or perceived danger. When you encounter a potential threat, your nervous system reacts by pumping stress hormones like cortisol and adrenaline through your body. These hormones raise your heart rate, constricts your blood vessels, and raise your blood sugar. Stress is defined as physical, mental, or emotional strain or tension. When stressed, the body thinks it is under attack and switches to fight or flight mode. So, generally, stress can be a positive or negative. Positive stress can inspire people to do their best. So, positive stress will help to motivate, provides excitement, improves performance, both physical and psychological. But negative stress is the opposite of positive stress. It can cause anxiety, it feels unpleasant, decreased performance, it may lead to both physical and psychological problems also. If we are kept in a state of stress for longer periods, it can be detrimental to our health. It can alter health and emotions as well. It can affect cognitive functions, impairs concentration, attention, decision-making ability, and creativity. Thus, stress is a silent killer. There are two components of stress. One is stress and another one is stressor. So, what is stressor? Stressors are life events or situations that trigger stress. They trigger you to fight or flight response, prompting the release of stress hormones throughout your body. So there are few examples for stressors like work stressor, financial stressor, emotional stressor, etc. So what is the main difference between stress and stressor? Stress is your hormonal response to a perceived threat, danger, or other stimuli. Stressor are what that trigger this reaction. So stress can involve emotional reactions like panic, irritability, or worry, etc. Stresses are the experience that prompt those feelings. Stress can harm you if you left unmanaged. Not all stressors are harmful. Hans Selye, a famous endocrinologist, he is known as the father of stress research. He explained that it's not stress that kills us, it is our reaction to it. So, before moving to the management, we can understand what are the different stages of stress. Mainly, there are three stages. Those are alarm stage, resistance stage, and exhaustion stage. Alarm stage is when the central nervous system is awakened, causing your body's defenses to assemble. This SOS stage results in a fight or flight response. Resistance stage is when your body begins to repair itself and normalize heart rate, blood pressure, etc. After the initial shock of a stressful event, your body enters this recovery phase but remains on high alert for a while. Exhaustion stage is when activation in the first two stages continues over time, causing a breakdown in the balance within your body. This is when certain diseases such as physiological, psychological, or behavioral may begin. What are the causes for stress? Actually speaking, there is no particular fixed cause for stress. The reason can be overambition, work pressure, disturbed marital life, poor economical status, etc. This can be included as the agents of stress. This long-term stress can lead to consequences like physiological, psychological, or behavioral problems like hypertension, heart failure, heart attack, depression, anxiety, personal disorders, obesity, bulimia, sexual dysfunction, etc. And panic attacks are the most extreme reaction from stress. So, how we can manage this stress? Yoga and Ayurveda both are referred as sister sciences in terms of self-healing and self-realization. Self-awareness through yoga and healthy lifestyle pattern from Ayurveda has a major role in handling the stress. From perspective, stress management can be done by two ways. One is lifestyle management and purification therapies. Yoga involves mind-body practice that combines stretching exercises, controlled breathing relaxation, and spiritual practices, etc. Stress can be managed mainly through lifestyle management and purification therapies. Although stress and stressors are different, both impact your overall stress levels. Knowing the difference in how to deal with them will help you to cope up this situation. So here are some techniques like these different types of charyas, satvruta, shirodhara, shiropichu, nasya, etc. Few examples I can give. For example, like vyayama or exercising daily. This physical activity naturally produces endorphins, a stress-relieving hormone, and improves your overall health condition. Even a 15-minute walk can change your mood. Snana or bath, which relaxes the nervous system, releases tension, and helps to quiet the mind. Also, if we are having the healthy foods, it can help to build up your immune system and lower your blood pressure. They can also trigger your brain's production of serotonin, a calming hormone and neurotransmitter. And also Abhyanga, which is a profound practice of rejuvenation and self-care that benefits both physical and mental health. In addition, it also forms a protective sheet around the body that can help to buffer the nervous system against stress. Purification therapies will help to soothe these delicate tissues, promotes unobstructed breathing, release accumulated stress, and supports mental clarity.
Hello, Dr.
Similarly,
Thanusree.
there are different methods are there for the management of
Hello, doctor.
stress.
And doctor, can you speed up your presentation, doctor?
Yes, of course. Moving to the management of yoga. In yoga, breathing using diaphragm as you breathe can stimulate the vagus nerve and helps to reduce stress. Asanas for stress release like Uttasana, Adhomukha Shavasana, Belasana, Shavasana, etc. will help for the stress relief. Apart from the asanas, pranayama also helps to relieve from stress. The main 5 points to remember are proper asana, proper pranayama, proper relaxation, proper diet, positive thinking, and meditation. Stress is a fact of life wherever you are and whatever you are doing. You cannot avoid stress, but you can learn to manage it so it doesn't manage you. Moving to the conclusion, in Bhagavad Gita, chapter 2, Sankhya Yoga, which is explaining about the Patheya, the pathway of knowledge. Here it explains that Dhyayado Vishayan Pumsaha Sangateshu Bhajayade Sangat Sanjayade Kamaha Kamat Krodha Bijayade. When a man thinks of object, attachment for them arises. From attachment, desire is born. From desire arises anger. Krodhat bhavati sammoha, sammohat smriti vibhramaha, smriti bhramshat buddhinashaha, buddhinashat pranashyati. From anger comes delusion. From delusion, loss of memory. From loss of memory, the destruction of discrimination. And from destruction of the discrimination, one who perishes. Thank you.
Thank you, Dr. Thanusree. So next I invite Dr. Sneha. I invite Dr. Sneha.
Yes, I'm present, ma'am.
Doctor, please share your screen.
Okay, huh.
Unmute.
So can you please share my PPT on your screen? Hello.
Doctor, please wait. Dr. Sabin.
1 second, doctor. Dr. Sneha, we will call you next, doctor.
Yes, sure, sir.
Okay.
So next I invite Dr. Pratiksha Pramod. I invite Dr. Pratiksha.
Yes, ma'am.
Doctor, please start.
Okay, ma'am.
Your screen is visible,
Hello.
doctor. Please start.
Yes, sir. Good evening to all. My topic is vitamins. Vitamins are organic food factor which are essential for healthy and well balanced growth of the body. Is called as vitamins. Vitamins are manufactured in plants and animal also. Animals can manufacture only few vitamins, which are vitamin A and D. There are two types of vitamin: fat soluble vitamin and water soluble vitamin. Fat soluble are A, D, E, K vitamin, and water soluble are vitamin B complex and C. Fat soluble vitamin, the body which stored fat soluble vitamin in fatty tissue and liver, and these vitamins can stay in body for days and sometimes months. Dietary fat can help the body to absorb the fat soluble vitamin through intestinal tract. And water soluble vitamin which do not stay in body for long and cannot be stored, they leave body through urine. So people need a more regular water soluble vitamin than fat soluble vitamin. Vitamin A, retinol, which is also called as anti-zero ophthalmic factor. Properties: it is yellow color viscous oil, heat stable in absence of air, which is formed from provitamin beta carotene in gastrointestinal tract and which is stored in liver. Daily requirement in adult 5,000 IU per day, and in growing children, puberty, pregnancy and lactation 6,000 to 8,000 IU per day. Sources: animal sources, cod liver oil, halibut liver oil, milk, butter, egg, and fishes. And vegetable sources: carrot, spinach, vegetable oils, yellow and green vegetables, and fruits, etc. Function: it is essential for growth. It is also essential for night vision because it is a component of rhodopsin. Hence, it is also essential for night vision. It prevents infection. It maintains nutrition and function of nervous tissue. It controls the action of the bone cells. It helps in normal fertility and also helps in glucose synthesis. Due to deficiency of vitamin A, it causes xerophthalmia and night blindness. In xerophthalmia, there is stoppage of lacrimal activity. Therefore, cornea and eyelids become dry and ulcerated, which leads to swelling of eyelids and opacity of cornea. If it is untreated, it leads to night blindness. Increased incidence of respiratory, urinary, and digestive system infection, inability to gain weight, retardation of growth in children, and defective growth of bones and teeth. Vitamin D, calciferol, which is also called as anti-rachitic factor. Properties: it is heat stable. Vitamin D, there are 10 types, but D2 and D3 are cheap. Daily requirements: 400 IU per day in adults, and in growing children and pregnancy, 400 to 800 IU per day. Sources: sunlight, dietary sources, fish liver oil, cod and halibut liver oil, egg, milk, and butter. Functions: anti-rachitic function. It is essential for absorption of calcium and phosphorus, essential for calcium and phosphorus metabolism, help in the bone formation, helps in the development of normal teeth. It maintains calcium hemostasis. Due to deficiency of vitamin D in adults. In bones, there is deficiency of vitamin D, which leads to rickets in children. In rickets, bones become soft due to less deposition of calcium salt, and long bones remains cartilaginous, easily bent under the weight of body. And in osteomalacia, it occurs as adult rickets and mostly occur in women, pregnancy and lactation period. Vitamin E, tocopherol, which is also called as anti-steroid factor. Properties: it is heat stable and obtained naturally as yellow oil. There are three varieties of vitamin E: alpha, beta, and gamma. Daily vitamin E 50 mg per day. Sources: animal sources, milk, fish, animals, vegetable soil, corn, and vegetables.
Hello, Dr. Pratiksha. Hello, Dr. Pratiksha, are you there? Okay, next I invite Dr. Sneha Suresh for the paper presentation.
Yes, I'm present, sir.
Okay, doctor. I will share the screen for you, doctor.
Huh.
Doctor, please chat, doctor.
Good afternoon, everyone. My name is Dr. Sneha Suresh, and I'm presenting Asclepiadaceae family under the guidance of Dr. R.S. Kharath sir. Introduction: commonly known as the Milky Way family, Asclepiadaceae includes some 250 genera and over 2,000 species, mostly herbs and shrubs with white sap. Leaves simple, near, always opposite or word and extrapolated. Next slide, sir. Flowers mostly hermaphrodite. Symmetry is mostly actinomorphic, solitary or few or many together in umbel. Umbellate cyme, inflorescence, cymoses or racemose. Next, calyx. They have 5 sepals, polysepalous and inferior. Corolla, 5 petals which are fused and form a short tube-like structure. Androecium, stamens are 5 and inserted at or near the base of the corolla tube. The filaments may be free or may be united to form a tube round the style. Gynoecium, next slide, sir. Gynoecium, the gynoecium is a bicarpellary. The ovaries of the two carpels are free. Style are united at their apices. The stigma has a 5 lateral surface. The ovaries are distinct and nearly always superior. Next slide, sir. Fruits. Generally, it is a pair of follicles. Seeds. The seeds are flat, endospermous, crowned by a fruit of hairs. Next, अर्कादि वर्ग included अर्क मतलब कैलोट्रोपिस जाइजेंटिया, अर्क पुष्पी, सारीवा, काकणासा, वृश्चिकाली, जीवंती, मधुनाशिनी, मुर्वा, अंतमूल, पातालतुंबी and so. Next, Hemidesmus indicus means sariva, perennial, slender, twinning shrub, woody and fragrant rootstock, stem numerous, wiry, lactiferous, leaves simple, opposite, elliptical, oblong to linear lanceolate, 5 to 10 centimeter long, glabrous, white above and silvery white pubescent beneath. Flowers greenish purple, crown in axillary cyme, calyx 2.5 mm, corolla 5 to 6 mm long. Active compound is p-methoxysalicylic aldehyde. Next, Calotropis gigantea, a tall shrub 2.4 to 3 meter high, bark yellowish white, branches stout, more or less covered with fine appraised cottony pubescence. Leaves 10 to 20 by 3.8 to 10 centimeter long, sessile, elliptical, oblong or obate oblong, thick, clothed beneath and above with a fine tomentum. Flowers purplish or white in umbellate cyme, calyx 5 sepals, corolla, gametopetalous, 5 lobe, twisted estivation. Active compound, eucerin, calotropin, and calotoxin. Next slide, sir. Calotropis procera, an erect shrub, usually 1.8 to 2.5 meter high, bark soft, corky, spongy, leaves subsessile, usually 5 to 15 by 4.4 to 8 centimeter long, broadly ovate oblong with cottony pubescent. Flowers in umbellate cyme, glabrous, calyx 5 sepals, corolla glabrous, follicles 7 to 10 by 5 to 7 centimeter, subglobous, ellipsoid, seeds ovate, flattened, light brown. Next slide. Pergurella extensa, a perennial herb, stem clothed with spreading hairs, leaves thin, usually velvety pubescent, margins ciliated, flowers greenish yellow or dull white, calyx pubescent, sepals 3 mm, ovate lanceolate, corolla tube narrowly capitulate, follicles reflex, lanceolate, enchinated with soft spine. Next slide, sir. Thank you.
Thank you, doctor. Next, I invite Dr. Dr. Sneha Kamalakar Sabale for the paper presentation.
Sir, I'm present.
Okay, doctor. Please share the screen, doctor.
Yes.
Your screen is visible, doctor. Please chat.
Am I audible?
Audible, doctor.
I'm Sneha Sabale. I'm PG student, Sharir Kriya in GAC Nanded. Today's topic is concept of man. Manas is the most important part of life, which is combined state of Sharir, Indriya, Sattva, and Atma. The study of Manas is an integral part of the basic thoughts of Ayurveda. Man is the one of the Karan Dravya. Sattva Atma Shariram Trayam Etam Tridandavat. Sattva Atma Sharir. These are the tripod of the Ayu. Mana Jnana Bodhe. Man is the entity which makes a person knowledgeable. Manyate avabuddhyate anena iti mana. Avbodhan means to perceive knowledge. The process of getting artha, that is knowledge, is possible only with man. Utpatti. Sankhya as well as Vaisheshik describe the Utpatti of mana from Rajasic and Tamasic. Man is called as Ekadash Indriya. In Ayurveda, the mana bhava Utpatti is in fifth man. Panchame mana pratibuddhitara bhavati. Definition. Yad indriyana abhigrahakam cha mana iti abhidhiyate. The entity which helps the indriya to perceive their own arthas, to get knowledge of arthas. Sukha, Dukha, Krodh, Vishan, etc. bhavas knowledge is gained by mana. Atindriya, Guna, Mana, Sattva, Sadhi names of Mana. Mana is called as Atindriya, Cheta, Sattva, as well as Rudayam, Rutamanasam. The seat of Mana. In Ayurvedic literatures, various references are available regarding the seat of Manasa, which are being discussed as here under. Man is continuously active, so it cannot be it is not stable at one particular place. Here, it is very difficult to say that seat of mana is something one place. In Acharya, references available in of mana as it is Hridaya. Acharyas mentioned that Hridaya is the seat of Chetna in the body. Hridaya is the actual seat of mana. Hridaya is the seat of Triguna as well as that are the normal characteristics of mana. Also, the Bhel Samhita has explained that Shiras Talva Antargata Sarva Indriya Mana. It has been explained that Prana and Indriya are situated in Uttam Anga, that is Sira. Among the whole Indriyas, Manasa is the supreme because it controls the Indriyas. So the Shir is the sthana of Mana. Also, Sarva Sharir is the sthana of Mana. The Swarupa of Manas is without any Rupa. It is Nirvikara. As it is an Ati Indriya Swarup, could be understood through Lakshanas. Manas is exposed to Vedanas like Sukha, Dukha, Vichar, Krodh, Kam, etc. Only through Manas we can understand these features. Charaka says that we cannot learn without coordination because Manas, soul, sense, organs and subjects. Manas Gun. Anutvam Chauthi Ekatvam, Do Guno Manasa Smrutam. Anutva and Ekatva are those gunas of mana, are the qualities of mind. Anu means sukshma, it's subtle, or in other words, mind is so minute, so it can't be seen. Due to its micro size, mind can move into body very fast. Due to the subtleness, it conjugates with different sense organs to perceive knowledge rapidly. Mind conjugates with sense organs, so mind conjugates with sense organs so rapidly that visualization, hearing, perception of smell, all these processes seem to be occur at one time. But every process is getting once at a time. Manas is the only one, but because of its extraordinary speed, we can feel it as there are numerous manas. But this is our, we are able to see an object, smell, and touch object because of unimaginary high speed of manas and subtleness of manas. It is explained by Shatapatra Kamal Bhedan Nair. मानस मनाचे मनाचे दोष रजस्तमश्च मानसो दोषो. The mana is made up of three gun. Whatever the status of mind remains in, out of three guna, it predominates one at a time. Person is said to be sattvic, rajasic, and tamasic in accordance to predominance of the guna. Sattvic, rajasic, and tamasic, these are the gunas. But sattvic is nirvikara, rajasic and tamasic are the doshas of mana. Sattvic and rajasic are responsible for deviation of mind for and generation of disease. मनाची कर्म इंद्रिय अभिग्रह कर्म मनस्य स्वस्य निग्रह उह विचारश्च. Functions of manas. The functions of manas are indriya abhigraha, that is control of sense organs, swasya nigraha, self-restraint, uya, hypothesis, and vicharya, that is consideration. They present the actions of mind. Indriya abhigraha is to control on all, to keep control on all organs. Manas is called as controller of the sense because it indicates to receive and send the impulse. Swasya nigraha is to keep control on oneself. Controlling of self-function or self-control is called as swasya nigraha. Manas is called as chanchal. So it is necessary to have swasya nigraha to have right orientation towards desired objects and retraction from those after purpose of is fulfilled. Uya. Uya is the knowledge of imaginary objects. Vicharya. Chakrapani stated that thinking upon perceived object for its reception, it is accepted or not, it is called as vicharya. Then manache vishay, manas vishay, chinte vicharya uya dheya yatkin. These are the objects of mana. Chintya. Chintyam kartavyataya akartavyataya. Chintya is thing requiring thought to think about, to do or not to do with purposeful or purposeless manner. Also to think practically or impractically. Vicharya. Vicharya, it is distinct analysis which enough to direct the mind to accept or reject a thing. Vicharya is to consider right or wrong with previous experience. Uya, it is a judgment about the near future that certain thing may happen. Dheya, to keep an object. It is an emotional thinking about distinct thing. Sankalp, it is an consideration and determination of mind about a thing that I have decided this certain thing. Mana's Lakshan. Without man, we can't get knowledge. To know or not to know is the criterion of recognition of presence of or absence of mind. Mind is not attentive. If the mind is not attentive, the soul, indriya, artha, and atma is not able to get the knowledge.
Hello,
When
Dr.
soul and
Sneha. Doctor, you are exceeding the time limit, doctor. Can you speed up
Yes,
your
yes.
presentation?
Yes.
Okay, doctor.
When soul, subject, and perception of subject with sense organ is done in presence of attentive mind, one gets knowledge. The sattva, we call man as sattva. Am I audible? संपलं वाटतं. Hello.
Yes, doctor.
Hello, doctor.
Okay, thank you.
Thank you, doctor. So next I invite Dr. Kiran Baburao Jadhav.
Hello, ma'am. I am audible.
Yes, doctor.
Hello.
Hello,
Am I audible?
doctor. Your screen is visible, doctor. You are also audible. Please chat, doctor.
Hello, everyone. The सामान्य विषय सिद्धांत. Made of the at the level of
Hello, Dr. Kiran Jadhav. Are you there, doctor? Hello, Dr. Kiran Baburao Jadhav. Hello, Dr. Kiran Jadhav. Are you there? Hello, doctor. Please unmute, doctor. Hello, Dr. Kiran Jadhav. Please unmute, doctor. Hello, Dr. Kiran Jadhav. I think you are suffering from network problem. We will call you next, Dr. Kiran Jadhav. Next, I would like to invite Dr. Priyanka
Hello.
Pande for the paper presentation.
Yes, sir.
Okay, doctor. Please share the screen, doctor. Dr. Priyanka. Hello, Dr. Priyanka, can you hear me? Hello, Dr. Priyanka Pandey, can you hear me?
Dr. Priyanka. So next I invite Dr. Reena. I invite Dr. Reena.
Yes, I am here. Dr. Reena here. Reena Malinpur.
Good evening, doctor.
Should I share the screen now?
Yes, doctor, please.
Just that I am sharing it.
Your screen is visible, doctor. Please chat.
Hello everyone. I am myself Reena Malinpur. About word Indriya. Indriya is meaning of word Indra is prana. Meaning of word Indriya is apparatus which exhibits symptoms about vitality. It means Indriya expresses all symptoms concerning vitality of life. Especially and that is Praksha. That means definition. They Indriya are total 11 in number, and these are as follows: 5 Jnanendriya, 5 Karmendriya, and 1 Udhyatmak. The Utpatti, that means generation of Indriya in intra-uterine life, from external part of lotus of cup and the cup, Indriya gets originate. Commentator better explain the meaning of this statement from Mahabhutagani of Total for Kapha and Rakta. These indicate Dodium. In unicellular zygote, everything is present, yet for special senses and for other sense organs to develop and differentiate it takes third month. That means this is the generation of Indriya in intrauterine life. Next is first of all, we study this step by step. First of all, Panchajnanendriya. Panchajnanendriya are nothing but the sense organs. Next one is female point is Indriya ke Panchabhautika tattva. That means the Indriya are made up of Panchamahabhut. That means the 5 Mahabhuta are Akash, Vayu, Tej, Aap and Prithvi. Constitution of sense organ is Panchamahabhut. Every sense organ has one Mahabhut predominant in spite of such constitution. Tej is predominant in eye. Akash is predominant in ear. Prithvi is predominant. Akash is predominant in. Am I audible?
Yes, doctor. Audible, doctor.
Akash is predominant in ear, Prithvi is predominant in nose, Aap is predominant in taste organs, and Vayu is predominant in touch perception. All these things are so natural by wish of God. These are Indriyanche Panchabhautika. That means Indriya are constitutes of 5 Mahabhut respectively. Next one is food on Panchamahabhut. Acharya Charak says, Annam Ishta, Vyupakrutam Ishta Gandharvadibhi Krutaka, Dehe Prinati Gandhadina, Granadini Indriyanitsa. That means food has smell, taste, etc. When food of choice is eaten, mind is in good mood by continuous uses matter in sense organs, undergoes catabolism and reduction. It has to replenish food by way of smell, taste, etc. And by the way of its Panchamahabhautik structure, replenishes and nourishes and refreshes Indriya. Next one is the Indriyas are situated under in Adhishtan. These are micro and macro. Okay, these micro centers are situated in brain. Then basic matter includes Panchamahabhut, mind, time, soul, direction. If body bears Indriya, it is living body taste, it is non-living matter. Then Indriya Pancha. Indriyas are majorly explained under the topic or concept that is Indriya Pancha. These are group. There are 5 sense organ, 5 Mahabhutagni, then 5 mechanical apparatus for perception of sense, that is Panchendriya Adhishthanani, then 5 objects, that is Panchendriyartha, 5 interpreting centers, that is Panchendriya Buddhya, are present in each individual. These 5 groups of sense 5 organs cater knowledge about their physiology and sense are named as Indriya, sense organs. 5 of them, that is Panchak. Now first group is Panchajnanendriya. These are eye, ear, nose, tongue, skin are 5 sense organs. Next group is Panchendriya Dravya. Under these Panchamahabhut are included. That means sense organs are Panchamahabhutik, and these 5 Mahabhut are Akash, Vayu, Tej, Aap, and Prithvi. The next group is Panchendriya Adhishthanani. That means there are 5 Adhishtan, namely 2 eyes, 2 ears, 2 nasal cavities, and 1 tongue and 1 skin. Adhishtan is nothing but the support. Whatever apparatus is working to gather information to send to buddhi for interpretation of subject is called adhisthana. It is mechanical instrument through which object get perceived. Further, commentator states that even if 2 eyes, ears, and nasal cavities are mentioned, it is 1 unit for each. 1 eye is representative of 2, and hence even if total number goes to 8, it should be taken as 5. The next group is Panchendriya. Panchendriyartha. The next way is Panchendriyartha. Panchendriyartha objects are stuff they perceive. Eye perceives image, hence image is an objective. Skin perceives touch, hence it is its object. This fact is applied to all 5 senses. Commentator explain it with an example of touch and sense organ of touch. Object of 5 special senses are sound, touch, image, taste, and odor. To perceive this object, biological apparatus is called ear, skin for touch sensation, eye, tongue for taste sensation, and nose for odor sensation are used. Commentator further adds that sense organs is capable of perception of only one object, for which it is mean all sense organs are basically composed of Panchamahabhut. However, one Mahabhut is predominant in each 5 of these sense organs. Hence, perception of one sense is so intense that other sense perception seems to be remote. Following references is important in these aspects. Next topic is Indriya Buddhi. 5th category, under this category, understanding or interpretation of perception is included. This perception of object or interpretation of object needs union between object and perceiving operators. It is conveyed through special senses to soul by means of mind. In fact, Indriya Buddhi, which is analyzes minute seen and unseen objects. These are all Indriya Pancha. Then there is a general route of perception of Indriya, that means Gnan Grahan Prakriya. Sense organs perceive information with the help of mind. Mind then analyzes right and wrong and then decide about the object. This is how information is received by sense organs. When soul that means Atma, special sense organs, that means Indriya, mind, that is Man, object, that is Artha, remain in contact with each other. Perception, which is without any hallucination of illusion, is knowledge called eyewitness knowledge. Togetherness of soul, mind, object, special sense organs, advocate perception, knowledge is zero with any one factor amongst four missing. That soul is present or absent can be examined by characteristic of life in individual. That mind is present or not can be examined by non-perception of object in individual with properly functioning sense organs. That sense organ is working or not can be
Hello, Dr.
examined with
Reena.
the yeah.
Hello, Dr. Reena. You are exceeding the time limit, doctor. Can you speed up your presentation?
Yeah. Next is the conclusion of today's topic, concept of Indriya. The conclusion means importance of this topic is clinical significance of knowledge of Indriya to learn can be should diagnose sound in abdomen, in joint of patient's speech, quality of voice of patient in his ear. A physician should diagnose about the color of patient, his apparent signs and symptoms, any obvious defect in any system with his eye. Physician should take judgment of normal and abnormal smells coming from patient. Physician should by touch of hand diagnosis about the patient. That means word indriya. That means the vitality of pran is important in the clinical significance because there is Charak in Vimastan said that Anthara Kujana Sandhi Sputanam Anguli Parvanam Sa Swara Visheshashchaye Chapi Kesh Chitata Roga Api Shabda. That means Commendium directs that test should be taken in any pathological matter. Physician should use his logic to come down to diagnosis. For example, if lice observed on skin pathology of body of patient should be diagnosed. If flies are sitting on body, patient's body must be bearing sweet rust. In disease, Rakta Pitta crow will not eat if blood is given to it. If Pitta is in pathological state, it is directed here that judgment of such type of needed to be taken by physician. Therefore, Indriya, that means Indriya gain utmost importance in examination of a serious patient in clinical use. Symptoms expressed by them measure span of remaining life in dying patient. Charak Samhita advises Ayurveda physician to treat curable diseases. Totally incurable diseases are left alone. This section of Commendium offers, even though this statement is apparently odd sounding, it is needed for physician to judge whether patient is worth treating. So this is the importance of Indriya in clinical significance way. Thank you so much.
Thank you, doctor. So next I invite Dr. Priyanka Pande.
Yes, ma'am.
Yes, doctor. Doctor, please share your screen and start.
Hello,
Ma'am,
Dr.
can you?
Priyanka. I will share for you, doctor.
Okay.
Doctor, please start, doctor.
Myself, Dr. Priyanka Pande, Romina department. The topic is association between kapha, avruta, udan and hypothyroidism. Next. Next, sir. Introduction. Hypothyroidism is one of the fastest rising health issues in India with prevalence rate of 10.95%. Thus, it is a great need to deal with this ever emerging disease. In Ayurveda, hypothyroidism is often taken as a rasa pradoshas vyadhi and treatment accordingly, but outcome is not as expected always. So there is need to find other condition which show similar sign and symptom as a hypothyroidism. In a modern medicine, the cause of hypothyroidism are differentiated in deficiency, insufficiency of hormone, inefficiency of gland, autoimmune disorder, cancer, etc. In a study, we will refer it with kapha, avruta, udan, vayu, vikriti with the help of classical textual references, which will be helpful in a treatment precisely. The diagnosis of hypothyroidism is based on the blood level of a thyroid hormone. Aims and objective to evaluate correlation between hypothyroidism with a kapha, avruta, udan, vayu. Second one is to understand the pathology of hypothyroidism in Ayurveda. Material and method is Ayurvedic Samhita, modern medical textbook and website. Discussion. The incidence of clinical hypothyroidism is 0.5 to 1.9% in women and less than 1% in a man. And of subclinical is 3 to 13.6 in a woman and 0.7 to 5.7% in a man. In a clinical hypothyroidism, the symptoms are more severe, and in some clinical type, the symptoms are less and sometimes may even be absent. Now, sign and symptoms of hypothyroidism. Symptoms: fatigue, feeling cold, anorexia, constipation, weight gain, hoarse voice, dyspepsia. Now, sign: dry cold skin, cool extremities, hair loss, myxoedema, delay relaxation of tendon reflexes, low pulse rate, anhidrosis. Pathophysiology: the thyroid gland produces the thyroid hormone with the help of iodine and amino acid tyrosine. Iodine in a blood stream taken up by the gland and incorporated into thyroglobulin molecules. This process is under the control of thyroid stimulating hormone, that is TSH and thyroprotein, which is secreted by pituitary. If either the iodine or TSH level not in required amount, it led to be decreased production of thyroid hormone. The hypothalamic pituitary thyroid axis play a key role in maintaining thyroid hormone level with the normal limit. Hypothalamus secrete the thyroprotein releasing hormone, which stimulate the anterior pituitary to produce thyroid stimulating hormone. Production of TSH and TRH is decreased by thyroxine by negative feedback process. Any deficiency in a TRH can lead to deficiency in TSH. This may result in a decreased production of thyroid hormone. Diagnosis: depending upon the thyroid hormone level in a blood hypothyroidism can be classified into three varieties. First one is overt hypothyroidism. Second one is a central hypothyroidism. Third one is a subclinical. When TSH is normal, T3 is normal, then is normal thyroid function. When TSH is elevated, T3, T4 low, it is overt hypothyroidism. When TSH is either normal or low, then T3, T4 is low, it called central hypothyroidism. When TSH is get elevated, T3, T4 remain normal, then it is a subclinical hypothyroidism. Ayurvedic view of hypothyroidism: among the three doshas, Vata is mainly responsible for the manifestation of disease. Vata Vyadhi manifests due to two reasons. First one is a Dhatukshay-janya Vata Vyadhi and second one is a Margavrut-janya Vata Vyadhi. Avran play a major role. Mithya Ahar Vihar lead to vitation of three doshas, mainly kapha and vata dosha. Due to excess vitation of a kapha dosha, kapha obstruct the movement of vata. Hence, this lead to state of a kapha vrutta vata. Thereby, the symptoms of kapha vrutta vata as a shaityam, shotha, gurutva, it is a result. Hence, cold intolerance is a myxoedema and heaviness of the body are seen in a hypothyroidism. Among Panchavida Vata, Udan Vata is involved in the manifestation of hypothyroidism. The sthan and function of a Udan Vata are as follow. Udan situated in the Ura region and move in the region of a Kanta, Ura, Nasika and Nabhi. When Udan Vata is vitiated, the organ residing in the Ura region are also affected.
This is the main reason why the latter stage of hypothyroidism, patients are affected with the symptoms pursuing to the heart and lung like pleural effusion, pericardial effusion, and ascites. Udanvat, when obstructed by kapha, lead to symptoms of a kapha avruta udanvata. They include vaivarnya, daubalya, aruchi, hence symptoms like pallor, hoarse voice, fatigue are seen in hypothyroidism. Samprapti ghatak is dosh, kapha and vata. Mainly is a udan vata. Dusha is a rasa dhatu and medo dhatu. Strotas is a rasavaha strotas and medavaha strotas. Strota dushti is a sanga. Vyadhi udbhav sthan is a gala and adhistan is a sarva sharir. Comparison between hypothyroidism and kapha avruta udan vata lakshanas. Hypothyroidism is a pallor. Then in the kapha avruta udan vata is vaivarnya. Hoarseness wise is comparison with the vaksvagraha, fatigue, daubalya, laziness, guru gatratva, maxoedema is a shota, weight gain in staulya, cold intolerance is shaitya, nausea is rillas, anhidrosis is asvet, body pain is angamarda, anorexia is aruchi, loss of appetite is mandagni. It is a comparison of the hypothyroidism symptoms and kapha vrutta udan vata. Conclusion, it was observed that the sign and symptom of a hypothyroidism were very much similar with the kapha vrutta udan vata. Thank you.
Thank you, Doctor.
Thank you, Doctor.
Next, I invite Dr. Anish T for the paper presentation. Dr. Anish, are you there? Hello, Dr. Anish, are you there? Okay, next I invite Dr. Arpitha for the paper presentation. Dr. Arpitha S, are you there?
Yes, sir.
Okay, Doctor, please share the screen, Doctor.
Okay.
Your screen is visible, Doctor. Please chat.
Okay. Good evening. Today, I'm going to discuss on a topic, understanding the concept of Basti in Ayurveda. Aim, understanding the concept of Basti in Ayurveda. Objectives are anatomical relations of Basti as per Ayurveda and probable similarities in contemporary science, identifying the anatomical checkpoints mentioned in Samhita during the context of Mutrotpatti. Third point is identifying the anatomical relations mentioned in Samhita while explaining the Samprapti of Mutra Vikara. In introduction, we can see that the Nirukti tells the Mutra is covered or enclosed within the Basti. That is, Basti is the place where Mutra resides. While seeing the location of Basti, it is said that the Basti is situated in the midst of Stulaguda, Mushka, Sevani, and the nadis carrying the Mutra and Shukra. We also get another too many references stating Basti is situated in the midst of Nabi, Mushka, Guda, Vankshana, and Chepa. And it is having only one opening and it is having thin skin. While explaining the Asana Prasava, they have told that Asana Prasavayam Mutra Purisha Bahulyam. Due to Asana Prasava, Mutra Purisha increases, and this reference gives us the location of Mutrashaya that is nearer to Garbhashaya. While discussing the Akruti of Basti, they have told it is shaped like Alabu, that is picture guard, and it is supported by Sira and Snayu. While explaining the Trimarma Abhihata context, they told Basti is in conical shape, that is Kundala shape, and injury to this marma leads to Kundali Rupa Vedana. And from inside, it is made up of Alpa Mamsa Shonita, and it is located at the level of Kati, and it is curved shaped like a bow. We also get another reference stating that it is present in pelvis consisting of less muscle and blood, and it is the reservoir of urine. Snayus present in Basti. Shishira Snayu is present in Basti Ante, and 20 Snayus are seen in Mushka, Medra, and Basti and Antra. Basti is included one among the 27 Snayu Marma. And here we can tell that detrusor muscle is more fibrous than muscular. While discussing the physiology of urine formation in Ayurveda, according to Sushruta Nidana, Pakvashaya Gatastasra Nadya Mutravahastu Ya. Here, Mutravaha nadis are related with Pakvashaya. Tarpayantri Sada Mutram Saritaha Sagaram Yata. Here, Tarpayanti is Vardayanti. In the commentary, we get Tarpayanti means Vardayanti, which means the quantity of Mutra increases by the Tarpana done by Mutravahi nadis, which are related to Pakvashaya. Sukshmatvan nopalabhyante mukanyasam sahasrasaha. These nadis are very minute and numerous in number, and these are considered as mukha of basti. And synonym of srotas is also mukha. And then nadibi rupanitasya mutrasyamashyantarat. Here we get the reference that even nadi is coming from amashaya antarat. In commentary, we get amashaya antaras indicates ama pakvashaya antarat. As mentioned before, basti is the only reservoir of mutra. There are sahasrashaha mukas which are carrying mutra to the basti or mukha. Here, mukha should be considered to be the part of basti when we relate this with the contemporary science. The numerous minute structure that helps in transferring urine are probably nephrons, or to be more precise, uriniferous tubules. Here, these Sahasra Sukshma Mukas shows functional similarities with the uriniferous tubules, and basti is the only the reservoir of urine, which is the function of urinary bladder too. So, the probable correlation for basti should begin from uriniferous tubules to urinary bladder. These are the other references for Nisyandana and Upasnehana explained. When we go to the applied aspects, formation of Mutrashmari, there are Sushruta Nidana, Ashmari Nidana chapter, they have explained two different sampraptis. In first, Samshodhana doesn't only mean Panchakarma Rupi Shodhana. Here, Samshodhana implies for evacuation of mala, more specifically mutra. That is, Asamshodhana Shilasya, Apatyakarinaha, Prakupitaha Shleshma, Mutra Samprukto Anupravishya, Basti Ashmari Janayati. In this samprapti, a person who doesn't micturate, even after having an urge, indulging in apatya, leads to the Prakopana of Shleshma. This Prakupita Shleshma enters the basti, mixing with mutra forms the ashmari in the basti, which means urinary calculate. In the second reference, when we see the samprapti, it is explained for individual doshas. Here, when the doshas increase, it reaches the basti mukha and settle there. That is, they take adhisthaya there. And in previous slides, we have seen that basti mukha is compared with uriniferous tubule, which is present in kidney. So these ashmaris which are formed can be compared to renal calculi. Next discussion. Here we see some of the similarities with the basti as urinary bladder. Mutra is covered within the basti. We get urine is filled within the hollow viscous reservoir. Basti is situated below the nabi and it is 1 in number. And in urinary bladder explanation also we get lies in the anterior part of pelvic cavity. Location both looks similar. And while explaining the akriti, they have said it is having only one opening and it is having thin skin placed with its face downwards. In urinary bladder also, it is a muscular reservoir of urine and it is located in the pelvic cavity, same applies. And in basti, it is supported by sira and snayu. In urinary bladder, we get it is supported by 9 true ligament and 7 false ligament. And basti, when we see the shape, it is a conical shape. Even the detrusor muscle of urinary bladder is arranged in whorls and spirals. And when we see the shape, it is Dhanuvakra and Alabu. The empty urinary bladders looks like tetrahedral in shape and filled urinary bladder looks like ovoid. And in formation of Ashmari, we have seen 2 different sampraptis. Scope for further studies. a proper anatomical and physiological understanding of direct involvement and role of intestine in urine formation is to be worked on. That is explained in Mutrashmari Nidana, involvement of Pakpashaya. So we get a score, we have to work on that. And when we see the Basti as Mula of Mutravaha Srotas and Mula of Medovaha Srotas as Vrukka, from above references as well as on exploring the aspects related to Mutra, we do not find the utility of Vrukka related with Mutra directly. If so, relating kidney as Vrukka is quite questionable. Thus, further studies are required on understanding the function of Vrukka. Conclusion: in most of the context, Basti should be considered as whole of urinary system. Like during the Samprapti also we have seen, and during physiology of urine formation also we have seen that it has to be taken from Basti Mukha to Basti, that is from uriniferous tubules to urinary bladder. Here we have to consider it as a whole urinary system, or in particular Basti is considered as urinary bladder. When we see the references or Nirukti or the definition, Basti, they have told that it is the reservoir of Mutra, or the Mutra where it resides is called Basti. So in particular, Basti can be considered as urinary bladder. According to the context, we have to take Basti as urinary system also and Basti as urinary bladder also. Thank you.
Thank you, Doctor.
Thank you, Dr. Arpitha. It was a quite descriptive presentation. So next I invite Dr. Kavya.
Yes, ma'am, I am present.
Good evening, doctor. Please start.
Your screen is visible, Doctor.
Okay, sir. Myself, Dr. Kavya GS. Today's topic of presentation is a case study on management of Kadara through thermal cauterization with special reference to core under the guidance of Dr. Rajneesh Vigiri, Dr. Ashwin Haridas, and Dr. Sahana Kamath. Introduction. Plantar corn is defined as a localized hyperkeratinosis of skin over bony projections like heads of metatarsals. In Ayurveda, Kadara is defined as a Katina kolamatra granthi which occurs due to Padakshata from Sharkara Kantaka due to Vatadi dosha prakopa along with Meda and Rakta. It passes over the adjacent nerves causing pain. If it gets infected, patient presents with severe tenderness and inability to walk. Acharya Sushruta mentioned Agni Karma for the management of Kadara. This case is treated with thermal cauterization. Causes: wearing tight-fitting shoes, injury from stones and spikes or thorns, repeated excessive weight bearing or friction over a part. Signs and symptoms: white or yellow or gray-colored deep-seated lesion, tenderness, hardened nodule. Case study: chief complaint: complaints of 2 hard masses with pain over right foot since 2 months. Associated complaint: disturbed sleep since 15 days. History of present illness: a female patient aged 58 years. Known case of ischemic heart disease. Working as a teacher was apparently normal 2 months ago. Gradually, patient developed 2 hard masses with pain over the right foot. Patient also complains of disturbed sleep since 15 days. As the severity of the complaints increased, patient got admitted at our hospital. History of past illness: known case of hypertension on medication, known case of ISD and on medication. There is no past treatment history for these complaints. Personal history: bowel once per day regular, micturition 5 to 6 times per day, clear and regular, sleep disturbed, appetite good. Examination of the patient: height 5.3, weight 65 kgs, BP 130 by 80 mm of Hg, pulse rate 76 per minute. The patient had no pallor, no ictus, no lymphadenopathy, no cyanosis, and no edema. Clubbing was present. Systemic examination: CNS RS per abdomen yielded normal findings. CVS, known case of ISD, between S1 and S2 there was a gap. Local examination of right foot, inspection, site of swellings, plantar aspect of head of first metatarsal and between 4th and 5th metatarsal. Size of the swellings: the bigger one is 2 into 2 centimeters and the smaller one on the between 4th and 5th metatarsal is 1 into 1 centimeter. Color of the swellings: yellow. Discharge absent. Redness of the surrounding area absent. On palpation, Local temperature not raised, tenderness present, consistency is hard, slip sign negative, trans illumination negative. Diagnosis, corn or kadara. Treatment, thermal cauterization followed by application of ST madhugruta. Preoperative procedure, written surgical consent, injection xylocaine 0.2 cc test dose, intradermal given prior to surgery, injection TT 0.5 ml IM given prior to surgery. Operative procedure, patient is made to lie in supine position, painting and draping done. Local anesthesia is infiltrated to the base of the corn present over first metatarsal. Edge of the corn is held with Alice forceps, thermal cauterization done along the edges, progressing up to the base for complete excision of hyperkeratinized tissue. Hemostasis is achieved. Similarly, second corn is also cauterized. ST madhugruta is applied to both the surgical wounds and dressing is done. Post-operative procedure, Triphala Guggulu 1 TAD, Gandhaka Rasayana 1 TAD, dressing after 3 days, avoid dust and wetting. This is the first image showing a plantar aspect of head of first metatarsal after cauterization, and the second image is showing the corn while excising between 4th and 5th metatarsal. Parameters taken for consideration before and after treatment. Pain was present before treatment and reduced after the treatment. Hardness was present before the treatment. Hardness is absent after the treatment. Conclusion, thermal cauterization is effective in treating kadara and or corn. Post-operative burning sensation was relieved by application of ST madhugruta. Appearance of healthy granulation tissue is seen. Pain is reduced. Patient is still under follow-up. Now we have noticed appearance of fresh healthy granulation tissue, and we are doing dressing with Jatyadi Taila. Thank you.
Thank you, Dr. Kavya. So next I invite Dr. Mrudula.
Dr. Mrudula P N, please unmute, doctor.
Please unmute.
Dr. Mrudula, can you hear me? Hello, Dr. Mrudula, can you hear me? Hello, Dr. Mrudula. We can't hear your voice, doctor.
Okay. Hello, can you hear me?
Doctor. Yes, doctor.
Yes, doctor.
Please share the screen, doctor.
Yes, sure. Just a moment.
Dr. Mrudula, you have any problem with screen sharing, doctor?
Yeah, now can you see the...
Okay, doctor. Your screen is visible, doctor. Please start.
Is the voice clear?
Yes, doctor. Clear.
Okay. Sorry for the interruption. Good evening, all. Welcome to the presentation. Topic of presentation today is critical analysis of DESHMUKH. I am Mrudula P N, first year PG scholar in BPSV ABC Critical. Beginning with the introduction, DESHMUKH is one among the parasurgical procedures. It is a Shodhana karma according to Acharya Susruta and Baburao. DESHMUKH is derived from Raktasya Mokshanam Raktasrava, where the term Rakta means colored and Mokshana means to relieve or to let out. These are the indications and contraindications of DESHMUKH. DESHMUKH Vidhi can be classified into Sashastra and Anshastra. The former one can be divided into Prachana and Siraveda, and latter into Jaloka, Alabu, and Shringa. Based on dosha, Shringa is to be used in Vedic predominance, Jaloka in Vedic predominance, and Alabu in Kapacha predominance. According to condition, it can be divided as Ekadeshastam and Pinditam in Prachana. Jaloka is to be used in Gradita and Avagada, and in Sukta, Shringa is to be used. According to patient, Jaloka is used in Parama Sugumara, Shringa and Alabu in Sugumara, and Siraveda and Prachana in Belavan. According to time of procedure, in rainy season, it is to be done when the sky is clear, in Grishma in morning, and in Hemanta in Madhyama. Moving to the properties of the instruments used for Rakta Moksha, Shringa has properties such as Ushnavidya, Madhura Rasa, Snikta Guna. Jaloka has Madhura Rasa, and Alabu has Kadu Rasa, and Yuksha and Tiksha in properties. Moving in detail, Shringa has properties such as Hasumatya. It is 18 angula in length, 12 angula in circumference, with an orifice of 3 angula, and Agra Chadra is of circumference of Sashapa. Modern equipments that can be used in place of Shringa include a suction pump, a syringe, or a breast pump. The mode of action is Vadagna property owing to the Madhura Rasa and Ushnavirya. It has action in Shula and increases local circulation and decreases the hydrostatic pressure. This is a picture depicting the Shringa. Next one is Alabu. Alabu has properties such as 12 angula in length, 18 angula in diameter, with an orifice of 3 to 4 angula. It is used for Ajushna of Rakta and Shleshma. Moving to Khadi. Khadi is used in Gulma and other raised swellings for Vilayan. The next procedure is Prachana. Prachana has synonyms such as Puttanam, Shastrapadam, etc. It is a Puvakarma in Shringa, Alabu, and Khadi. It is indicated in localized vitiation of dosha. The contraindication include Shobha, Pandu, Asha, Udara, and Garbhini. The next one is Jaloka Ajar. The term Jaloka can be split as Jala and Oga. It just means water-dwelling animals. It is indicated in Pitta Dushta Rakta Vikaras. The types include Savisha and Nirvisha. It is indicated in several diseases, and according to patient, it is used for Sugumara. Current applications of leech therapy include plastic and reconstructive surgery, reducing venous congestion, promoting microcirculation, improving the hemopoietic cell formation, promote healing, anti-inflammatory effect, and immune stability. The next one is Siddhavedhanam. Siddhavedhanam is the most important among the Rakta Moksha techniques. As a pre-preparation for Siddhavedhanam, liquid diet or Yavagu is preferred. During the procedure, one has to prepare and mark the vein, tap the area with finger, palpate to see the prominence of vein, puncture by tapping, pressing, or incising. The blood flow will stop by itself in Samyak Yoga. The quantity of blood relieved through Rakta Moksha is assessed as Prastha in Uttama Matra and Kudava in Hina Matra. Features of adequate Siddhavedha are Lakhuta, Vedana Shanti, Vyadhi Roga Prashamana, and Prasannamana. Moving to the history of bloodletting. Bloodletting is also called as phlebotomy, where phlebos means vein and tom means to cut. Bloodletting was devised as a way to correct harmful imbalances in the body. Bloodletting process removes impurities according to Hippocrates. Galen, student of Hippocrates, described how much blood is to be let out according to age, season, disease, etc. It was even recommended in the 1923 Davidsons. Moving to the next slide, the death of the tradition of bloodletting. With scientists such as Louis Pasteur showing that germs are the disease-causing agents and not humors, and medical statisticians like Louis tracking case histories collected evidence that bloodletting was not effective. All these led to the death of the tradition of Rakta Moksha. The importance of Rakta Moksha, as said in textbooks, include Siraveda Chigilsatrim, Shailatandra Pragyapta, Yeda Pranahita Samek Vasti Kaya Chigilside. The next one is Satvak Dasha, Grantaya Shoparoga, Shonida Shili, Rakta Mokshan Shilinam, Napavanti Katachana. The next one is Shidoshna Sikta Rukshadi, Upakrantesha Yekata, Samek Sadhyana Chittandi, Rakta Jansha Vivari. In Susruta Sharida, Sushruta says, Neha the Kriya Yogi, Natatha Lebanere, Chandeshu Yadhya Shandi, Yada Samek Siraveta. Next, the next slide is conclusion. If we adopt the new techniques, we can popularize Siraveta and other methods. By adopting the new technique, almost same results can be obtained. It is more safer, economic, and patient-friendly. Raktamokshana therapy is exceptionally beneficial for patients suffering from chronic skin diseases. Hopefully, Raktamokshana will be accepted as a treatment of choice in many more diseases in the years to come. Thank you.
Thank you, doctor. So next, I invite Dr. Anjal Rana. Yes, doctor, you're. Hello, Dr. Anjal.
Hanji, good evening, ma'am.
Doctor, please start.
Good evening, myself Dr. Anjal Rana. I am second year PG scholar from Government Ayurvedic College, Patiala. Today I present the topic Dincharya. Ayurveda is not merely a health science but a life science. In our Samhita, there is Ayurveda Prajna is Swastasya Swasthya Rakshanam, Atrasya Vikar Prashamnam cha. That is to maintain the good health of healthy individual, to cure the disease of the diseased person.
Hello, doctor. Your screen is not visible, doctor.
Sir.
Okay, doctor, now visible, doctor. Please continue, doctor.
Ayurveda is not merely a health science but a life science. In our Samhita, Ayurveda Prajna is Swastasya Swasthya Rakshanam Aturasya Vikar Prashamnam cha. That is to maintain the good health of healthy individual, to cure the disease of the diseased person. Now, what is health? Health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. In our Samhita, that is Susha Samhita, there is a definition of Swastpush, that is Sam Dosha, Sam Agnishta, Sam Dhatu Malkriya, San Atma Indra, Swast Itya Bidhyate. What is Dincharya? Dincharya is basically an ideal daily schedule for us, which takes into account the nature's master cycle and suggests action to follow. Dincharya includes Udan, Ushapan, Shoch, Danthavan, Anjan, Nasya, Kaval and Gandush, Dhumpan, Abhyang, Murdhatel, Vyayam, Ubatan, Snan, Vastradharan, Ratnabhushan, Ahar, Ratricharya. Udan, that is waking up. One should be wake up at Brahmurta, that is before 96 minutes from sunrise. Next is Ushapan. 1 to 2 liters of water should be drink in copper utensils. It helps to cure the disease like piles, edema, hyperacidity, constipation, etc. Chot. This should be no direction, shouldn't speak, shouldn't remain naked, cover up head, neither suppress nor initiate the urge, wash and clean the anal region, wash the hands and legs properly. Next is Danthavan, that is brushing teeth and scraping tongue. Danthavan should be twice daily, morning and before going to bed must. Toothbrush should be 12 angul pramana. Tongue cleaner should be 10 angul praman. Kashaya Katutik Madhurasa, are mentioned ras in Danthavan in Sushu Samhita, Karanj, Karveer, Ark, Malti, etc. Tongue cleaner should be made up of gold, silver, copper, brass, zinc, etc. Benefits of Danthavan are removal of phytated cough and bad odor, freshness in mouth and lightness in body, appetite increases. Anjan. It helps to expel the impurities derived from kapha. Morning and evening Anjan should be applied, never at night. Apply in lower eyelid from inner canthus to outer canthus. After applying Anjana, one should close his eyes and rotate the eyeballs for spreading of Anjana in the whole eye. Till burning sensation and lacrimation stops and eye feels comfortable. Nasya. Nasal cavity is regarded as the door to brain. 5 types of nasya mentioned in Sushil Samhita: Marsh, Pratimarsh, Avpid, Pradhaman, Shirovirechan. Out of which Pratimarsh nasya can be taken in daily routine. Age group of nasya is 8 to 80 years. Benefits are eyes, nose, ear become healthy and more powerful. Disease like stiffness of neck, headache, sinusitis, etc. can be cured. Next is Kaval and Gandush. Keeping any liquid, medicated oil or decoction in mouth. When it can be moved in all direction, it is known as Kaval. When it is not movable, then it is known as Gandush. Should be kept in mouth till sweating in forehead, secretion coming out from nose and eyes. Next is Dhumpan, medicated smoking. Cigars made up of useful medicinal plants only and immersed in ghee should be used. Firstly, it should be inhaled through mouth and then from nostrils. Alternately, all cases, smoke should be exhaled from mouth. Benefits: strengthens sense organs, makes mind stable and peaceful. Disease like foul smell, anorexia, lokcha, and goiter can be cured. Abhyang, oil massage. It is Vatnashak. If it is not possible on whole body, then should be done at least on head, ears, and legs. Makes bones and muscles strong, increase work efficiency, relieves pain, anti-aging. Mudha tel, applying oil overhead, prevents hair fall and graying, beneficial for brain, keeps the mind cool, face become beautiful and shining. Vyayam, physical exercise that is favorable to mind and increase strength and firmness of body is known as Vyayam in Ayurveda. Excessive Vyayam is detrimental to health and can cause fever, dyspnea, rhinitis, etc. Benefits are feeling of lightness in body, increased patience and ability to tolerate stress and strain, increase work efficiency, reduce obesity. Button, that is skin application. Rubbing medicated powder or paste on skin is known as Ubbutan. Kapha, Bhrajik Pith is activated. Dissolve fat, disease of skin, itching and discoloration get cured. Face, eyes become relaxed. Snan. Hot water bath in lower portion of body is beneficial. It is, however, harmful for the eyes and hair if it is poured on head. In winter season, warm water should be used and in summer, cool water should be used. First, wash hands and feet before taking bath. Don't take bath being naked. After taking bath, sponge with the towel. Always wear fresh clothes after taking bath. Don't go to bath after taking food. Benefits are mitigate sleep, tiredness, yawning, sweating, itching, thirst. Alleviates burning sensation, giddiness and sins, increase appetite. Vastra dharan. Dress should be comfortable, clean and fresh, beneficial for skin and should have a decent look. Makes up the personality of a person. Rat abhushan, gems and ornaments. Bestows purity, good fortune and satisfaction. Planetary ill effects are mollified.
Doctor, hello
like
doctor. Doctor,
Hanji,
please
ma'am.
speed up your presentation.
Okay, ma'am. Mind becomes cheerful, promotes life and provides energy. Ahar should be 6 rasayukt, nutritious, easily digestible. Half of the stomach should be filled with solid food, 1/4 with liquid, rest 1/4 should be left empty for air to ensure easy digestion. Ratricharya, don't take full meal at night. Sleep in a comfortable, smooth bed that should be high up to knee level. Go to bed within first prahar of night, that is before 10 p.m. Conclusion is Nagri Nagrasya Vratasya Rathi Yatha Swashirirasya Medhavi Kritya Yashasvi. Charak Samhita में ये reference mention है, means a wise being protects his health just like the king looks after his kingdom and the charioteer takes care of his chariot. Thank you.
Thank you, doctor. So next I invite Dr. Pooja Kumari Sahu. I invite Dr. Pooja Kumari.
Yes, Dr. Pooja here. Should I share? Am I audible?
Yes, doctor, you are audible. Share the screen.
Okay. One second, ma'am.
Okay, doctor.
Oh, 1 second, ma'am. Ma'am, I'm unable to share. Can you kindly?
Okay, doctor.
It's
Doctor,
not
please be-
supportive. It's not supportive.
It's okay, doctor. Doctor, please be there. You can present next. So next I invite Dr. Summaiyah S. Shah.
Yes, ma'am.
Doctor,
Dr. Summaiyah here.
Okay, doctor. Doctor, please share the screen.
Yeah.
It's visible, doctor. Please start.
Myself, Dr. Summaiyah, presenting on role of Papati in Grahani Roga. Coming to the introduction, Parpatikalpa of Paradiya Yoga are most significant contributory remedy to treat diseases of gastrointestinal disorders and other ailments. Purpati has high therapeutic value, potent, less toxic, and cost-effective medicine. It is not absorbed in the stomach. Instead, it is absorbed properly in the duodenum and onward. Hence, it is effective in gastrointestinal diseases. Purpati is Agnisthai Morchita Parada Banda, where Kajjal is the base material, which after exposure to heat becomes light in nature. Purpati is indicated when low dose of Basma is to be administered. Coming to Grahani, according to Acharya Shushruta, 6th Pittadara Kala situated between Amashaya and Pakvashaya is called as Grahani. According to Charaka Samhita, it is the part situated above Napi. Grahani is the seat of Agni, and anatomically, Grahani is situated above the umbilicus between Amashaya and Pakvashaya. Physiologically, it is responsible for holding indigested food for the duration of its digestion before the pitta or undigested food residue is propelled into the pakvashaya. Grahani is a disorder with the signs and symptoms of irritable bowel syndrome, malabsorption syndrome, colitis, celiac disease, spastic colon, topical flu, amoebiasis that causes diarrhea. Coming to the purpati, purpati is a thin flake-like preparation which is developed from potabandha consisting of parada, gandhaka and other drugs. Here, potabandha is a procedure where Parada is bind and stabilized. It is beneficial in Antrashota, Antravrana, and Durgandha Purisha. It strengthens intestine and regulates intestinal movements. It is also beneficial for elevating associated symptoms of Rajayakshma, Kushta, and Gulma. In chronic phases of Grahani Roga, Parpati proved to be highly beneficial along with gold, silver, copper, or iron. Coming to the reference of Rasaratna Samuchaya, Dhrita Kajjalika Mocha Patrake, Chipati Kritacha, Sapotaha Parpati Saiva, Baladya Khilarogan. Parpati is prepared in the temperature range of 120 to 140 degrees Celsius, where kajjali is melted and pressed against the heart, to get cooled immediately with the arrangement of infrastructure which gives the parpati shape. Due to its shape, it is known as parpati kalpa, and the literal origin of the word is derived from word parpat, which means papad. Coming to the types of parpati, based on kajjali as ingredient, parpati with only kajjali. For example, rasa parpati. Parpati with kajjali and other loha dhatus includes panchamrita parpati, vijaya parpati, etc. Parpati with kajjali and other vegetable drugs, for example, bola parpati. Based on gandhaka as ingredient, it is of two types, sagandha and nirgandha. Sagandha is all the above examples such as rasa parpati, panchamrita parpati, vijaya parpati, and parpati without parada and gandhaka. Examples can be given as Shweta Parpati, which is not included, which is included in Parpati due to its shape. Coming to the properties of Parpati, it is dark in color, easily breakable, glittery, flake-like appearance, preserves its potency due to keeping it in glass bottles, and it increases the luster, strength, and appetite. Coming to the effect of Parpati in Grahani Roga, the Lagu Ruksha Guna and Katutikta Rasa subsides the aggravated kapha, and the Ushnavirya and Tikshna Guna counteracts with the Vata. The Laguruksha Guna, Tikshna, and Ushnavirya removes the Srotoroda and it penetrates the minutest sotas. By the virtue of the Tikshna Guna, it enhances the function of Pitta, stimulates Jataragni, and stimulates the other Agni. Importance of cow dung in the Parpati preparation. It is the interesting feature of this Kalpana where the fresh cow dung is used, where the Gopitta and other bilious products are helpful. Parpati gets samskara by Gopitta and attains the Deepana Pachana property to regulate the biliary disorders of the human system. The importance of leaves in Parpati preparation. Different leaves used for preparation of Parpati are Kadali Patra, Kamalapatra, Arka, Nagavalli, Eranda, Kutaja. Because of the heat, the chlorophyll gets absorbed into the formulation and exerts therapeutic effect on the human system, especially on GIT. Properties of chlorophyll are, it detoxifies the liver, has antioxidant effect, anti-atherogenic effect, stimulates the enzyme activity, clears constipation and flatus, cholesterol and triglycerides, acts as natural body cleanser, rebuilds neutralizer of toxin, is natural antiseptic and antibacterial, has anti-yeast activity, anti-inflammatory activity, promotes healthy intestinal gut flora. Coming to the procedure, the Parada Shodhana and Gandhaka Shodhana are done, followed by Kajjali preparation. The Kajjali is melted and poured over the platform of the Gomaya, which is covered with the Kadali Patra and is pressed along with the Pottali to make a flat final product. Coming to the mode of action of Parpati, Parpati is prepared by Agni Samskara, and this Agni is responsible for increasing the Ushnaguna and Deepana, which in turn increases the appetite, which is responsible for intestinal ducts to open and Poshaka Rasa absorption. Agni gets locked in the Parpati Kalpana, which acts best in disorders related to Agnimadya. By elevation of vitiated Vayu, the main symptom of Ati Pravritti of Mala is resolved. Deepan and Grahi Parpati of Parpati improves the absorption of nutritive material and the proper secretion of digestive juices for improving digestion enhances absorption of nutrients and minerals. Coming to Anupana, the Anupanas are honey, ghee, milk,
takra, fried jeeraka, fried hingu, sugar, and dadima swaraka. Takra has the properties of Deepana, Pachana, and Grahe, and according to modern, takra has antibacterial effect. Coming to Matra and Prayoga, Parpati Prayoga is two types, Samanya Prayoga and Kalpa Prayoga. Samanya Prayoga, the dose of 1 to 2 ratti is given with fried jeeraka and hing. And in Kalpa Prayoga, the dose is started with 2 ratti, increased 2 ratti every day up to 10 rattis and then tapered again. In case of Samanya Prayoga, diet restriction is not compulsory, but in case of Kalpa Prayoga, diet restriction should be strictly followed. Few of the examples are Panchamrita Parpati, Pranda Parpati, Swarna Parpati, Vijaya Parpati, Loha Parpati, Gagana Parpati, and Mandura Parpati. All these are indicated in case of Grahani and related symptoms. Coming to the discussion, increase in intrinsic factor which is responsible for absorption in intestines by regulating Agni and thus efficient in causing Samprapti Vigatana of Grahani Roga. There is a study on effect of Parpati Kalpana in Grahani Roga that showed that Parpati gets integrated in the body at the level of Grahani Dara and enhances the normal functioning of Pakwasha due to its Rasayana property. Few of the other articles and journals are role of Parpati Kalpana under the influence of Shadharana Churna in Grahani Roga, randomized control parallel group trial of monotherapy with Kutaja Parpati effective in reducing the irritable bowel syndrome symptoms. Few others are study of Parpati Kalpana with special reference to Panchamrita Parpati according to different classics, anticipating effect of Parpati Kalpana in Grahani Roga, Paradiya Parpati Kalpana according to different ingredients, ratio and Bhamana Dravya, and a review of Parpati Kalpana of Rasa Parpati according to different classical. Coming to the conclusion, Parpati is usually employed for management of diseases born out of Mandagni and Pittaja-janya rogas like Grahani. Regarding the ingredients of every Parpati Kalpana, mercury and sulfur are the primary ingredients. Later on, the metals and herbs are added time to time in different preparation having special indication. One can enhance its therapeutic efficacy further with contemporary technology. It disintegrates in the body at the level of Grahani Dara Kala and enhances the normal functioning of Pakwasha due to its Rasayana property and Gamitva towards the Pittadhara Kala. Thank you.
Thank you, Doctor. So next I invite Dr. Pooja Kumari Sahu.
Yes, I'm here.
Hello, doctor. I will share for you, doctor.
Okay,
Please
sir.
start the session, doctor.
Good evening, everyone. This is Dr. Pooja Sahu, second year PG scholar from Ayurveda Mahavidyalaya Sayan, Department of Dravya Gun. My presentation for today is on the topic conceptual review on Dravya Sangraha Kal, that is time of drug collection by Ayurveda literature. Many factors are taken into consideration while when the plant is collected. The main focus of my presentation is on the Kala, that is the time of collection. Medicinal value of the plants mainly depend upon the season in which they are grown and collected. The Kala denotes the potentiating factors of inherited qualities. The research work done on plant physiology and applied botany renders scientific explanation for the classical approach. My review paper is an endeavor to put light on classical perspective of time of medicinal plant collection. According to Ayurveda, Dravya which is to be used in treatment should have the qualities of Bahugunam, Bahukalpam, Sampannam, Yogyam, Aushadam. To attain these qualities, Dravya should be collected in a specific Kala or specific Ritu, which is the Sangraha Kala of that plant or part of the plant used. The best time of collection should be determined according to the potency of the drug rather than the total vegetative yield or targeted medicinal part of plants. The information is collected from various Ayurvedic classics, modern literature, and various documented papers. Next. Dravya Sangraha Kal. Now, what is Dravya Sangraha Kal? Time of collection takes two aspects, that is season of the collection and time of the day of collection. Samba Puran gives a reference to the different colors of sun in the 6 Ritus.
These colors influence the complete flora and fauna on Earth. This could be the ancient approach of complying the wavelength of sunlight. A famous botanist says, plants have a temperature memory. They measure the product of time and temperature and can work out how cold it's been for how long. They do this by keeping track of the interactions between certain proteins, which sign that it's time to activate a key gene to break or to begin the dormancy. Now, Sangrahakal, according to various classical texts, are there. Charak, Sushrut, Rajnigantu, Bhav Prakash, Bhaishajya Ratnavali have given the Sangrahakal according to the part of plants used, that is, in which season it should be collected. Next. Acharya Sushrut has given Sangrahakal according to its Virya, that is, Shita Virya drugs should be collected in Saumya Rutu, and Ushna Virya drugs should be collected in Agneya Rutu, that is Sharad, Vasanta and Grishma. And Acharya Sharangdhar has given Dravya Sangraha, which are according to the pharmacological properties, that is, drugs which are to be used for Vaman and Virechan should be collected in Vasanta Rutu, and for other purposes should be collected in Sharad Rutu. Bhav Prakash also opines the same. Now, which part is collected in which season? The reason might be like this. In Sharad Rutu, that is post-monsoon, Kanda is collected. So the tuber, the ideal temperature for tuber collection is 5 to 30 degrees Celsius. And the main metabolites, which are in the matured form, are present in the post-monsoon season. Hence, Sharad and Hemanta would have been recommended for collection of tubers. Kshira is collected in Sharad because the youngest vessels are near the cambium in this season and the oldest are towards the exterior, yielding more latex in this period. Twak is easily separable in Sharad Rutu, hence it is collected in that Rutu. Hemanta Rutu, Sar is collected. So the nutrients in the leaves and barks are back into the branches in this time, hence Sar is to be collected in Hemanta. In Vasanta Rutu, Patra leaves serve as factories where most of the foods necessary for the tree's growth are manufactured, and the nutrients are more in this Rutu. Shakha and Sara develop a new layer of wood by growing the cambium between the inner bark and the previous growth ring, and functions like transportation of the nutrient and adding support to the tree. Pushpa is collected in Vasanta as it is the season of the physiological process. Grishma, in Grishma Rutu, Patra is collected, reason same as the Vasanta Rutu. Moola is collected to combat natural moisture evaporation from leaves in summer. Roots attain more ability to pierce down to get water and required nutrients. Varsha Rutu, Patra and Shak are collected in Varsha Rutu because chlorophyll accumulate in most higher concentration during the rainy season. Time of the day, mostly the collection should be in Pratahakal, early morning hours, because it has the highest percentage of active principles at that time. Daily circadian fluctuations in constituents of essential oils distilled from leaves shows level of monoterpenes dropped by 50% from 6 a.m. to noon, increased by 9 p.m. There are various research works on the field of the collection of drug, time of collection of drug. There is this wet and dry season effect, in which the readily available nutrients are more during the wet season. Seasonal variation research has also been made on Guduchi Sattva, where the total alkaloid content was found to be higher in Varsha and Vasanta. There are research works on lunar plantation. That is, a full moon day influences the growth of ashwagandha compared to new moon day. The percentage of oil in Vacha, Acorus calamus, it is also more in the lunar phase, and garlic cloves have high oil concentration during full moon day. Thus, moon rays have a profound effect on the cell sap within the plants, which in turn affect the transpiration, root pressure, and active principles. Discussion and conclusion. Therapeutic efficacy is presumed to depend on quality and quantity of the secondary metabolites, which in turn are influenced by the season of collection. The data analyzed in this communication highlight the importance of application of collection practices to achieve desired therapeutic effect, as herbs without good potency become useless weapon of physician as well as pharmaceutical industries. Conceptual study gives an insight about the historical review and basic facts regarding the subject. Thank you.
Thank you, Doctor.
Thank you, sir.
Next, I invite Dr. Komal Chimnaji Vavre for the paper presentation.
Present, sir.
Okay, doctor. Please share the screen, doctor. Your screen is visible, doctor. Please start.
Good evening, everyone. Myself, Dr. Komal Chimnaji Vavre, PG Scholar, second year, Department of Kriya Sharit, Government Ayurveda College, Nanded. Now coming to the vitamins. Vitamins are organic food factors which are essential for healthy and well-balanced growth of the body. Even the small amount of vitamins is sufficient for the normal functioning of the body. All vitamins are manufactured in plants. Animals can manufacture only few, that is vitamin A and vitamin D. Coming to the types of vitamins, the vitamins are of two types, that is fat soluble vitamins and water soluble vitamins. Fat soluble are vitamin A, D, E and K. Water soluble vitamins are vitamin B complex, C and P. Water soluble vitamins are found mainly in fatty foods such as animal food, butter and lard, vegetables, oils, dairy foods, liver and oily fish. Water soluble vitamins, that is vitamin B complex. First, thiamine, vitamin B1, also called as anti-neurotic factor. Properties: it is white crystalline substance, water soluble and heat liable. Daily requirement of vitamin B1 is 1.8 mg per day. Requirement increased in pregnancy, lactation, heavy muscular work and in high carbohydrate diet. Sources: vegetable sources are cereals, pulses, nuts, yeast, beets, carrots, cauliflower, pears and beans. Animal sources are eggs, liver and yeast. Functional importance: antineurotic function, essential for the synthesis of acetylcholine neurotransmitter, anti-beriberi action. Deficiency of vitamin B1 leads to beriberi. Second, riboflavin, vitamin B2. Properties: it is yellow crystalline substance, water soluble. Its daily requirement is 1.5 to 1.8 mg per day for adult. Sources are vegetable sources, whole grains and green leafy vegetables. Animal sources, milk, eggs, liver, kidney and muscles. Its functional importance is essential for the growth, for tissue oxidation, role in carbohydrate, fat and protein metabolism, maintenance of skin and oral mucosa. Its deficiency causes fissure at the corner of the mouth and ulcer on the lips, angular stomatitis, glossitis, that is inflammation of the tongue. Third is vitamin B3. It is white crystalline substance, water soluble and heat stable. Daily requirement is exactly not known. Average daily diet contains 10 mg per day. Sources are molasses, wheat bran, peas, sweet potatoes, etc. Animal sources are liver, meat, milk, and yeast. Its functional importance is vitamin B3 plays a fundamental role in the metabolism as coenzyme. Vitamin B3 required in the cell respiration, essential for the normal functioning of skin and nerves. Its deficiency leads to gastrointestinal disturbances, alopecia, and graying of hairs, hypofunction of adrenal cortex, burning feet syndrome. Then nicotinic acid. Its properties are white crystalline substance, water soluble and heat liable. Daily requirement is 12 to 18 mg per day in adult males and little less in adult females. Sources are vegetable sources, dried legumes, peas, beans, whole wheat meal and green vegetables. Animal sources, meat, fish, egg, liver, milk, and yeast. Its functional importance is prevents pellagra, essential for growth, helps in the formation of fats from carbohydrates, stimulate the central nervous system. Hypovitaminaceous of nicotinic acid is characterized by pellagra. Next, pyridoxine, that is vitamin B6. It is white crystalline substance, water soluble and heat liable. Its daily requirement is 0.3 mg per day in infants and 2 mg per day in adults. Sources are vegetable sources and animal sources. Germs of various grains and seeds, leafy vegetables. Animal sources are meat, eggs, yeast, kidney and liver, also produced synthetically. Functional importance. Antidermatitis function helps in the synthesis of fats from protein and carbohydrate. Concerned with the metabolism of central nervous system. Its deficiency causes peculiar dermatitis, reduced growth, degeneration of the nerves, reproductive failure, hypochromic microcytic anemia, weakness of muscles, convulsive seizures. Then next, folic acid. It is yellow color compound, water soluble, destroyed by light. Daily requirement not exactly known, but average 50 microgram per day for adults. Sources are vegetable sources, plants, green vegetables and cauliflower. Animal sources are liver and kidneys. Functional importance. Take part in the formation and maturation of red blood cells. Along with vitamin B12, it helps in the synthesis of nucleic acid, essential for the DNA in the nuclei of the cells. Its deficiency causes megaloblastic anemia, especially occurring during pregnancy. Pernicious anemia along with vitamin B12 deficiency. Neurological symptoms along with vitamin B12 deficiency. Gastrointestinal disorders, glossitis. Cyanocobalamin, that is vitamin B12. It is red crystalline substance, water soluble. Its daily requirement not exactly known, but average 1 microgram per day for adults. Sources absent in plants and but present in almost all animal tissues. Animal sources: liver, kidney, eggs, beef extract, milk, etc. Functional importance: essential for the formation and maturation of red blood cells, plays an important role in the synthesis of nucleic acid, increase WBC count and platelets through its action in the bone marrow, maintenance of normal health and activity of nervous system. Effects of deficiency: pernicious or megaloblastic anemia, mucosal atrophy, glossitis, loss of peripheral sensation. Next, vitamin H, that is biotin. It is water soluble, heat stable, contains sulfur. Its daily requirement is 150 to 300 microgram per day in adults. Sources present in all common articles of food, especially in yeast, egg yolk, kidney, liver, cauliflower, peas, etc. Its functional importance is acts as a coenzyme in CO2 formation for the urea formation and biosynthesis of pyrimidines and fatty acids, helps in deamination of threonine, serine, and aspartic acid. Role in purine synthesis, role in lipid synthesis in animals, prevents dermatitis in rats and dogs. Its deficiency causes peculiar dermatitis, symptoms resembling thiamine deficiency, rise of blood cholesterol. Then last, vitamin C. It is also called as ascorbic acid. It is white crystals, water soluble and
Hello,
insoluble.
Doctor, you are exceeding the time limit, Doctor. Can you speed up your presentation?
Okay, sir. During pregnancy, lactation, adolescence. Sources: vegetable sources, fresh fruits, mainly citrus fruits, amalaki, orange, lemon, tomato, pineapple, papaya, etc. Fresh vegetables. Animal sources, generally poor. The adrenal cortex contains a good amount. Cow's milk, meat, and fish contains a little amount. Its functional importance regulates oxidation, reduction potential inside the cell, role in carbohydrate metabolism, essential for proper functioning of the formative cells of various tissues. Its deficiency leads to scurvy, that is, its symptoms are weak and fragile capillary wall leading to bleeding, gums, purpuric spots, delayed wound healing, defective bone formation, defective iron absorption, anemia, fall of plasma ascorbic acid level. Thank you, sir.
Thank you, doctor. Next, I invite Dr. Girija for the paper presentation. Dr. Girija, are you there?
Yes, sir. Yes, sir. Yes, sir. I'm.
Okay, doctor. Please share the screen, doctor.
Sir. I'm audible, sir.
Yes, doctor. Your screen is also visible, doctor. Please share.
Sir. Myself, Dr. Girija. My presentation on efficacy of Agni Kumara Rasa in Grahani Roga. Introduction. In Ayurveda, Grahani dosha is one among the Mahagadas. Grahani is the main functional part of Mahasrota, situated in between Amashaya and Pakpashaya, and also known as Six Pittadara Kala. Grahani springs from Da to Graha, which suggests to catch, to hold, or to get. Grahani is the seat of Agni. It retains the Ahara and then passes into Pakpashaya. Grahani Roga can be correlated to IBS. Prevalence of IBS worldwide has been estimated as 11.2%, and in India it is 4.54 to 7.7%. Agni Kumara Rasa is one of the Karaliya Rasayana used in the management of Grahani Roga. 50 references are found in Rasa Yoga Sagar. Most of these Agni Kumara Rasa are indicated in Grahani Roga. Ingredients of Agni Kumara Rasa: Shuddha Bharada, Shuddha Gandhaka, Shuddha Vatsanabha, Shuddha Tankana, Kaparda Basma, Sunti, Maricha, Pippali, Jambira. One part each. Jambira Swarasa is quantity sufficient. Next, method of preparation. Take Shuddha Parada and Shuddha Gandhaka, prepare Kajali, and then Shuddha Vatsanabha, Shuddha Tankana, Kaparda Basma, and Trikatu Churna. Add to Kajali and give Bhavana with Jambira Swarasa for 7 days. Properties of Agni Kumara Rasa: Shuddha Bharada, Shadrasa, Rasas, Snigdha Guruguna, Ushna Virya, Madhura Vipaka, and Yogavahi Karma. Shuddha Gandhaka, Madhura Rasa, Lagu, Ushna, Tikshna Guna, Ushna Virya, Madhura Vipaka, Deepana, and Grahi Karma. Shuddha Vatsanabha, Katu Tikta Kashaya Rasa, Saraguna, Ushna Virya, Madhura Vipaka, Deepana, Pachana, and Agni Karaka Karma. Kaparda Basma, Katu Tikta Rasa, Guru Ushna Guna, Ushna Virya, Deepana, and Vrishya Karma. Shunti, Katu Rasa, Guru Ruksha Tikshna Guna, Madhura Vipaka, Deepana, and Shulahara. Maricha, Katu Tikta Rasa, Lagu Ruksha Tikshna Guna, Ushna Virya, Katu Vipaka, Deepana, and Rucha Karma. Pippali, Katu Rasa, Lagu Tikshna Guna, Madhura Vipaka, and Deepani, and Shulahara. Indication: Sarva Grahani Roga, Matra 1 Valla, Anupana, Maricha, and Gritha, Patya, Takra, and Odana for 3 months. Mode of action of Agni Kumara Rasa. Because of its Lagu Ruksha Guna Katu Tikta Rasa, it subsides the aggravated kapha. By virtue of its Tikshna Guna, it enhances the function of Pitta, stimulates the Jataragni and also other Agnis. Due to its Lagu Ruksha Tikshna Guna, Ushna Virya, it removes Shrotodara as it penetrates minute Shrotas. Drugs like Kajali, Shuddha Vatsanabha, Shuddha Tankana, Maricha, and Trikatu are having Deepana, Pachana, Grahi, and Yogavai action and are directly indicated in Grahani Roga. So Agni Kumara Rasa regulates Jataragni and functions of Grahani and ultimately cures Grahani Rogas. A discussion: in this reference, Agni Kumara Rasa is indicated in Sarva Grahani Roga. The symptoms of Grahani Roga are Trishna, Alasya, Vidaha, Antardaha, Mandagni. Ingredients of Agni Kumara Rasa mainly have Deepana, Pachana and Agni Vardhaka properties. Kajal here acts as Yoga Vahi. Shuddha Vatsanaba acts as Vyavahi, Vikasi, Klera, Shoshakara, Amapachaka and Grahi help in Atisara. Tankana is having Kshariya Agnikaraka Guna in help in Lekana of Kapha Kleda and in Amapachaka. Kapardika Basma is Ushna and Deepaka does action of Vatanuloma and thus used in Grahani Roga. Conclusion. In Grahani Roga, mainly there is a vitiation of Agni. Usually Mandagni is seen. Agni Kumara Rasa have very good effect on Grahani because of Katu, Tikta, Kshariya Rasa, Lagu, Ushna, Tikshna Guna, which acts as Yogavai, Agni Deepaka and Amapachaka. Thank you.
Thank you, Dr. Girija. Next, I invite Dr. Pallavi KB for the paper presentation. Dr. Pallavi.
Hello, sir. Am I audible?
Audible, doctor. Please share the screen, doctor.
I think my slides are visible.
Yes, doctor. Visible, doctor. Please start.
Okay. Good evening, everyone. Myself, Dr. Pallavi, PG Scholar. Today, I'm going to present about the topic, a conceptual review on Kankayanavati and its different references under the guidance of Dr. Vinay Kumar R. Kadibagil. I'm from the Department of Rasashastra and Vaishishya Kalpana from SDM College of Ayurveda and Hospital, Hassan, Karnataka. First, we will see the references of Kankayanavati in different contexts. In Bhaishajya Ratnavali, under Gulma Rogadikara, Kankayana Gutika is mentioned. In Ayurveda Sara Sangraha, Sharangadara Samhita, Ayurveda Sara Sangraha, under the name Kankayanavati, they have mentioned. In Sahasra Yoga, they have mentioned as Kankayanam Gulikam. This is the Kankayanavati reference in Vaishajya Ratnavali. We'll see the method of preparation. The ingredients are Shati, Pushkaramula, Danti, Chitraka, Adaki, Shrungavera, Vacha, Trivrut. These should be taken 1 pala each. Hingu should be taken 3 parts. Yavakshara and Amlavetasa should be taken 2 parts. And Yavani, Ajaji, Maricha, Dhanyaka should be taken 1 karsha, that is 12 gram. And Upakunchika and Ajamoda, these should be taken 23 gram each, that is almost Ardapala. These should be done bhavana by using the Matulunga Swarasa. The indication, it can be indicated in many other diseases like Gulma, Arsha, Hridroga, Krimi. The main indication is for Gulma, different types of Gulma with different Anupana. Kankayanavati given with Gomutra, it gives the Kaphaja Gulma. Kankayanavati given with Kshira, it gives the Pittaja Gulma. It can be given for Vata Gulma along with Anupana, Madhya and Amla. Triphala Kashaya is used as Anupana and Gomutra for Sannipataja Gulma. For Raktaja Gulma, Ushtra Kshira has to be used as a Anupana. This is the Kankayanavati reference of Sharangadara Samhita. This is almost similar to Vaishajya Ratnavali reference, but the ingredient Jiraka, Girikarnika, Vidanga, Dadima, Shiva, that is Haritaki. These are extra ingredients. And Yavani, Jiraka, Dhaneka, Maricha, Aparajita, Ajamoda, Upakunchi, these should be taken 4 shana. Hingu should be taken 6 shana. Dvikshara, that is Yavakshara and Sarjakshara, and Panchalavana, Trivrut, these should be taken 8 shana. Danti, Shati, Pushkaramula, Vidanga, Dadima, Haritaki, Chitraka, Amlavetasa, Shunti. These should be taken 16 shana. Sharangadara mentioned Bijapura Rasa as a Bhavana Dravya in Kankayanavati. It is indicated for Gulma, Hridroga, Krimi. For Gulma, different Anupanas are mentioned depending on its dosha. Madhya Amla is used for Vataja Gulma as Anupana. Kshira is used in Pittaja Gulma. Gomutra is used in Kaphaja Gulma. In Vaishajya Ratnavali, for Sannipataja Gulma, they have mentioned different. Here they have mentioned Dashamula Kashaya as Anupana for Sannipataja Gulma. Ushtra Kshira is mentioned as Anupana for Rakta Gulma. We'll see the Ayurveda Sarasangraha reference of Kankayanavatti. Haritaki, it's 20 tola. Pippali 4 tola. Maricha 4 tola. Jiraka 4 tola. Pippali Mula is 8 tola. Chavya 12 tola. Chitraka 16 tola. Shunti is 20 tola. Shuddha Bhallataka is 32 tola. Suranakanda is 64 tola. Evakshara is 8 tola. These should be added with 2 parts of Guda. And by using the method either Kuttana or Paka, we have to prepare the vati. It should be given 2 to 4 tablets per day in the dose of BD. Along with the Anupana Takra, this Kankayana vati is used in Arsha, mainly Shushka Arsha and Ardra Arsha. It also cures the Upadravas of Arsha like Agni Mandya, Pandu, and also Nidana for Arsha like Udarashula, Koshtabhaddhata. We'll see the Sahasra Yoga reference of Kankayana Gulika. This reference almost similar to the Ayurveda Sarasangraha reference. Here they have mentioned Patheya, that means Haritaki, 5 pala, Maricha Jiraka, 1 pala each. From Pippali to Nagara, we have to increase the dose, like Pippali, Mula, Chavya, Chitraka, Nagara. It should be taken in 2 pala, 3 pala, 4 pala, 5 pala, 6 pala respectively. Then Evakshara should be taken 2 pala, Bhallataka should be taken 8 pala, Suranakanda should be taken 8 pala. These should be mixed with the Guda 40 pala, either Kuttana or Paka method. We have to prepare the vati. The dose should be 1 to 2 tablets per day. Anupana is always Takra. Indication, it can be used in 6 types of arshas. Also, they have mentioned that it is the better choice for patients who are having the fear of Kshara and Shastra and Agni Karma. These are the products. This is formulated depending upon its indications. Like for Arsha, Vaidyanath, Maharshi Ayurveda, and Ashtanga herbals. These products should be choose. For Gulma, Vaidyanath Dabur product, these can be chosen. And we'll see the differences and similarities in these references. The number of ingredients mentioned in Vaisheshwara Ratnavali are 17. In Sharangadhara Samhita, it's 20. Ayurveda Sarasangraha and Sahasra Yoga, they have mentioned 12 ingredients. The main indication, Vaisheshwara Ratnavali and Sharangadhara, they have mentioned it for Gulma. Ayurveda Sarasangraha and Sahasra Yoga, they have indicated it for Arsha. The method of preparation, it's Bhavana method. In Vaisheshwara Ratnavali and Sharangadhara, it almost goes for Kuttana method in Ayurveda Sarasangraha and Sahasra Yoga. Bhavana Dravya used in Vaisheshwara Ratnavali is Matulunga Sarasa. Sharangadhara mentioned it as Bijapura Sarasa. The marketed product, Vaisheshwara Ratnavali, Vaidyanath, Kankayana Betty. Sharangadhara Jandu product. Ayurveda Sarasangraha, example is Ashtanga herbals. Sahasra Yoga, they have Vaidyanath has prepared the articles related to Kankayanavati are clinical study of Kankayanavati in the management of Harshas. It is published in International Journal of Ayurvedic Medicine. They have chosen 40 patients of with inclusion criteria. They have given 2 tablets in OD dose along with the Takras Anupana for 21 days, and they have found the relief of symptoms after 21 days using Kankayanavati. And also the efficacy of Abhayarishta in the management of Arshas. And one more article, standardization of Kankayanavati and Ayurvedic polyherbal formulations. It is published in International Journal of Pharmacy and Life Science. They have analyzed the TLC and HPTLC using ferulin and plumbazine. We'll see the discussion. Ingredients present in Kankayanavati of all the references having Lagu Ushna Tishna property. So Kankayanavati acts as Mandagni Pradipana, which relieves the Sangrahi. Also, Mandagni is a main cause factor for almost all the disorders, includes Arshas and Gulma. It reduces the Mandagni, which directly affects these diseases. Also, it is taken with a different Anupana, which aids bioavailability and site of action. We'll see the last part of the presentation, conclusion. Kankayanavati is a clinical preparation. References are found in different authentic texts of Vaisheshya Kalpana. Sharangadhara Samhita reference of Kankayanavati is having the Jiraka, Girikarnika, Vidanga, Dadima, Shiva as additional ingredients with Vaisheshya Ratnavali reference. Sahasra Yoga mentioned the pramanas of ingredients in Pala, and Ayurveda Sarasangraha mentioned it as Tula, which is mainly formulated to treat either Arsha or Gulma Roga with different Anupana. The marketed samples are available based on the indications. Thank you.
Thank you, doctor.
Thank you, doctor. Thank you for this excellent presentation. So next I invite Dr. Santosh. So next I invite Dr. Santosh Kumar R. Mishra.
Hello.
Hello, doctor.
Yes,
Hello.
doctor, you are
audible, doctor.
I'm audible, right? Can you see the screen? Hello.
Hello, doctor.
Please state,
Hello.
doctor.
Can you see the screen?
No, doctor. Please share, doctor. Please, once again, please share, doctor.
Just a second. Can you see the screen now?
Yes, doctor. Now visible, doctor.
Okay.
Please chat, doctor.
Just a second. Just a second, sir.
Okay, doctor.
Yeah, can you see the screen now?
Yes, doctor. Visible, doctor. Please chat.
Hello, everyone. My name is Dr. Santosh Mishra. I'm a PG final year from Rasa Shastra and Vaishya Kalpana Department, Sai Ayurved Mahavidyalaya, Mumbai, under the guidance of Dr. G.R. Asore and Dr. Sachin Seth. My topic for today's session is critical study of Bhavna in Ayurveda. So Bhavna can be defined as a procedure in which the powder drugs are mixed with some specific liquids and are dried. I want to talk about the modern and the Ayurvedic aspect of Bhavna. How does it work and what are the effects of Bhavna on the Ayurvedic formulations? Okay, so everything has to undergo a change. It is the only unchangeable fact, and everything in this universe is in a continuous process of change. The change is happening continuously and naturally in the any Panchabhatik substance are due to the Agni, Mahabhut present in it. When this transformation is performed in a proper manner under controlled condition to get the expected result, it is termed as sanskara. In present days of globalization, people are curious to find out the basic reasons for transformation. Bhavna is one of the type of sanskara responsible for transformation. So, according to modern concept, the pharmaceutical process in which the metallic and mineral as well as herbal powders are subjected to mardan with liquid media, that is Quath and Surat, etc., till complete absorption of liquid by powder is known as Bhavna. Bhavna is basically done in Khalva Yantra, that is pestle and mortar. The mortar is a bluish or blackish, smooth, heavy, and strong stone which is used as a khalv or mortar. The mortar's dimensions are 24 by 4 by 16. The most ideal and used it is most ideal and used for various verifying procedures. The length of the pestle should be 12 inches. There are different types of khalvas, that is Ardha Chandrakal khalva, Vartul khalva, or Tapta khalva. In modern pharmacies, we use end-runner mill. End-runner mill is a modified form of pestle and mortar. It consists of mortar made of steel or granite. The dumbbell shape heavy pestle is mounted eccentrically in the mortar through the hinge joint. The mortar is rotated by a motor. The pestle rotates itself by friction. The materials is crushed and rubbed between the pestle and the rotating mortar. At the end of the grinding gear, pestle is raised to facilitate emptying and cleansing of the mortar. The procedure of Bhavna. Bhavna is also explained as a procedure of soaking the churnas with liquid overnight and triturate in daytime in the presence of sunlight. The Bhavna of a substance with swaras or kashaya helps in potentiating the substance which shows desired results in reduced dosage. Subhavit Lakshan of the Bhavnas. The substance after Bhavna will be able to roll between the fingers without being sticky. There will not be any cracks produced on the outer surface when roll paste is pressed in between the fingers. These features are suggestive of Subhavit Lakshan. If the paste is sticky, watery, or produces cracks on pressing in between the fingers, it indicates that the Bhavna is to be continued. Time duration of Bhavna. The authoritative books of Ayurveda do not advocate Bhavna in rainy season, whereas winter and summer are suitable. This may be probably because in the presence of moisture in the atmosphere during rainy season. If the duration of Bhavna is not specified, it can be continued for 7 days. The duration of Bhavna in days and hours. In Agnikumar Ras, Bhavna of Chitrakwat is given for 1 yam. Mukta Panchamrit Ras, Ikshuswaras Bhavna is given for 2 yam. Raj Rajeshwar Ras, Bhringraj Swaras Bhavna is given for 1 day, and the other formulations likewise. There are different number of the bhavna can be classified according to the number of bhavnas given in any kalpa. For example, in Ichhabediras, Arpitra Swaras bhavna is one bhavna of Arpitra Swaras is given. In Kafketuras, 3 bhavnas of Adrak Swaras is given. In Induvati, 4 bhavnas of Kakmachi Swaras or Shatauri Swaras is given. In Dhatri Loh, in the preparation of Dhatri Loh, Gudichi Swaras bhavna is given 7 times. The bhavna can also be classified according to the types of liquid media used. For example, in Vasant Kusumakar Ras, Godugdh bhavna is used. Panchalavan Churna, Gogrit bhavna is used. Vasant Malini Ras, Navnit bhavna is used. And Rasanjanadi Vati, Gomai liquid is used. Bilwadi Gutika, Ajamutri is used. Mechanism of bhavna. By the process of bhavna, the bhavna dravya loses the molecular cohesiveness and breaks into fine particles. This is because of rubbing action and the pressure applied during the process. The continuous movement of the pestle on hard surface also helps in adding the pressure on the substance. Bhavna has a lot of significance. Bhavya dravya will be neutralized. The neutralization of toxic effects of the bhavya dravya will take place. Bhavna makes the drug easily digestible and assimilable. Completion of bhavna results in smoothness of the drugs, leading to non-irritability. Metals and minerals are processed with the help of bhavnas. The addition of swaras kashaya water helps in easy grinding and of the hard drugs, especially the metals and the minerals. There is also a significant role of bhavna in shodhan. Shodhan is a process of removal or destruction of impurities of raw materials. It is hypothetically believed that bhavna dravya acts as antagonist to the bhavya dravya, therefore destroying or neutralizing the toxic properties of the raw materials. Further, there will be addition of organic compounds to the mineral in the process, leading to its potentiation. This phenomena helps in removing the soluble impurities and addition of useful material to the drug. For example, in Ingul Shodhan, Adrak Swaras bhavna is given 7 times. There is also an important role of bhavna in Maran process. Maran is a process of incineration of mineral, thereby making the final product bioavailable. The organic residue of bhavya dravya acts as a catalyst for the process of Maran, and there will be addition of a few trace elements to from the herbal juice. It is hypothetically opined that sodium silicate present in abrak imparts some luster to it. Most probably by repeated levitation before put to process, a part of it will be converted into sodium sulfate, which helps in the making silicate into soluble form. For example, in abrak maran, bhavna dravya with 64 dravya 17 times each. There is also a role of bhavna in amrutikaran. The Ushna Tikshna guna of bhasma obtained after the process of maran is further reduced by bhavna process as it infuses active principle of bhavna dravya to it. This increases the bioavailability of bhasmas and makes it more suitable for internal use. For example, in Tamra Amritikaran bhavna dravya of Nimbu Suras is given. Lohitikaran also has a certain bhavna also is very important in Lohitikaran. Lohitikaran is a process of giving color to the bhasmas. For Lohitikaran, the coloring agents augmented to the bhasmas with the help of bhavna. For example, usage of Rakta Varga Dravya Kashai like Manjistha imparts brick color to the abrak bhasma. In abrak lohitikaran bhavna with nagbala, swaras, vata dugdha, vata mula, haridra, and manjista and mustar. The bhavna also has an important role in sattva patan. Extraction of an element from the mineral is termed as sattva patan. In this process, bhavna acts as destructor of the bondage between the cations and the anions. Example: abrak sattva patan bhavna with musli, swaras is given. Role of bhavna in other formulations. The bhavna also has an important role in potali, kupi, pakwa, and kharali rasayan. Even though bhavna has no direct role to play.
Hello, doctor.
Yeah.
Doctor, you're exceeding the time limit, doctor. Can you speed up your presentation?
Yes, sure.
Okay.
So the conclusion, essentially, it is a sanskar which alters the original property of the raw materials and induces new properties to the main drugs through various liquids, which acts as catalyst to direct the alchemical transformation of the original ingredients. It leads to possible formation of organometallic compounds and converts heterogeneous form into homogeneous form, macro to micro form, rough to smooth form of drugs. This process of impregnation helps in reducing the particle size of the drugs, thus increasing their capacity for absorption into the system. Thank you so much for your patience.
Thank you, doctor.
Thank you, doctor. So next I invite
Dr. Prajna Hegde for the paper presentation. Dr. Prajna.
Hello.
Hello, doctor. Please share the screen, doctor.
Am I audible?
Audible, doctor.
Yes,
Your screen is visible, doctor. Please start.
Okay. Good evening, everyone. Myself, Dr. Hegde from Department of Rasashastra and Vaishajya Kalpana, Taranath Government Ayurvedic Medical College, Ballari. Today, I am going to present on the topic Mahavata Vidvamsana Rasa. In Ayurveda, we have 4 Chikitsa Chatushpadas. Among that, Bheshaja is a very important one. So, without Bheshaja, we can't do the treatment. So coming to the introduction, Rasashastra and Vaishajya Kalpana is one such glorified subject where every good bit of work done opens way for something still better. Yet Rasashastra remains vast with many formulations hidden and unexplored in it. Mahavata Vidvamsana Rasa is one such formulation with perfect blend of herbal and mineral compounds. References of Mahavata Vidvamsana Rasa in the classics. The original reference is from Rasachandamshu Vatavyadhi Chikitsa Adhyaya and Rasatantra Sarava Siddha Prayoga Sangraha. There is another formulation with the name Vata Vidvamsana Rasa in Vatavyadhi Chikitsa of Yoga Ratnakara with the same ingredients. So coming to the ingredients of the Mahavata Vidvamsana Rasa, the Kashtoshadis in the formulation are Pippali, Trikatu and Shuddhavatsanaba. The Rasaushadis are Shuddha Parada, Shuddha Gandhaka, Nagabhasma, Vangabhasma, Lauhabhasma, Tamrabhasma, Aprakabhasma and Tankana. There are 10 Bhavana Dravyas for the formulation. They are Vyosha Kashaya, Vara Kashaya, Chitrakamula Kashaya, Bhrangaraja Swarasa, Kushta, Nirgunde Swarasa, Argadukta, Dhatri Kashaya, Ardraka Swarasa and Nimbu Swarasa. Coming to method of preparation of the Mahavata Vidvamsana Rasa. First, the mana of the ingredients. Shuddha Vatsanabha should be the 4.5 parts and other ingredients are taken in 1 part. So all the ingredients except Shuddha Vatsanabha mentioned in mentioned quantity are homogeneously mixed for 1 yama. Later, for this mixture, Shuddha Vatsanabha is added and Mardana is done. Then Bhavana is given with mentioned Bhavana Dravyas for 3 times with each of them. Then Vati of 2 Gunja Pramana is prepared and stored properly. Falashruti of Mahavata Vidvamsana Rasa, as mentioned in the shloka, is Vatavyadhi, Shula, Mahashlishma Roga, Grahani, Sanipata Roga, Mudhavata, Gutika, Sutika Roga. Coming to the dose, 2 Gunja Pramana in divided dose forms, in divided dosage can be given. Next, coming to the Gunakarma of each Dravya, Kashtaushadis, Shunti, Marisha, Pippali in combined, they mainly act as Pachana, Deepana and Rochana properties, helps in Amapachana. Rasaushadis, Kajali is having Yogavahi properties, Nagabhasma, Vangabhasma, Lauhabhasma, Tamrabhasma and Abrakabhasma and all other Rasaushadis are mainly having Deepana properties, Rasayana, Balya and Vrishya properties. Coming to Bhavana Dravyas, all these Bhavana Dravyas are Vata Kapahara Dravyas. Coming to discussion, almost all the ingredients in this formulation mainly act as Vata Kapahara, which helps in correcting deep-rooted morbid Vata dosha and in turn relieves the symptoms caused by it. Kajali, due to its Yogavahitva, help in quick action of the yoga. All the Rasabhasmas are having Rasayana Balya action, which nourishes the depleted dhatus caused by Vata Vriddhi. Kashtaushadhi are mainly having Deepana Pachana action, thereby doing the Amapachana. Bhavana Dravyas used in this formulation also have their Vata Kapahara effect on the whole yoga, enhancing its property in relieving Vata Vyadhis. Hence, Mahavata Vidvamsana Rasa is considered as an effective medicine to alleviate the pain, inflammation, etc. symptoms in chronic musculoskeletal and neurological and also chronic GI disorders. Thank you.
Thank you, doctor. So next I invite Dr. Pooja. I invite Dr. Pooja PK. Yes, doctor, you're audible. Please share the screen.
Ma'am, can you please share the screen?
Just a second, doctor. Dr.
That
Sabale.
PPT I have sent you, no, ma'am. That one.
Okay, doctor. Please wait.
Okay, ma'am.
Okay, doctor. I will share for you, doctor.
Okay, sir. Thank you, sir.
Doctor, please start the session, doctor.
Okay, sir. Good evening, everyone. My name is Dr. Pooja PK, first year PG scholar, Department of Panchakarma, guided by Dr. Mrudula P Pooja sir, Professor, Sri Dharmasthala Manjunatheshwara College of Ayurveda and Hospital, Hassan. Today I am going to present a case report on combined effect of Erandamoola Ksharabasti and Agni Chikitsa Lepa in the management of inflammatory arthritis. Next, sir. Next slide. Content. No, sir. Second slide. Okay. And the presentation contains description of the patient, complaint, history of present illness, findings, examination, diagnosis, treatment plan, materials and methods, outcome, discussion, lastly conclusion and acknowledgement. Description of the patient goes like this. The female patient whose age is 21 years, name XYZ, nationality is Indian, from the Karnataka state, Hassan district, who is studying as a student, came to our hospital. Next slide. Complaints of pain, swelling over the elbow since 6 months, pain and restricted movement in left wrist joint, morning stiffness, unable to flex the right elbow, and the aggravating factors like she is feel more pain during the early morning and during the cold climatic conditions. History of present illness. Patient was apparently normal 6 months back. She gradually developed pain, stiffness, swelling over right elbow and left wrist joint. Since 1 month, she was unable to flex the right elbow. And the findings goes like rheumatic factor was positive. On examination, while inspection, swelling was present over the right elbow and left wrist joint. Pain on flexion was positive over right elbow. On palpation, tenderness was present and raise in temperature was present. Finally, it is diagnosed as inflammatory arthritis. Treatment plan goes like this. Based on above history, clinical examination, investigations, patient was diagnosed as inflammatory arthritis. Hence planned for Sarvanga Udvartana and Dhanyamla Parisheka, Churna Basti as a Deepana Pachana Basti. There we have taken Ingvastaka Churna 20 grams, Rasna Saptaka Kashaya 60 ml, Dashamulakwata 100 ml, which is carried for 2 days. Agni Chikitsa Lepa externally over bilateral upper limb, which was kept for 30 to 40 minutes for a period of 7 days. And Erandamoola Ksharabasti was planned in the pattern of Yoga Basti. Materials and methods. For the Agni Chikitsa Lepa, we require Lashmana 10 buds, Lavanga 10 grams, Maricha 10 grams, Sarshapa 5 grams, Haridra 5 grams, and Agnimantha, leaves of Agnimantha, Tulsi and Nirgundi. Each wet drugs is taken in equal quantity. Quantity varies according to the part affected. For Erandamoola Ksharabasti, for Anuvasana Basti, we have taken Panchatiktaka Gugulugruta 80 ml, which was given in the afternoon time. And for Niruha Basti, Makshika is taken in 80 ml, Lavana 10 grams, Sneha is same, that is Panchatiktaka Gugulugruta 80 ml. Kalka we have taken Rasna, Devadaru, Guduchi 10 grams each, that is totally 30 grams. Kwata, Erandamoola Kwata 350 ml. Avapa we have selected Amrutasara 60 ml. The outcomes like before and after, the swelling was present before the treatment, which was absent after the treatment. Tenderness is also present before the treatment and absent after the treatment. But stiffness reduced by 50%. Raise in temperature is also absent after the treatment. Pain on flexion was positive before the treatment, that is range of movements increased after the treatment, which will be seen in the next slide. That is in the form of pictures. Next slide, sir. Next. In this, we can see that the range of movements increased. Coming to discussion part. As Amavata is an Abhishyanda Pradhana Vyadhi, adopting any Snigdha modality of treatment will cause complications. Hence, Rukshana is to be done prior to any Snigdha Chikitsa. Udvartana and Dhanyamla Parisheka are one among the Rukshana Chikitsa, where Udvartana has kapha Medohara action and also it does Agni Deepana, thereby reduces Gauravata in the Sharira. Dhanyamla Parisheka is a method of Ruksha inducing Sweda. Ushnavirya of Dhanyamla possesses antagonistic property to that of both Vata and Kapha dosha, thereby resulting Shula Prashamana, Shita Prashamana, and reduces the symptoms of Amavata. The Churna Basti that we have taken is also a Ruksha Basti, and the ingredients used here are having Ushna Tikshna Gunas, Deepana Pachana, Vata Kafahara, and Shula Shotahara properties, which may also help in attaining Agni Deepana, Lagutta, Nirama Lakshana, and Chulahara action. Next slide. Agni Chikitsa Lepa. In Amavata, one should plan the treatment which pacifies Vata and does Pachana of the Ama in local as well as in systemic level, considering the strength of the patient. Hence, with the other treatment modalities, Agni Chikitsa Lepa with the drugs possessing Ushna, Tikshna, and Ruksha properties does the reduction of Ama and Vata without hampering the Bala of the patient. The drugs used for this process are having Vedana Stapaka, Shotahara, and Kafavatahara properties, which may relieve the cardinal symptoms of Amavata, that is, joint inflammation, tenderness, stiffness, by Samprapti Vigatana due to their direct action at the Sandhi. Here we have taken Erindamula Kshara Basti. As there is involvement of Kapha dosha with Vata, Basti is selected as a line of treatment. The Erindamula Kshara Basti having Ushna, Tikshna, Kafavatahara property, by combating Vata dosha and Ama, it leads to Samprapti Vigatana of Amavata, and hence significant results were achieved in all cardinal symptoms. Coming to conclusion, thus it can be clearly seen that the combined effect of Agni Chikitsa Lepa and Erindamula Kshara Basti holds a promising result in the management of inflammatory arthritis, thereby reducing the clinical signs and symptoms and increase the range of movement. Due to the limitation in the duration of the trial, there is a need to conduct further study in this regard for longer duration to improve the preliminary study. Lastly, I would like to thank Dr. Lohit B.A., Associate Professor and HOD, Department of Panchakarma, Dr. Sitaramu M.S., Assistant Professor, Department of Panchakarma, Dr. Shamim Manu, Assistant Professor, Department of Panchakarma, Dr. Ashwini Kumar M., Professor, Department of Panchakarma, Sri Dharmasthala Manjunatheshwara College and Hospital, Hassan. Thank you, one and all.
Thank you, Doctor.
Thank you, Doctor.
Next, I invite
So-
Dr. Pallavi KB for the poster presentation. Dr. Pallavi, are you there?
Yes, sir, I'm here.
Okay, Doctor. Please share the screen, Doctor.
Okay.
Your screen is
Good
visible, Doctor. Please start.
Visible now. Okay. Good afternoon again. Today my poster presentation topic is conceptual review of Kshira Shatpalagrita with its references. The Kshira Shatpalagrita has two different references. One is with Saindhava Lavana, one is with Yavakshara. The name Kshira Shatpalagrita because it is one of the Sneha Kalpana using Grita, and the Dravadravya used here is Kshira. And Shatpala, it means the Kalkadravya contains 6 ingredients: Pippali, Pippali Mula, Chavya, Chitraka, Nagara. These are the Panchakola. Along with this Panchakola, some authors said to add Saindhava Lavana as a Kalkadravya. The authors like Chakradatta in Sushruta Samhita, Vangasena, Vrindamadava, Brihat Nigantu, Ratnakara, Sharangadhara Samhita. In these contexts, you will see the reference of Kshira Shatpalagrita having Saindhava Lavana as one of the ingredient. And this Kshira Shatpalagrita is mainly indicated in Jwara, Udara and Agnimandya Vikaras. Like where the Agni Deepana action is needed, in that conditions, Saindhava Lavana Yukta Kshira Shatpalagrita is mentioned. And one more reference with Yavakshara as a Kalkadravya along with Panchakola. That is in Bhaishaja Ratnavali, Chakradatta, one more reference. In Charaka Samhita, in Ashtanga Hridaya, Ashtanga Sangraha, in Vangasena, also in Vrindamadava, Gada Nigraha. Here, along with the Yavakshara, we can see the Sroto Shodhana action. So, the diseases like Raja Yakshma, Gulma, these are the diseases which needs Sroto Shodhana action, so that Yavakshara can be used. And the conclusion is, 1 minute. Kshira Shatpalagrita, which is a formulation which is mentioned in different texts and quoted as Kshira Shatpalagrita or Shatpalagrita or Shadangagrita. In these many names, it is mentioned. It's having either Yavakshara or Saindhava Lavana as one of the Kalka Dravya, along with the Panchakola, and Grita as a Sneha Dravya and Kshira as Dravadravya. Depending on its ingredients, it exhibits different action, like Agni Deepana action or Sruta Shodhana action. Depending on its action, it is indicated in different conditions like Jwara, Udara, Agni Mandya, or Raja Yakshma Gulma. Thank you.
Thank you, Doctor. Next, I invite Dr. Priyanka Rajendra Chaudhary for the paper presentation. Dr. Priyanka,
Yes.
are you there?
Yes, sir. Am I audible, sir?
Audible, Doctor. Please share the screen, Doctor.
Yes, sir. Is my screen visible, sir?
No, Doctor, not visible, Doctor.
Okay.
Hello, Dr. Priyanka. Hello, Dr. Priyanka. Can you hear me? Hello, Dr. Priyanka. Can you hear me? Okay, next I invite Dr. Priya Bilkhade for the poster presentation.
Hello, sir.
Hello,
I'm
Dr.
Dr.
Priyanka.
Priyanka. Can you
Okay.
please share screen, sir?
Okay, Doctor. One sec, Doctor. Dr. Priyanka, please start, Doctor.
Okay, sir. Myself, Dr. Priyanka Rajendra Chaudhary, PG scholar from SMBT Ayurved College and Hospital, Nashik. My topic for presentation is Garbha Samskar, an Ayurvedic approach for fetal well-being, guided by Dr. Prashant Patil, sir. Introduction. During intrauterine life, the fetus is completely dependent on the mother. As a result, the health of the fetus directly depends on the health of the mother. Not only maternal nutrition, but maternal psychology during pregnancy has significant effect on the health of the offspring and mother too. Whatever emotional perception a woman has during her pregnancy are transmitted to the fetus. Garbha Samskar is best suited for previous slide, sir. Garbha Samskar is best suited to caring for the unborn baby's physical, emotional, mental, and spiritual development as well as the mother's health. Next. The word Garbha Samskar is composed of two words, Garbha and Samskar. Garbha means the fetus and Samskar means Parivartana in a guna, that is change in character. Thus, Garbha Samskar is basically aimed at providing fundamental care for good physical as well as mental setup of the child. It includes three stages. First, preconceptional care to get healthy baby, that is bija, sperm and ovum, care during pregnancy for development of the fetus, and postnatal care, that is Bala Samskar. The present paper and its relevance in the present modern era. Need of the study. Due to rapid industrialization and modernization, there have been massive change in lifestyle all over the world. With this, women have emerged as equivalent contributors in workplaces and business industry. This definitely has brought change in antenatal care too. Impact of lifestyle on fetus. Improper diet and lifestyle have a negative impact on fetal growth and can result in growth retardation. Use of preservatives, soft drinks, food additives, tobacco, alcohol with technological templates like microwave, laptop, mobile phones during pregnancy period affect the fetus. Next, effect of stress on expectant mother and fetus. Family disputes, traveling during first and third trimester, workplace stress, financial status, fear, these all causes increased level of stress hormone cortisol in the mother body. Stress causes the activation of hypothalamic pituitary adrenal axis and inflammatory response. Stress hormone cortisol can cross the placental barrier and high cortisol level can affect fetal brain development and especially memory. Next. Prenatal maternal stress is a risk factor for autism and ADHD. It also causes pregnancy and birth complications like low infant birth weight, depressions, preeclampsia, and gestational diabetes. These circumstances emphasizes the need of Garbha Sanskar in the present era. There is a need to adopt lifestyle described by ancient science before and during pregnancy to avoid complications. According to Ayurveda, the act of Garbha Sanskar has strong and direct effect on the child's physical, mental functioning. Aim to establish the role and importance of Garbha Sanskara. Objective: conceptual study of Garbha Sanskar to understand relevance of maintaining good physical and emotional status of mother and fetus and in fetal outcome. Next. Material and methods. Ayurvedic literatures regarding Garbhadhan Sanskar, Garbhini Paricharya, and its importance before and after conception was searched thoroughly. Similarly, its effect on fetal well-being were also studied. Other research journals, papers, books related to conception, pregnancy, stress, music, yoga, and its effect, etc. were also explored to collect the matter. Next. Discussion. Garbhadhan Purva Samskara, that is preconceptional care. Prakruti Parikshana, that is Ayurgenomics. Rajaswala Paricharya in female, Shodhan in couple, that is Vaman, Virechan, Basti, Panchakarma procedures, that is cellular cleansing. Ahara Shuddhi with special food plannings. Vihara Shuddhi with special daily routines. Brahmacharya Palan, Nadi Shuddhi, Pranayam and Yogi Kriya. Paryavaran Shuddhi, Agnihotra fumigation. Next. Garbhadhan Paschat Sanskar, post-conceptional care. If conception occur, Masonomasi Garbhini Paricharya and other means of Garbha Sanskara to be followed. This includes Garbha Samvad, communication or talking with baby, Garbha Sangeet, music, Garbha Mantra chanting, Yogasan with Pranayam, Dhyan, different postures with breathing exercise and meditation. Next. Garbha Samvad, communication or talking with baby. Hearing is the first sense stimulated in the fetus that promotes the development of the neural pathway. Brain development is linked to early auditory experiences. Noise from the placenta, maternal organs, and maternal voice all play a significant role as current in utero auditory stimuli, forming memories of his or her hearing experiences. It is also seen that fetus respond to father's voice but prefer to mother's voice after birth. Attachment and communication are already established before birth through auditory and multisensory experiences. Next. Garbha Sangeet, music for the fetus. By listening to special type of music like sound of veena, flute, Sama Veda mantras, and trimester-wise ragas with specific frequency helps in development of the body, mind, and soul of the child in the womb. Music exposure causes a variety of endocrine effects, including change in adrenal and gonadal stress steroid levels. These changes in the pregnant woman can affect neuroblast proliferation, axonogenesis, synaptogenesis, and neuronal organization. It also increases fetal movement and decreases uterine contraction. In a nutshell, music can be highly recommended for prenatal relaxation since it also leads to maternal relaxation. Next. Garbha Mantra, sound of mantra chanting for mother and fetus. Mana means mind and Tra means deliverance. Based on the vibratory aspect of energy and its modification into variant matter, mantras like Garbhadhan Mantra, Garbha Samraksha Mantra, Rama Raksha Kavach Mantra, and Gayatri Mantra, etc. can be used. This musical interpretation creates an environment of spiritual tranquility and learning for the mother and child. Thus, in expectant mother, mantra chanting can prevent pregnancy-induced hypertension, intrauterine growth retardation, and also helpful in mental health and brain development of the child. Next. Yogasana and a pranayam like Padmasana, butterfly pose or Titali Asana, squat or Uttanasana, cat stretch pose or Marjory asanas can be used. Dhyana, meditation. Mindful meditation is very important. It releases accumulated stress, increase energy levels, and improve health. Anuswaram, humming boosts the production of nitric oxide in the body. Next. Nitric oxide is important regulator and mediator of numerous processes in the nerves, immune and cardiovascular system. Nitric oxide is synthesized in the vascular endothelium and syncytiotrophoblasts from L-arginine. It significantly releases vascular smooth muscle, inhibit platelet aggregation, and prevent intervillous thrombosis. Deficiency of nitric oxide contribute to the development of pregnancy-induced hypertension in the mother. Conclusion. All these procedures of Garbha Sanskara help in every stage for all around development of the healthy, smart, beautiful baby with longevity. Establishing the Garbha Sanskar as a gold standard procedure for achieving the signature child is a stepping stone for the upgradation of our country in the developing world. Thank you.
Thank you, Doctor. Next, I invite Dr. Priya Bilkhade for the paper presentation. Dr. Priya, are you there? Hello, Dr. Priya, are you there? Hello, Dr. Priya Bilkhade, are you there? Okay, next I invite Dr. Prakriti TS for the paper presentation. Dr. Prakriti, are you there?
Yes, sir.
Okay, Doctor, please share the screen, Doctor.
1 minute.
Screen is
visible, sir.
Doctor. Visible, Doctor. Please start, Doctor.
Okay. Namaste, everyone. Myself, Dr. Prakriti TS, first year PG scholar from Department of Rasashastra and Vaishajya Kalpana. My today's topic is conceptual review on Samira Panaga Rasa, guided by Dr. Archana B. Pagad. Contents goes like this. Introduction. Samira Panaga Rasa or Vata Panaga Rasa, as the name indicates, it kills Vata like serpent and it can be used in number of diseases with suitable anupanas. Mainly Parada, Gandhaka Mishla Haratala, which are grouped under Uparasa, and Gauri Pashana, which is a Sadharana Rasa. Totally, you can find 7 references pertaining to creation of Samipanaga. Firstly, Ravichandamshu, named as Vatapanaga, which does not contain Manashila. Ayurveda Aushadhi Guna Dharma Shastra, which contains Manashila and it is accepted by Ayurveda Family of India. Other references are Rasa Yoga Sagara, Rasatandra Sara, Siddha Prayodandra, Siddha Graha, Ayurveda Sarasaha. Samira Panagarasa according to A5 reference. Paradam Gandhakam Malam, Hertalam Manashila, Chunikarva, Deita Vinarayam, Kachakupya Vinishipya, Aluka Yantrake Nisib, Kramagnina Pachet Samyak, Yamashte Samudre, Swangashitam Samudritya Namna, Asaur Vatapanaga, Shuddha Haratala.
Hello, Doctor.
Am
Hello,
I
Dr.
audible?
Prakriti? Audible, Doctor. Your screen is visible, Doctor.
Other
Please continue.
references are Rasa. Can I continue or should start from
Please
first?
continue, Doctor. Continue, Doctor.
Other references are Rasa Yoga Sagara, containing Abraka Basma, Shuddha Gandhaka, Vatsanaba, Shuddha Parada, Vyosha, and Shuddha Tankana. Mardana done for 7 days with Brangaraja Swarasa, and 1 Gunja Vatiswar should be prepared, and it is useful in Vata Vyadhi and Nasya in Murcha. Second reference, Shodhita Parada, Shodhita Gandhaka, Shodhita Haratala, and Shodhita Gauri Pashana in equal quantity. Mardana done with Tulasi Swarasa, and 2 Gunja Vati should be prepared and covered with Abraka Patra, and Golakas or kept in Sharava Samputa, and Mandagni applied for 4 yamas in Valuka Yantra. It is useful in Sannipata Rogas. It's a table showing different method of preparation of Samira Panagarasa. We can find Rasachan mentioned Sharava Samputa and Karaliya Rasayana methods, Ayurveda Aushadhi Gunadharma Shastra Upipakwa method. Properties of the ingredients: Shuddha Gandhaka and Madhura Vipaka, Ushna Virya. It has Deepaka and Pachaka. 1 to 8 rati dosage. Shuddha Manashya and Katu and Tikta Rasa, Rasayana and Lekana Karma. Dosage is 1/132 to 1/16 rati. Shuddha Haratala having Katu and Kashaya 4 to 1/2 is its dosage. Shuddha Gauri Pashana and Snigdha Guruguna 1/120 to 1/30, that is its dosage. Indications are Sandipatrogas, Kaphonada, Kafaja Sandibanda, Jwara, Kasa, Shwasa, and Vatarata. Articles regarding Samira Panagarasa. Standard operative procedure of Samira Panagarasa prepared to vertical electric mobile furnace. In this study, we can find that Samira Panagarasa was prepared by following the reference of AFI, and heat was given up to 37 hours 35 minutes, and Samira Panagarasa was collected from Kala and Kanta. Average yield was 86%. Toxicity study of Samira Panagarasa in Charlie albino rats. In this study, animals were divided into 5 groups, each containing 6 rats. Group 1 served as vehicle control. Group 2 to Group 5, Group 4 served as received Samira Panagarasa, and Group 5 received Samira Panagarasa and served as recovery group. No mortality was found, and Samira Panagarasa was safe even up to 10 times the therapeutical dose. And effect of Samira Panagarasa in the management of Tamakshwasa. In this study, Samira Panaga was prepared with and without Manashila, and 52 patients were treated with Samira Panagarasa in the dose of 30 mg twice a day for 4 weeks, along with Nagavalli Dala. And the results were, we can find improvement in pulmonary functions, and symptomatic reliefs were found. A randomized clinical study to evaluate the effect of Samira Panagarasa in Sandigata Vata. In this study, total 15 patients were selected, and Samira Panagarasa was administered 60 mg twice a day with Nagavalli Dala. Therapy shows maximum effect on Shota or edema. Probable mode of action of Samira Panagarasa in Tamakashwasa. Tamakashwasa is Amashe Udbhava Roga and affects Prana and Anavaha Srotas with Dushita Kapha and Vata and Rasadhatu. Samira Panaga having Ushnavirya, Lekana, Snigdha, Guru, Deepaka, Pachaka action may act as Srotoshodhaka, Vatanulomaka, and Kafasrava and reduce Tamakashwasa. Moving on to discussion. Samira Panagarasa can be prepared using Kopi Pakwa, Karaliya, and Putapaka Vidhi. In the preparation, we can find variation in the ingredients, difference in duration of heat application, and also difference of opinion exists regarding the final product. The concentration of mercury is less in Talasta Samira Panaga when compared to Galasta, and Gandhaka and arsenic are more in Talasta. Kajjali, Manashila, and Haratala contains Gandhaka. Hence, after corking, we should maintain the temperature, otherwise increase in pressure can lead to blast of bottle. Samira Panagarasa contains Parada, Haratala, Manashila, and Somala, which are included under Schedule E1 Drugs of Drug and Cosmetic Act 1940. Rasatantra Sara and Siddha Prayoga Sangraha mentions that Samira Panagarasa enters Shwasavahini Damani and Fuffusa, then removes Shota and induces Kafasrava, leading to reduction of Tamakashwasa. Conclusion, Samira Panagarasa is proved safe medicine on account of different toxicological studies, and the overall pharmacodynamics of Samira Panagarasa is Katurasa, Ushnaguna, Ushnavirya, Katuvipaka, and Kafavatagna. Samira Panaga with Manashila and Ubhayastha have relatively more effect than the Talasta. It is proved a potent anti-inflammatory medicine. As I've already mentioned, Samira Panagarasa is useful in Tamakashwasa. Tulasi Patra Swarasa Bhavana may act or give add-on effect to the Samira Panagarasa action. In Sandivata, Acharyas have explained Ushna, Snigdha, Vatanulomaka, Ahara, Vihara, and Chikitsa. So, Samira Panaga having Ushna Virya, Snigdha Guna, and Vatahara Guna probably helps in treating Sandivata. Thank you.
Thank you, Doctor. Next, I invite Dr. Kiran Baburao Jadhav for the paper presentation. Dr. Kiran, are you there?
Yes, sir. I am there.
Okay, Doctor. Please share the screen, Doctor.
Okay, wait.
Your screen is visible, doctor.
Okay.
Please chat, doctor.
Okay. Thank you. Hello everyone. Myself Kiran Jadhav. I am a PG scholar, Kriya Sharir Department, GSC. My topic is a Samanya Vishesh Siddhanta. The main motive of Ayurveda is to maintain the health and the healthy person to treat the disease. As per Ayurvedic etiology, any disturb at the level of dosh dhatumal leads to roga, and their equilibrium state is known as the health. The unbalanced state of dosha dhatumala is created by the Samanya Vishesh Siddhanta by using dravya having similar and dissimilar attributes. Just as a tree is depend on its root, similarly, Ayurveda also depend on its fundamental principle. The main fundamental principle of Ayurveda is a Trigun Tridosh Siddhanta, Panchamahabhut Siddhanta, Rasaguna Vipak Siddhanta, Lok Purush Samya Siddhanta, and Samanya Vishesh Siddhanta. According to Charak, Samanya Vishesh Siddhanta is सर्वदा सर्व भावांना सामान्य वृद्धि कारणम रास हेतु विशेषश्च प्रवृत्ति रुभयस्यतु. The padarthas which causes increases or decreasing of bhav padartha such as dravya means substance, guna, attribute, and karma is action of everything at all time is called as the Samanya Vishesh Siddhanta. Samanya Vignan सर्वदा सर्व भावांना सामान्य वृद्धि कारणम. The padartha which causes growth or increase of bhav padartha. There are the three type of samanya: drava samanya, guna samanya, and karma samanya. Drava samanya, the similarity visualized in substance represent this type of samanya when drava are directly used to increase the same type of dravya. For example, enhancement of muscle tissue by eaten meal. In modern aspect, blood transfusion in acute blood loss, use of IV fluid in dehydration, and third example are use of insulin in diabetes. The second is guna samanya, when administration of similar dravya is not possible. Dravya having same quality are given in the form of ahara. For example, dugdha and shukra dhatu are dissimilar, but madhur ras, shita, snigdha guna of dugdha increase the quantity of the shukra dhatu. Third are karma samanya. The common result of the action belong to this samanya when any activity is used to increase the dhatu. For example, kapha dosha is increased by continuous sleeping or sitting. Vishesh Vijnana, Rasa Hetu Visheshascha Pravrutti Rubhayasyatu. According to Ayurveda, Vishesh or variant factor is causes the reduction in all time. It bring about sense of separation. Type of Vishesh are Dravya Vishesh, Guna Vishesh, and Karma Vishesh. The Dravya Vishesh, directly administration of the heterogeneous Dravya. For example, Gaveduk in a Mamsa Vruddhi. Second are Guna Vishesh, administration of Dravya which have dissimilar attribute. For example, Godhuma or Tilatel, which having the property like Snigdha and Guru Guna, opposite to Vata Dosha, having the Ruksha and Lagu Guna. The third are Karma Vishesh, use of the opposite activity will decrease the guna in the body. For example, Kafakshay due to the Vayam. Samanya Vishesh Siddhanta in Ama Chikitsa. Ama dosha treated indigested ahar rasa present in the stomach is called as the ama. There are the two possibility treatment of ama. One is increase the Jata Agni and other one are Pachana. In the first type, Ushna property substance are used. This is the type of Samanya Chikitsa and other one including under the Vishesh Chikitsa. Samanya Vishesh Siddhanta in a Chikitsa. The principle of similar and dissimilarity described as the Samanya Vishesh Siddhanta in Ayurveda, and these principles help greatly towards the management of the various pathological conditions. Samanya Vishesh principle help physician to plan the treatment protocol while choosing the specific food, activity, lifestyle, medicine, etc. For particular type of the disease, the similar and dissimilar of the substance or activity increase and decrease the property of bhav padartha. These effects contribute towards the therapeutic response of the substance and suppress the pathological progression of disease. Samanya and Vishesh play important role in maintaining equilibrium with doshas. सामान्य विशेष सिद्धांत in षट क्रियाकाल. The 6 stage of the disease aggregate are संचय, प्रकोप, प्रसर, स्थान संश्रय, व्यक्ति and भेद. These all stage arises due to enhancement सामान्य of aggregation factor. Thus opposite, that is the vishesh treatment is used to prevent pathological progression of the disease. Abhyanga and Vyayam used to treatment method for the Vata and Kapha disease as the Karma Vishesh. Samanya Vishesh Siddhanta in a Dosha Rasa Sambandha, the Khatu Tikta Kashaya Ras cure in a Vatakshay, Amla Lavan and Ushna cure the Pittakshay, and Madhur Amla Lavan are cure the Kaphakshay. This is the example of the Guna Samanya. A very special thank you. Hello.
Next, I invite Dr. Gayatri Saji for the paper presentation. Dr. Gayatri, are you there?
Yes, sir. Yes, sir.
Okay, doctor. Please share the screen, doctor.
Okay, sir.
Your screen is visible, doctor. Please start, doctor.
Okay, sir. Namaste to you all. Myself, Dr. Gayatri Saji, first year PG scholar, Department of Rasashastra and Vaishajya Kalpana, Sri Dharmasthala Manjunatheshwara College of Ayurveda and Hospital. Today, I am going to tell about a review on Rasa Sindhura, a mercurial preparation. Contents include introduction, reference, ingredients, method of preparation, dose and anupana, indications, article on Rasa Sindhura, discussion and conclusion. Rasa Sindhura is one among the Kupipakwa Rasayana. Kupipakwa Rasayana are pharmaceutical preparation obtained by sublimation of Parata, Gandhaga and other metals requiring a specific heat pattern in a specific arrangement. Kupipakwa Rasayana is one among the Parada Murchana. The first documentation of Rasa Sindhura is done by Sri Yashodhara in his book Rasa Prakasha Sudhakara. It is named as Udaya Bhaskara Rasa. In Rasa Tarangini, 7 preparation of Gandhaga Jarida Rasa Sindhura has been explained. Starts with Ardhaguna Jarida Gandhaga to Shad Guna with different Swarasa as Bhavana Dravyas. According to books, different books, some variation in ingredients and procedures are there. References. Around 39 references are found from 22 classics books of Ayurveda, which include Rasa Tarankini, Rasamritam, Rasa Chandanshu, Rasa Manchari, Rasa Raja Chindamani, Rasa Prakasha Sudhakara, and also in AFI Part 1. Method of preparation of Rasa Sindhura. Acharya told 8 tola, 96 grams of each Shuddha Parada and Shuddha Gandhaga in a Khalva Yandra to be taken and triturated thoroughly to get a proper Kajali. This Kajali is subjected for 1 Bhavana with Vadangura Swarasa. Kajali to be filled into a Mrut Lepita Kachakupi and to be placed over Valuka Yantra. Mrutu, Madhyama and Tikshna is applied respectively for 4 Prahara, that is 12 hours. During Madhyamagni of 3 to 4 hours, yellowish red fumes can be observed from mouth of the bottle. During procedure, if the neck of the bottle is obstructed, it can be cleared with a tapta shalaka. After another 2 to 4 hours, flames and fumes gradually subsides. At this stage, deep red color can be observed at the base of bottle. Now, the corking of the bottle has to be done and sealed with a mud smeared cloth. Tikshna Agni to be given remaining 6 hours. Later, fire is put off and Valuga Yandra is allowed to cool by its own. Rasa Sindhura of Rekta Aruna Varna can be collected from the neck of the bottle. So this method is told in Rasa Tarangini Taranga 6. Uses of Rasa Sindura in different diseases with various Anupana is mentioned by Rasa Tarankini and Rasa Prakasha Sudhakara. The indication is along with the Anupana is mentioned, around 37 indications is mentioned. For Ajirna, Madhu and Mustakwata, Apasmara, Vajachurna or Brahmi, Gulma, Ajamoda Churna and Vidalavana. Like this, 37 indications with Anupana is mentioned. Therapeutic uses of Rasa Sinduram is mainly depends on Anupana. In Rasa Tantra Siddha Prayoga Sangraha, 39 indications along with Anupana is mentioned. There is no much references about contraindications, but in Rasa Tantra Siddha Prayoga Sangraha, Acharya told that Pitta Prakriti, Pittaja Shushka Kasa, Pitta Paitiga diseases, Rasa Sindura is contraindicated. Properties of Rasa Sindura, it is Shad Rasa Yukta, Guru Snigdha Guna, Ushna Virya, Madhura Vipaka, Rasayana Vajikarana, and Sarva Rogahara Prabhava. Dose, according to Rasa Tarangini, dose is mentioned as for 1 year 1/16 rati, 2 year 1/7 rati, 6 years 1/3 rati, 12 year half rati, and more than 12 years 1 rati. 1 rati is 125 mg. These are the articles related to Rasa Sindura. The toxicological studies of Rasa Sindura is done, which proved that the drug to be safer in therapeutic dosage form. Coming to discussion, difference of opinion exists regarding the proportion of Gandhaga, method of preparations, Bhavana Dravya, and duration of preparation of Rasa Sindura. The duration varies from 12 hours to 7 days. The preparation resembling to Rasa Sindura are mentioned in different textbooks with different names such as Udaya Bhaskara Rasa, Kamdeva Rasa, Haragauri Rasa, Madan Kamadeva Rasa, Sindura Paka, and Nayanananda Sindura. Coming to conclusion, toxicity studies prove that the drug to be safer in therapeutic dosage form. Rasa Sindura can be used to treat various diseases by changing the specific anupanas. These are the market available samples of Rasa Sindura. Dhoot Papeshwar, for 2 grams, it is 103 rupees. Baidyanath, 2.5 grams, 120 rupees. Dabar, 2.5 grams, 116 rupees. Thank you.
Thank you, Doctor. Next, I invite Dr. Sangeeta B for the paper presentation. Dr. Sangeeta, are you there?
Yes, sir.
Okay, Doctor. Please share the screen, Doctor.
Yes, sir.
Your screen is visible, Doctor. Please start.
Okay, sir. Thank you. Namaste, everyone. Myself, Dr. Sangeeta, third year PG scholar from the Department of Rashastra and Vaishya Kalpana. I am presenting the topic on Kasturi formulations, the formulations containing Kasturi under the guidance of Dr. Vinay Kumar R. Kadibagil, Professor from the Department of Rashastra and Vaishya Kalpana, STM Hassan. Kasturi Adi Gutika. It is mentioned in Sastra Yoga Gutika Prakarana and also in AFI Volume 1. Ingredients are Kasturi, Kirata Tikta, Rasna, Gandha Marjara Virya, Kanta Bhasma, Karpura, Jati Phala, Dvikshara, Tripala, Trijata, Hiravi, Dvijiraka, Ajamoda, Akara Karba, Shatava, Yashti, Lavanga, Gairika, Rivera, Rasa Sindura, Parangi, Pashupashi, Chandana, Vacha, Kankola, Shunti, Maricha Pippali, Shuddha Tankana, Anjana, Vatsanaba, Manashila, Chakramarda, and Hingula. All ingredients are taken in equal part and Bhavana is given along with either Jala or Godugdha or Bringaraja Swarasa. And Vati of 125 mg are rolled. Anupana is Jirka Kvata and it is indicated in all Vata Vikaras. Second formulation market availability of Kasturi Adi Gutika is VHCA pharmacy and it is also available in SKM Ayurvedic Kasturi Ayurvedic pharmacy. and it's also available in Kerala Ayurveda pharmacy. Then second reference is second formulation is Amarasundara Vati. It is mentioned in Ayurveda Sara Sangraha Rasa Rasayana Prakarana. There are two different formulations. One is without kasturi and another one is with kasturi. First one is without kasturi. Ingredients are Trikatu, Trifala, Renuka, Pippalimula, Chitrakamula, Lohabhasma, Tvak, Tvejapatra, Nagakeshara, Ela, Shuddhaparada, Gandhaka, Vatsanaba, Vayuvidanga, Akarakarba, Musta and Guda. The preparation is prepared by Gudapaka method, and dose is 1 to 3 tablets given along with hot water as anupana. It's indicated in all Vata Vyadhi, Unmada, Shwasa, Kasa, Arsha, etc. And it is specially indicated in women after giving childbirth along with DESHMUKH Vata. Then second reference which is containing kasturi is all the ingredients are same except kasturi, which is taken in 3 masha pramana. The method of preparation is kajal is prepared and remaining ingredients are added. Then mardana is done and kasturi is added at the last as it is a fragrant animal product. Then after proper mixing, the pills of 1 rati are rolled. Dose is 1 to 2 tablets, twice or thrice it's given per day along with warm water, indicated in Vataruga, Vataja Unmada, Apasmara, same as that of formulation 1. Then disease-wise, specific anupana are mentioned. In Kaphaja Rogas, it is given along with Ardraka Swarasa, Tulasi Swarasa, and in Vataja and Sannipataka Roga, it is given with DESHMUKH Vata. Its market availability is in Dudh Papeshwar and as well as in Baidyanath pharmacy. A clinical study has been conducted to evaluate the efficacy of Amarasundara Vati and Carovaran hydrochloride capsule in the management of cochlear synaptic tinnitus. Here, two groups. For one group, Amarasundara Vati is given, and for another one, Carovaran hydrochloride capsule is given. And it was found that Amarasundara Vati was effective in managing the cochlear synaptic tinnitus. Then discussion. Both references the discussion for Amarasundara Vati, both references have common indications like Vata Vyadhi, Shwasa and Unmada. Only difference between the two formulation is first formulation contains Guda and second formulation contains Kasturi. And remaining ingredients like Trikatu, Pippalimula, Chitrakamula, Vidanga, Akarakarba, all are Ushna, Virya and Kapha Vata Shamaka, which helps in reducing the Vataja disorders. And Kasturi is an animal product which is collected from the musk pod of the musk deer. After killing the deer, it is collected. It is also Katotikta Rasa and Ushna Virya, Vrishya, Balya, Rudya, and it is also indicated in Vadhara diseases. Then another reference for Amarasundara Vati is given in Rasa Hridaya Tantra. Then Kasturi Vati, it contains Kasturi and Gandha Marjara Virya, both are Ushna Virya and Kapha Vata Nashika. And Manashila and Rasa Sindhura are having Tikta Katu Rasa, which is indicated in Shwasa and Kasa. Chaturda Jatakas are Ushna Virya, Tikshna and Kapha Vata Shamaka. There is a separate reference for Vayugalika in Sastra Yoga, which contains some ingredients common to Kasturi Adi Gutika, and that Vayugalika also contains Kasturi as its ingredients. Kasturi is an animal original drug which can be used as which is used as medicine and for cosmetic purposes, which is obtained from the musk pod of the matured male musk deer, and it is included under the endangered species under the act called as Convention on International Trade in Endangered Species of Wild Fauna and Flora by the Government of India. Both Kasturi Adi Gutika and Amarasundara Vati are available in market, though Kasturi is considered as an endangered product. So it could be a point of discussion that whether they will add Kasturi really in Kasturi Adi Gutika, which is available in market. Amarasundara which is mentioned in Ayurveda Sara Sangraha is available in market, and the one which I have mentioned in that article, they have prepared by the first method, that is Gudapaka method. Thank you.
Thank you, Doctor. Next, I invite Dr. Seema Holapagol for the paper presentation. Dr. Seema, are you there?
Yes, sir.
Okay, Doctor. Please share the screen, Doctor.
Okay.
Your screen is visible, Doctor. Please chat.
Myself, Dr. Seema Holapagol, second year PG scholar, Department of Panchakarma, Taranath Government Ayurveda Medical College, Ballari. My topic is role of Panchakarma in Tamakashwasa. So, introduction. Chakrapani told that Tamaso Ati Andakarena Kimva Tamasa Tamogunaina. Tamakashwasa is the condition where the patient feels as if he is entering into the darkness during the paroxysm. It is the Shwasa which occurs during the Durdina and aggravates during the night time. That is called as Tamakashwasa. The disease is called as Tamaka as attack of the disease precipitated during the night, and during the state of attack, dyspnea becomes so severe that patient feels entering into the darkness. Tamakashwasa can be correlated to asthma in modern science. It is predominantly kapha-vataja vyadhi originating from the Pittasthana. Nidanas, Raja, Dhuma, Vata, Sheetasthana, Ambu Sevana, Vyayama, Gramya Dharma, Ruksha Anna Sevana, Vidahi, Guru Vishtambi, Ruksha Vishanda Bhojana. Next, Samprapti. Due to the Nidana, Jataragni Mandya will occur. That will cause Amutpatti. Then Rasagni Mandya. Then Malarupi Kapha Vruddhi at the level of the alveoli. It will cause Srotoroda. Because of Srotoroda, Pratuloma Gati of the Pranavata occurs. That leads to Tamakashwasa. Lakshanas, Pinasa, Gurguraka, Ativa Tivra Vega, Shleshma Samuchane Brumsha, Bhavati Dukkina, Mahat Mashwasa, Diva Shiraso Sangraha, Kruchra Bhashita, Pashvapida, Sveda, Moha, etc. Types, mainly there are two types, Pratamakashwasa and Santamakashwasa. Coming to prognosis, Tamakashwasa in strong patient with incomplete manifestation and of recent origin is curable. In general, Tamakashwasa is Kruchra Sadhya or Yapya and Asadhya in Durbala Rogi. Management, Sadhya and the Yapya type of Shwasa should be treated with the due care of medicines as early as possible. Delay in treatment can cause the death of the patient. So, Samanya Chikitsa includes Kapha Vata Hara, Ushna Vatanulomana, Bhesaja and Annapana. Here, Kaphakara and Vatahara should be administered sometimes, but Vatakara and Kaphahara should be avoided. Then, Brahmana and Shamana Chikitsa. Karshana is contraindicated as it may produce the adverse effects. Then, in all Pranavas, Srota, Vrishti Vikaras, we must always go for the general line of treatment, that is Snehana, Svedana, Shodhana, and Shamana. Kavala and Gandusha is told by the Sharangadara also. Samprapti Vegatana, go for Nidana Parivarjana. If Ama, then treat with Deepana Pachana, Vatanulomana, Srotoroda, then Kapha Nirharana and Vatanulomana by Sneha Sveda Purvaka Vamana. Shesha Kapha Nirharana at Dhumapana should be done. After that, Samshamana and Brahmana Chikitsa. So, Shodhana indicated condition. If Shwasa Rogi is suffering from Kasa and the Sarabanga, go for Vamana. Then Virachana should be done with Vata Kaphahara Dravyas. If Balavan Rogi and Kapha is more, then undergo Vamana and Virachana. If patient is Durbala and Ruksha, then administer Tarpana with Jangala Pashupaksha and Anupamamsarasa. In Navajvara condition and Amadosha, Vamana will be done with Lavana Jala. After Vamana, to treat Udavarta and Atmana, diet comprising of Matulunga, Amlavetasa, Hingu, Pilu, Bidalavana must be offered to restore the normal movement of Vata. Coming to Svedana, some patients are contraindicated for all type of Svedana. So go for alternative method. Mrudu Svedana to be done with Ushna Sneha Parisheka, Upanaha and Utkarika. Utkarika is prepared with the Vatahara Dravyas. Coming to Vamana,
management of Tamaka Shwasa can be done in two avasthas, that is Vega Kalina Chikitsa and Avega Kalina Chikitsa. Vega Kalina Chikitsa is acute exacerbation of the condition. In that condition, Sadhyomana is done instantly without giving Snehapana, such as Atyayika Avastha and Kapha Utklishta Avastha. So for Sadhyomana, before that, Purva Karma, Abhinga should be done with the Taila mixed with Lavana, then Svedana with the Nadi Prastara and Sankara Sveda. So due to that, kapha will vilayana of the kapha takes place. Srotas becomes mudhu, resulting in the easy elimination of the kapha to attain the vatanulomana. So after that, administer the kapha utkleshakara ahara, then administer vamana with pipali, saindava and madhu. Probable mode of action of Snehan and Svedana in Tamakashwasa. Stanika abhenga to the uraha, followed by the Sveda liquefies the kapha and clears the srotas, produces vatanulomana. The passage of pranava srotas gets relaxed and dilated by the Snehana and Svedana procedure, which acts as the bronchodilator. Next, Virechana Karma. Advan and Udavarta in Tamakashwasa is treated with Anulomana. Anulomana is done with Matulunga Surasa, Amla Vetasa added with Hingu, Pilu, Vidalavana, Amla Falarasa added with Saidava and make it Sukoshna and administer for Virechana. Clinical indication of Vamana and Virechana in Tamakashwasa. Vamana, when Shwasa associated with Kasa in Kapha Bahula Avastha, Balavan patient, and if he is Yogya for Vamana, then administer Vamana. Virechana should be done when Vata Pradhana, Madhyama Kapha Prakopa, that condition go for Virechana, that is in Avega Kala. Next, Duma, to remove the remaining doshas, Lina Doshahara, for the Lina Doshahara, we administer the Duma. For example, Varti is prepared with Madhu Chishta, Sarjarasa, Grita, all are mixed and prepare the Varti and that is used for the Dhumapana. Contraindication of Shodhana, if person is weak and Kapha is not in its Utklishta Avastha and he has not undergone Svedana, then avoid the Shodhana. Instead of Shodhana, go for Shamana and Brumana Chikitsa. So, probable mode of action of Vamana and Virechana and Shwasa. Vamana, by removing the obstructed Kapha, helps in easy movement of Vata. Virechana does Samprapti Vigatana and brings Vata into Anulomana Gati, and also it removes the Utklishta doshas. Here, one clinical study has done in our college, Sadhyomana in Tamakashwasa as Atyayika Chikitsa. A lady of 35 years came with the complaints of Shwasa Krishrata, increases at evening and aggravates at night, shortness of breath, and produces productive cough with restless since 8 days. We have treated with Stanika Abhenga to the Urha Parshva Krishna with Tilataila, with Saindava Lavana and Stanika Nadi Sveda with Panchamula Kwata. Vamana is given with Dambargava Kalpa prepared from Eshti Madhu Kwata. So results are immediate relief from the breathlessness and chest heaviness. So she attained Dehalagava, Uralagava breathlessness. Peak flow meter volume is before treatment 300, after treatment 350. ESR is also reduced significantly after treatment. So discussion, management of Tamakashwasa through Panchakarma depends on the Rogi and Rogabala and Avasthas. Therefore, the treatment modality is classified according to patient like Kaphadika, Vatadika, Balavan and Durbala. The therapy which elevates both the doshas should be adopted. Among Panchashodhana, mostly practicing are Vamana and Virechana. In Vega Kalina Avashwasa and Hika, Abhenga should be done with Lavana Taila to the Uras, and Svedana should be given either Nadi Sankara, Prastara, Sadhyomana and Dhumapana. In Avega Kalina Avastha, Virechana and Rasayanas are indicated. Mrudu Vamana and Virechana should be done with the Vata Kaphahara Dravyas. It will eliminate the Kapha dosha and it should not provoke the Vata dosha. Moving to conclusion, Pranava Srotas plays a vital role in maintaining the homeostasis of the body because not only prana moves in Srotas but also it entry for the pathogenesis. As we know, Na Tesham Punarudbhava indicates importance of Panchakarma. The disease treated with Panchakarma have less chances of recurrence by prohibiting the aggravation of dosha. Vamana is specific treatment for Kapha and Kapha Samsargaja Vadis. Virechana is best for Pitta dosha and Pitta associated with Kapha and Vata dosha. Dhumapana, Kavala, Gandusha helps to explain the Kantastha Kapha after Vamana. Hence, as a preventive and curative, one can practice the Rutu Shodhana also. Also, healthy lifestyle would have a preventive role. Breathing exercises, particularly pranayama, which improves the lung function, and meditation helps in reducing the stress and checks the recurrence. Thank you.
Thank you, Doctor. Next, I invite Dr. Jayant BS for the paper presentation.
Sir. Present, sir.
Okay, Doctor. Please share the screen, Doctor.
Okay. Sir, can you share, sir, here?
Okay, doctor.
Got
Hello,
it, sir.
doctor. Doctor,
Sir.
start the session, doctor.
Okay, sir. Good evening to all. Myself, Dr. Jayan, PG Scholar of Department of Shalya Tantra, Sri Kalabareshwara Ayurvedic College, Hospital and Research, Bengaluru, under the guidance of Vishwanath Sharma, sir, Professor of Department of Shalya Tantra, Sri Kalabareshwara Ayurvedic College and Hospital Research Center, under the Dr. Shailaja ma'am, a professor and HOD of SKMC, Department of Shalya Tantra. Today's my topic is Shalya Tantra, Pranashta Shalya and Jnana Upaya in Ayurveda. Content, Introduction, Pranashta Shalya, Shalya Beda, Shalya Gati, Shalya Ashraya, Shalya Lakshana, Samanya Lakshana to determine the Pranashta Shalya, Shalya Sthana, Jnana Upaya. Conclusion. Introduction. Shalya Tantra is considered one among the 8 branches of Ashtangas of Ayurveda. Acharya Shushruta defines Shalya Tantra as Tatra Shalyanam Vividam Trunam Kashtam Pashanam Pamshu Loha Loshtam Asti Bala Naka Puyasrava Dushtarana Antargarbha Shalya Dvaranartha Yantra Sastra Shara Agni Pranidana Rana Vinishaya Artha. Shushruta Sutra, first chapter, 9th sloka, where says that Shalya Tantra is the branch which deals with the extraction of grass, wood, stone, metals, bones, hairs, nails, and pus discharge which are embedded in Dushtarana, and extraction of Garbha Shalya, dead fetus, deals with the introducing the Yantra, Sastra, Shara, Agni, and Rana Vinishaya Artha. Next slide, sir. Acharya Shushruta has considered Shalya as a main threat that disturbs the sukha of the person that eventually leads to the various vyadhis or marana. A foreign body is any object originating outside the body. Acharya Shushruta wonderfully managed to trace out the foreign bodies lost in the body from the signs and symptoms exhibited by the subject along with some diagnostic techniques designed by him. Some of the techniques that were used those days are now also used and widely practiced. Advanced imaging techniques are used to locate the foreign bodies in present scenario. Pranashta Shalya. Acharya Chakrapani says, Atastesham antastita Shalya Nam Jnana Artha Pranashta Shalyam Abhidiyate. Pranashta Shalya comprises of 2 words, that is Pranashta and Shalya. Nirikti of Pranashta. Pranashta apatato anupalabhyamanam. Nirukti of Shalya. Shal Shwal Hashagamane Dhatu Tayoradasya Shalyamiti Rupam. Means the shal means which gives a meaning of fast movement. Shwala, that causing pain, misery. So that Shalya defines as the subject which moves quickly and enters the human beings, causing a pain or a misery. Shalya Paribhashaha. Sarva Sharira Padakaram Shalya. Shushruta Sutra, 26th chapter, 4th sloka, says that Shalya is that which produces troubles and pains for entire body. Acharya Dallana comment, Sarva Sharira Hena Abadda Bhavati Tat Shalya. Shalya Vedas are Vividam, that is Sharirika Shalya and Agantuja Shalya. The Sharirika Shalyas are Danta, Roma, Naka, Dhatu, Annamala, and Dushta Doshas. Agantuja Shalyas are Truna, Kashta, Pashanam, Loha, etc. Shalya Adhikara. Shalya Adhikara. Shushruta Sutra, 26th chapter, 7th sloka says that Shalyas are composed, made from the metals, bamboo, wood, grass, horns, and bones of animals, especially from the iron itself, because it's chiefly used for salt. Even among this, the made up of iron. Importance of Shara. Next slide. Sharas are made up of Durratvatvam, Anumukatvam, Dura Prayojana Karatvam means ability to enter the body, pointed tip, can be used from the long distance. Charas are two types, Karni and Slakshana. Karni means having a ear like a structure attached its front, and Slakshana it's a smooth rod like without any attachments. Generally, these are the shapes of leaves, flowers, fruits, and different kinds of trees can be used. Shalya Gatis. Shalya Gatis are Urdhvagati, Adogati, Avarchinnagati, Triyakati, and Rujugati. Shalya Ashrayas. Shalya Ashrayas, the spear of arrow is cut down because of long distance it travels, and also because of resistance of the body. The arrow makes the wound get lodged at the level of the skin, but eventually may pierce the structures like Damani, Srotas, Asti, and Peshi, etc. Shalya Lakshanas, Sushruta Sutra 26 chapter 10 shlokas, Samanya Lakshanas, Shalya get embedded inside the body. That following signs and symptoms are, there will be Rana Sofa, swelling will be there, resemblings of Budbud, bubbles associated with Shravam, that is blackish discoloration on affected area, Pidakachitam, appearance of rashes in the affected area, Vedana Vantam, that is associated with pain, Muhur Snonita Sravinam, means recurrent bleeding is seen. As on touch, there will be swelling is soft. Vishesha Lakshanas, Twagati Vishesha Lakshanas are, when Shalya lodge in Twak, the symptoms will be Vivarnam, discoloration, sofa, swelling will be there, and there will be Katina, all. Mamsagata and Peshigata, when the Shalya lodge in Mamsa, the symptoms will be increases in size of sofa, swelling. The tract through which the Shalya entered does not show the symptoms of healing. There will be Pidana, pain which is intolerable. There will be Osha, feeling of pain as though the area is being sucked forcefully, and there will be Paka, swelling exhibits that inflammatory signs. Similarly, the Peshigata, apart from Mamsagata Lakshana, there will be absence of Chosha and Sofa in Peshigata Shalya. Siragata Shalya. When the Shalya large in the Siras, there will be Sira Hadmana and Sira Sofa. Dilatation of vessels will be seen. Sira Shula, there will be pain area related to Sira, and with Sira Sofa, there will be swelling in the Siras. Snayu Gata Shalya. Where the Shalya large in the Snayu, there will be Jala Utshepana. Snayu Jala Utshepana means the elevation of networks of Snayu. There will be Samramba, the swelling with the inflammatory signs, and Ugraruk, there will be severe pain. Srotagata Shalya. Where the Shalya embedded with the Srotas, there will be the dysfunction of respective Srotas, and there will be Srotas Rava Gunahani, means the changes in the appearance of Srotas. Damanigata. When the Shalya embedded in the Damanis, bleeding which appears like a frothy along with the sound associated with generalized, there will be body ache, Trishna, and Rulasa, feeling nausea. Astigata, Asti Vivaragata, and Sandhigata Shalya. The Shalya large in the Asti, then the symptoms will be different kinds of pain will be felt along with the swelling. Asti Vivaragata symptoms will be Asti Purnata, there will be feeling of fullness in the Asti. Asti Nistoda, pricking pain will be there. And there will be severe pain associated with auripulation. Koshtagata Shalya. Where the Shalya embedded in Koshta, there will be Atapa, the gurgling sound in the abdomen, Anaha, distension of abdomen, contents of part affected wound, appears the wound like Ahara, Mutra, and Purusha. Pranashta Shalya Gnana Upayas. Samanya Gnana Upayas, the Sushruta Sutra, 26 chapter, 13 shloka says that the common method to determine the site of Shalya foreign bodies are riding on elephant or horse, climbing a hill or a trees, fast riding, walking a long distance, wrestling, long jumping, swimming, physical exercise, yawning, belching, coughing, sneezing, spitting, laughing, and elimination of flatus, urine, feces, or semen. The place where the swelling or a pain develops during the above activities, that should be. Okay, sir.
Doctor, you are exceeding the time limit, Doctor. Can you speed up your presentation?
What, sir? Time has
you are
been over,
exceeding
sir.
the time limit, Doctor. Can you speed up your presentation, Doctor?
Okay, sir. There will be Vishesha Lakshana of Tvak Pranashtas, where the embedded Shalya embedded in Tvak, there will be should be the Snehana and Shvedana. One should apply the lepa using of Yava, Goduma, Gomaya. By this, the patient signs symptoms of inflammatory signs, the localized area. One should interpret Shalya where the particular site, even the condensed ghee applied or a paste of Chandana, the applied to the area, ghee gets diluted and the paste of Chandana gets dried up immediately because of rise of temperature in Tvakkati Shalya. Then Mamsa Pranashta Shalya. In the Mamsa, one should do the Snehana and Svedana in an individual who is lean because of above treatment. Shalya becomes loose and get dismatted from the side. Further, it produces discomfort and a pain in the area where it's present. This gives a clue to where the Shalya is present. Sira, Damani and Slotos Snayu Pranashta Gnana Upayas. Shalya got embedded in the Sira, Damani and Slotos. The patient would made to sit on the chariot which is broken wheel and taken him to the fast ride on the rough road. The area where the patient feels some rhomba, inflammatory signs in the local area, the pain should be identified in the site where the Shalya gets embedded. In the Asti Pranashta Shalya, to identify where Shalya get embedded in Asti, one should do Snehana, Svedana, Bandhana and Pidana. The patient feels a inflammatory signs in the local area. Then Sandhi Pranashta Shalya, one should do the Snehana and Svedana. After this, one should do the brisk stretching, constructing the joint, the area where the patient feels sambramba, means inflammatory signs in the local area. Pain should be identified in the particular site, Shalya where embedded. Marma Pranashta Shalya, Dallana comments that marmas are located in Tvakkati Vivarna Vastu, which are 18 numbers. So keeping the location and the types of marma in the consideration, we can adopt the Tvakkati Gnanopayas. Sasalya Lakshana and Nisalya Lakshanas. Where Sasalya Lakshanas, the place where the symptoms like a pain, numbness, heaviness, the part which is restlessness, where there is a swelling along with the pain. This site, the patient tries to protect while doing any activities where Shalya is embedded. Nishalya Lakshanas are the injury which do not cause us too much of discomfort, not associated with pain. There will be no associated with any complication. The site which is clear and which is soft, the part which is stable, which is not much too elevated, should be subjected for Ishana, that is probing, and it traces the tract of injury clearly, forms all the angles, and asks the patient to do the movements like stretching and constructing. The part concluded that Shalya is absent. Conclusion. Pranashta Shalya Gnana Upayas are some valuable knowledge we can compare from the classics with a lot of scientific background behind them. Examination is mandatory before any diagnosis and for further intervention. When there is a Shalya or a foreign body lodged inside and moreover ignored, its progression can cause us a severe diseases or a permanent disability. The physician or a surgeon needs a complete knowledge, observational skill, examination tactics, and an intelligent mind to locate the Pranashta Shalya. In olden days, Vaidyas were able to find out the foreign bodies with the limited resources. But in the present era, the advanced techniques are available to detect even the minute foreign bodies in the different parts of the body. Thank you, sir.
Thank you, doctor.
Thank you, sir.
Next, I invite Dr. Supriya for the paper presentation. Hello, Dr. Supriya, are you there?
Yes, sir, I'm here.
Okay, doctor. Please share the screen, doctor.
Okay, sir. Sir, my screen is visible.
No, doctor, not visible, doctor.
Sir, can you share my screen from your side?
Okay, doctor, one sec. Doctor, please share the screen, doctor. Dr. Supriya,
Yes, sir. I'm here.
please start, Doctor.
Good evening, everyone. Myself, Dr. Supriya from SDM College, Bangalore. My topic is a critical review on Sthanik Chikitsa and Prasuti and Stri Roga. Next slide, please. In Ayurveda, many local therapies, that is Sthanik Chikitsa, are described for the management of common gynecological disorders. Sthanik Chikitsa help in relieving vulval itching, vaginal discharge, and foul smell, pain, burning sensation, vaginal infection, and inflammation. Sthanik Chikitsa means the sarta vishuddha hai, shesha karma vidhyate, basti abhyanga prisheka prilepa pichu dharanam. Sthanik Chikitsa, which is given after the Shodhan Karma, include the following: Uttar Basti, Yoni Pichu, Yoni Varti, Yoni Lepa, Yoni Prisheka, Yoni Dhupna, Yoni Purna. Next slide, please. Yoni Prisheka. Synonyms are Sheka, Prisheka, Prishechan, Nirukti, Secha, Shuk Ambu Nama. Sechan with the Shuk Ambu is known as Sheka. Definition: Prachalan of Yoni with the help of various Shodhanostia. You have changed my slide. Definition: Prakshalan of yoni with the help of various Osad Siddh Dravya is known as yoni prakshalan. Application site is vagina. Duration 8 days. Time of administration Ritukala. Time limit 1 to 1.5 minutes. Next slide, please. Indication of yoni dhavana. Saral Mudak Parni Kashai Prashalna. In Vata Jata Doshti Prashalan with the Sharal and Mudak Parni. In Pitta Jata Doshti Prashalan with the Garik and Nimbu. In Kapha Jata Doshti Prashalan with the Lodra and Trikatu. In Kunuk Bandi Artha Doshti Prashalan with the Kavat of Trifla. Mode of action of Yoni Prisheka, as the name Dhavana suggests, wash out the secretion and discharge of vagina. The action is mainly by the drug used in the preparation of the kvata. Bactericidal action of the drug prevent the bacterial growth and maintain the pH of the vagina. It deals with the alter the pH of the vagina, thus not favoring the microorganism attack. The action of the drug used in Prakshana having the Sulagna and Durgandha properties. Next slide, please. Yoni Dhupana. Definition: Dhupan is carried out using the fine powder of the selected dry drugs with the intention of Nirjata Krama is called Dhupana. Site is outer surface of vagina. Duration 3 to 5 minutes. Indication of Yoni Dhupana. Dhupana of Saral Guglu and Yavu mixed with the Grita and Katu Matasya with the Tela also be used in Shweta Pratra. Dhupana of Haridra and Brahati in Yoni Kandu. Dhupana of Kusht Guglu Agar mixed with the Grita in Sutika Pricharaya. Mode of action of Yoni Dhupana are Shrota Shodhana, Kafhana, Kledhana, Rakshohana. So in first Shrota Shodhana, Dhupan is Ushna, Tikshna, Shukshma in induced Shvedana which open the minor channel and clean the yoni. It dilates the blood vessel and help the oxidation of the blood. It lead to educate tissue perfusion and oxidations, thus reduce inflammation, itching, and eliminates the infection. Kapha and Kledhana. Dhupan is Ushna, Rukshna, and Tikshna, and Shukshma, hence it reduces Kapha and Kledha. Rakshohana. Dhupna is bactericidal and antiseptic due to Ushna, Ruksha, etc. or due to Prabhava of a specific drug. Dhupan carried in aseptic environment kill microbes, thereby prevent infection. Next slide, please. Uttar Basti. Uttar Basti is described by all the Acharya except the Kashyap Sahita and Bel Sahita. Definition: Uttar Marga Kiva Shreshta Guna the Uttar Basti. The Basti which is given by Uttar Marga and means that Uttar Marga, Muttar Marga and Yoni Marga. According to Vagbhata, it have both effect, Snehan effect also and Shodhan effect also. Next slide, please. Indication: Baste Rogeshu Nariname Yoni Garbeshu Che Yoni Vyapat Asrikdre Yoni Vibhransha Shule Mutra Krich Mutra Vikareshu. Uttar Basti is indicated in following: Basti Roga, Yoni Vyapa, Ashragdhra, Yoni Vibhranja, Yoni Shula, Mutrakrich, and Mutragat Roga. Next slide, please. Uttar Basti in various disorder. An ovulation, Uttar Basti with Phalagrita, Kalyanagrita, Satavigrita, because all these drugs having the Arthogena property. In tubal blockage, Uttar Basti can be done by Char Tela and Apamarga Char Tela if tubal block is due to adhesion. In cervical erosion and cervicitis, Uttar Basti with Jata Degrita, Ropan Grita, and Trifla Grita. In cervical mucus disorder, Uttar Basti can be done with Jata Adi Grita and Go Grita. Endometrial condition can be treated with the Brahmaniya Dravya should be administered as the absorption of these Sneha Dravya has very rapid, which improve the quality of endometrium. Sneha Dravya having Snigdha and Pichil Guna, which help in improving the secretion of vaginal mucus. Tel and Grita is used along with the drug act as a carrier because the endometrium mucus can be absorbed fat easily. Also, estrogen and progesterone are lipid hormones, so Sneha Dravya have a stronger effect on them. Similarly, some herbal preparations having Kashaya Rasa, which help to decrease vaginal secretions. Next slide, please. Mode of action of Uttar Basti. Uttar Basti remove the Srotas Sangha and correct the Dhatu Agni, which regulate the menstrual cycle. Ovarian contain the receptor which receive the hormone, secrete the hypothalamus, secreted by hypothalamus and pituitary gland. The drug stimulate these receptors, so proper ovulation occur in each cycle. In tubal block, the drug reaching the block site and hence the Uttar Basti relieve the tubal block by lysis of adhesion and relieve the obstructions. In cervical factors, drug administered locally in the cervix and absorbed by the cervical epithelium due to Shushma property of drug. The lipid soluble drug is passively diffused across the membrane in the direction of its concentration gradient. The rate of transport of the proportional to the lipid and the more lipid soluble, the higher the concentration and the quicker diffusion. In this way, the alter the cervix pH can be corrected by Uttar Basti. Uttar Basti help in endometrial condition by improving the thickness of endometrium, improve the quality of endometrium, help in reoccurring the endometritis. Absorption is very fast and quicker results. Joni Pichu. Pichu pechete karpas sulla. The substance which is made by cotton is known as pichu. Definition: Pichu tele pichu nama tul kena tela vat handravya kvata siddha yoni dharnayat. The pichu lubricates with oshit siddha tela or vat handravya kvata should be kept in yoni. Site vagina. Duration of retention of pichu 5 to 6 hours. Indication of yoni pichu in Istri Roga. Vatas Yoni Vyapad, Guduchi Tel Pichu, and in Pitas Yoni Vyapad, Panchvalkal Siddha Pichu. In Garbhani Paricharya in 9 months with Madhur Oshad Siddha Tela Pichu, and in Garbhasarava Yashti Madhu Grita Pichu. In Apra Sangha, Shatpushpa Kushta Madanfal Hingu Siddha Tela Pichu should be given. Mode of action of Yoni Pichu. Pichu helps the medicine to retain at the site for a longer period for a better action. The mode of the action depend on the medicine used, as the different medicine have different mode of action. This the sesame oil base most commonly used, and it has higher antiseptic and antibacterial property. The pichu used during the pregnancy and labor help to soften the vagina canal, allow the easy delivery and easy expulsion of the placenta. Pichu have also Lekan Karm and thus remove the slug. Oil used for Pichu strengthen the muscles of the vagina canal along with the healing of wound. Yoni Varti. Varti is used in Yoni Pradesh. It
Hello,
is
doctor.
called as, yes sir?
Doctor, you are exceeding the time limit, doctor. Can you speed up your presentation?
Yes sir. Definition: Dharna of Varti in Yoni known as Yoni Varti. Parmana, Tarjani Ungli Parmana, duration 2 to 3 hours. Next slide, please. Indication of Yonivarti. Here some example I have put it. Varayeshu Bahusha Pitta Bhavita Tela Krita. Varti prepared with Varha Pitta Bhavit Vastra should be used in Kafaj Yoni Vapad. Next slide. Yoni Lepa. Definition. Fresh drugs are made into the paste and used externally for the ointment or lepa. When used in yoni, it term as yoni lepa. Site vagina. Time limit for 3 to 4 hours. Indication of yoni lepa. Some example I have put it. In Vivrit yoni with the powder of the palash, bija and udumbar phala mixed with the til, tela and honey. Mode of action. Yoni Purana. It is also known as a Yoni Dharana. Definition. The word Yoni Purana is formed by two words. Yoni means vagina, Purana means filling with something. Indication of Yoni Purana. In Pittaj Artha Dushti, Dharan of Chandan and Payasa Kalka in Yoni, and Dharan of Piddhavat Pakshana Churna and Madhu in Yoni. Next slide, please. Discussion. Vaginal route has a higher bioavailability compared to oral route. The vaginal wall is very well suited for the absorption of the drug since it contains a vast network of the blood vessels. The drug used for Sthanik Chikitsa act externally, exerting the antiseptic, antimicrobial, antifungal, anti-inflammatory, analgesic actions. It play a major role as it directly act on the different area and pathology can be rectified. Hence, the proper Sthanik Chikitsa with proper drug give good result in Stri Roga. Conclusion: Sthanik Chikitsa play equal importance role as the Bhayantar Chikitsa in the management of various Stri Roga. Sthanik Chikitsa prevent microbial infection and control abnormal vaginal bleeding. It's also prevent foul smell and burning sensation. It always, in this way, Sthanik Chikitsa not only relieve symptoms of a vaginal disorder but also help to maintain the reproductive health of females. Thank you. These are the reference I have put it.
Thank you, doctor. Next, I invite Dr. Monica Singh for the paper presentation. Dr. Monica, are you there?
Yes, sir.
Doctor, please share the screen, doctor.
Okay, sir. Namaste everyone. Myself Dr. Monica Singh, first PG scholar, Department of Rachna Sharira, SDM College of Ayurveda and Hospital, Hassan. Today I am going to present on topic understanding the concept of Yakrit with special reference to embryogenesis. Yakrit is derivation. It is derived from yam samyavam karoti, that means union, kru to make, quit to augment, to increase the value, amount or size of something. This is from Shabda Sagara. Aim of the study. This study has been conducted to assess the views of Ayurveda and contemporary science based on the genesis of the living. Paryayas of the Yakrit. Kalakhanda, this is from Amanakosha. Kalakhanjam, Kaleyam, Kalakam, this is from Hemadri. Karanda, Mahasnayuhu, this is from Rabhasa. Other synonyms include Jyotisthana, Yakrit Khanda, Raktadhara, Raktashaya, Yakrit Pinda. These are the other synonyms which are used in the commentaries. Kalakhanda, Yakrit Kalakhandam, Dakshina Pashvasthanam. This word is also used as synonym of Yakrit in the Sushruta Samhita. Jyotisthana, Jyoti is Agni. The site of Agni is called as Jyotisthana. Tasyantarina Nabhestu, Jyotisthana Dhruvam Smritam. Tadadamati Vatastu, Dehasthenasya Vardhate. Fetal nutrition usually depends on Ahara Rasa, categorized under maternal factors and Vayu present in Jyotisthana, which is responsible for cell division. The Ahara Rasa is first received by Jyotisthana, which further nourishes the whole body. Therefore, Jyotisthana can be considered as liver. Yakrit Khanda. In Ashtanga Hridaya, Acharya Vagbhata has used this word with regards to description of Piktarsha. Shuka Jivha, Yakrit Khanda, Jalauko, Vakta Sannibaha. In accordance with contemporary science, Yakrit Khanda can be considered as lobes of liver, Raktadhara or Raktashaya. Tatra Yakrit Grahanam, Raktadhara Syamyena, Plina Upalakshanam, Yakrit Samipanam, Hrudayadinamscha. Yakrit is a site of Raktadhatu. Blood is stored in the liver. Therefore, Raktadhara or Raktashaya words have been used in Sushruta Samhita. Srotas, Yakrit is the Mula of Raktavaha Srotas. So it can be considered as Yakrit is the source of Rakta. Varna, in the classics, various references regarding the color of Yakrit can be seen during the elucidation of signs and symptoms of the diseases. The color of Vidradi is similar to the color of Yakrit, that is, Krishna Lohitam, reddish brown in color. Acharya Vagbhata has compared the color of Arsha with Shukajivha, that is, the tongue of parrot, Yakrit Khanda, and Jaloka. In other condition, Atisara, Yakrit Pinda Mamsa Dhavana Mechakaihi. The critical condition of the patient in Atisara, if the color of the stool is like Yakrit Pinda or Mamsa Dhavana, the patient will not survive. Swarupa, according to Brihadaranyaka Upanishad, the appearance of Yakrit and Pliha are solid structures like mountains. Sthana, Yakrit Dakshina Parshva Sthana. The site of the liver is below and right to the heart. Acharya Arunadatta has also gave the same statement. Karya of the Yakrit. Many acharyas have stated that the main function of Yakrit is to offer red color to the Rasadhatu, that is, Ranjana of Rasadhatu. According to Sushruta, the function of Pitta, which has its seats in the Yakrit and Pliha, consists of imparting its characteristic pigment, that is Ragakrit, to the Rasadhatu, and hence it is known as Ranjakagni. Acharya Sharangadhara also has a similar opinion about the formation of blood. Utpatti, about the development of body parts, Yakrit is developed or generated from Matruja Bhava, as stated by Acharya Sushruta and Charaka in Sharirasthana. Acharya Sushruta in Sharirasthana states that Yakrit is also developed by Raktadhatu. According to Acharya Arunadatta, the three Bhava Padarthas, that is, Samanavayu, Dehoshma, and Raktadhatu, takes part in the formation of Yakrit, Pliha, and Pluma respectively. While considering these verses, it has been clear that all the acharyas were sure about the major role of Raktadhatu is the development of Yakrit. Discussion. Ayurveda described the formation of the body in the Sharirasthana in Garbha Avakranti Sharira. In Garbha Sharira, Avakranti means stepwise development. As the body formed or developed in a stepwise manner, the term Avakranti has been used. According to Ayurveda Samhita, Yakrit develops from Raktadhatu. The correlation of this in contemporary science is the development of the liver is from hepatic bud and septum transversum, that is the unsplit part of the mesoderm. On the first hand, the mesoderm produces septum transversum and the liver develops from the same. On the other hand, the mesoderm also produces mesenchymal cells, which in turn produces myoblast, chondroblast, lymphoblast, hemocytoblast, etc. The blood cells develop from hemocytoblast and lymphoblast. It is seen that the raw material for the liver and blood is same, that is mesoderm. Secondarily, the septum transversum is the first site of maternal blood. The umbilical and vitelline veins open at the septum transversum. Due to this, the septum transversum is rich in blood supply. The hepatic bud grows in the septum transversum, and due to it, the umbilical and vitelline veins are broken up, forming the liver sinusoids. It indicates that blood plays an important role in the development of the liver. Hence, in this manner, the references of Ayurveda can be correlated with contemporary science regarding the development of Yakrit. According to Ayurveda, the Rasadhatu which comes to Yakrit and Pliha gets colored by Ranjakagni. In the contemporary science, it can be matched with hematopoiesis. Hematopoiesis is the formation of the blood cells. Blood cells arise from the blood islands of the yolk sac. However, this is temporary and it is replaced by permanent stem cells, which in turn arise from the mesoderm surrounding the developing aorta. These stem cells first form colonies in the liver. In the late embryonic period, formation of blood stacks in the liver, which remains an important site of blood cell formation till the 6th month of intrauterine life. In the middle of prenatal life, definitive hematopoietic stem cells from the liver migrate to colonize the bone marrow. At the time of birth, blood formation is mainly in the bone marrow. By this, it can be understood that liver plays an important role in the formation of blood cells. When we see the context of Rasaranjana, Ahara Rasa pass through venous capillaries of inferior mesenteric veins and splenic vein and then to reach the liver through portal vein. There it reaches till hepatic sinusoids, where admixture of venous blood and arterial blood takes place. Then it reaches the heart through inferior vena cava. By this, it can be understood how Rasaranjana takes place.
Hello, doctor.
Hi, sir.
Doctor, you are exceeding the time limit, doctor. Can you speed up your presentation?
Yes, sir. Last slide. Conclusion. The above discussion shows that the embryological origin of the liver is blood tissue as per Ayurveda as well as contemporary science. So by considering its Utpatti, Karya and synonyms, it can be concluded that Yakut is considered as liver. Thank you.
Thank you, doctor. Next, I invite Dr. Sirisha S.R. for the paper presentation.
Yes, sir, I'm here.
Okay, doctor. Please share the screen, doctor.
Okay, sir.
Your screen is visible, doctor. Please chat.
Okay, sir. Namaste, everyone. I'm Dr. Sirisha, first year PG scholar, Department of Rachana Sharira, SDM College of Ayurveda and Hospital, Hassan. Today, I'm going to present on a topic, understanding the concept of Garbhashaya. Introduction, Nirukti. Garbha plus Ashaya, that is Garbhashaya. Garbha means fetus, Ashaya is the residence. That which gives residence to the Garbha is called Garbhashaya. Synonyms of Garbhashaya, Garbhashaya, Dara, Dimba and Kshetra. Aims and objective, conceptual study of Garbhashaya with its correlation. Material and methods. There are so many references regarding Garbhashaya in different samhitas. According to Sushruta, Shukra Shonitam Garbhashayastam Atma Prakriti Vikara Samurchitam Garbha Ityuchate. Sushruta tells that in Garbhashaya, Shukra and Shonita combines with Atma Prakriti and Vikara to form Garbha. According to Amarakosha, Garbhashayaha Pum, Garbhasya Brunasya Ashayaha Shayavadashraya Sthanam. Garbhashaya is the bed for growing Bruna, that is embryo. According to Bhava Prakasha, Sa eva Garbhasya Danam Kuryat Garbhashaye Striyaha. Garbhashaya is the place where Garbhadana takes place. Garbhashaya in Mahabharata, Shukra Shonita Samsrishta Striya Garbhashaya Gata. Garbhashaya is the place where Shukra and Shonita combines. Here Arunadatta and Vagbhata tells Dimba as Garbhashaya. Vagbhata has enumerated Dimba among the structures of Koshta, and Arunadatta says it is made from Prasada Bhaga of Rakta and Mamsa and it is derived from Antra. Kshetra as Garbhashaya, Kshetra Bhuta Smrita Nari, Bija Bhuta Smrita Puman, Bija Kshetra Samayogat Sambhavaha Sarva Dehinam. The Garbhashaya in female acts like a Kshetra and Shukra in man like a Bija, which is sown. Thus the creation of all beings is due to the proper growth of the bija in the kshetra. Vajikaranam agram cha kshetra striya praharshini. Kshetra is the best aphrodisiac and stimulant for procreation. Shape of Garbhashaya, Yata Rohita Matsasya Mukam Bhavati Rupataha. The resemblance of Garbhashaya Mukha is having the same shape and size of the Rohita Matsya Mukha. Garbhashaya as Ashaya. Strinam Garbhashayoshtam iti. There are 7 ashaya in human body which are common for both male and female. Apart from that, female body has 8th ashaya, that is Garbhashaya. Strinam Pitta Pakvashayor Madhye Garbhashayoshtam Garbhashayo Ashtam. This is according to Vagbhata. He said that the 8th ashaya of women is Garbhashaya is located between Pittashaya and Pakvashaya. Purushe abhi adikaha cha anye narinam ashayaha trayaha dara garbhashayaha proktaha stanau stanashayo matav. There will be 3 extra ashaya in female. 1 is Garbhashaya and 2 are Stanyashaya according to Sharangadhara. Location of Garbhashaya. Tasya Strutiye Avarte Garbhashaya Pratishtita. Garbhashaya is situated in the 3rd avarta of Yoni. Pitta Pakvashayor Madhye Garbhashaya Yatra Garbhas Tishtati. It is situated between the Pittashaya and Pakvashaya. Strinam tu Basti Pashvagate Pashvagato Garbhashayah Sannikrishtaha. According to Acharya Sushruta, he said that in women Garbhashaya is situated in Pashva of Basti. Garbhashaya in between Vipula Kundala of Shrotas, according to Kashyapa Samhita. Here Vipula Kundala of Shrotas refers to multiple coils of intestine and it is covered by Jarayu. According to Sharangadhara Samhita, Garbhashaya is in the 3rd avarta and it is in Chakrakara, that is wheel shaped. Yoni, derivation of Yoni, Yoni hi yauti samyojayati iti. According to Shabda Kalpadruma, the word Yoni is derived from the Sanskrit root yuj, meaning the join, meaning to join, suffixed by ni to form the word Yoni. Yono Garbhashayo Dwaramukhe. According to Ashtanga Sangraha, the word Yoni refers to Garbhashaya Dwaramukha. Synonyms of Yoni: Smaramandira, Janmavartma, Apatham, Upastha, Smaradvajam. Strinam aparani cha trini dve stanayor adastat raktavaham cha. According to Sushruta Sharirasthana, and trini strinam stanau raktapatascha. According to Ashtanga Hridaya, apart from the Navarandras which are common for both the sexes, females have 3 extra external orifices. 2 are in the stana and 1 more is in the yoni to discharge artava. Shape of yoni: Shanka nabhya kritihi yonisya avarti sa prakirtita tasya strutiye avarte garbhashaya pratishtita. The shape of the yoni is compared to the shape of the Shankanabhi or the hollow portion of the conch shell. It has 3 avartas or circular folds. Garbhashaya is situated in the 3rd avarta or the uppermost fold. Yoni as Garbhashaya. In different contexts, Yoni is considered as Garbhashaya. Like in Yoni Vapad, here the Vapads of Garbhashaya is referred. Yoni Shodhana, here the Shodhana of Garbhashaya is referred. And in Mahayoni, it is a clinical condition having Yoni Vishtambana, that is distension and Utsanna Mamsata, prolapse. Here also Yoni refers to Garbhashaya. Importance of Garbhashaya: Shuddhe Garbhashaye Marge Rakte Shukre Anile Hridi Viryavanta Sutam Sutam. Acharya Vagbhata says that a woman gives birth to a valiant son when Garbhashaya, Marga, Rakta, Shukra, Anila and Hridaya all being pure. Rutukshetra Ambu Bijanam Samagrya Ankuro Yata. According to Sushruta, here he tells Rutukshetra, Ambu, Bija are necessary factors for Garbhadana. Bijatma karma ashaya kala doshair matus tata ahara vihara doshaihi kurvanti dosha vividani drushtaha samstana varnendriya vaikritani. According to Charaka Sharirasthana, because of the defects in the bija, atma, karma, ashaya, kala, dosha and ahara and vihara of mother, doshas gets variously vitiated and this results in impairment of samstana, varna and indriya of the offspring. Peshi in Stree, female body consists of 20 extra peshis compared to the body of the male. Among the 20 peshis, 10 are in the sthana, 5 in each sthana, and the rest of the 10 peshis are in the yoni. 4 peshis are in apatyapata, 2 are inside the yoni, and remaining 2 are in the mukha. These are circular in fashion. 3 peshi are in garbhachidra. 3 peshi take part in the movement of bringing together of shukra and artava. Artavaha Strotas, Artavahe Dve, Tayor Mulam, Garbhashaya Artavahinyascha Damanyaha. Origin of 2 Artavaha Strotas are the Garbhashaya and the Artavahi Damanis. Artavaha dhamani. Female body has two urdhvagami dhamanis. They carry stanya or milk to the sthanas or breast. Analogous to these dhamanis, these are two dhamanis in the male body carrying the shukra. There are two adhogami dhamanis or channels going downwards that carry the artava. Nadi of yoni, there are three nadi: Samirana, Chandramukhi and Gauri. Discussion: Garbhashaya is the place where Shukra and Shonita combines. Uterus is the place where sperm and ovum combines. Garbhashaya is the seat for Bhruna and uterus is the site for growing embryo. Location of Garbhashaya is between Pittashaya and Pakvashaya, and for the uterus it is between urinary bladder and sigmoid colon and rectum. Garbhashaya is covered by Jarayu. Here the Jarayu covering the Garbhashaya can be taken as peritoneum covering the uterus. The mukha of Garbhashaya is like Rohita Matsya Mukha, having the same shape and size of the lips of Rohita fish. Here the lips depict the anterior and posterior lip of cervix. Yoni is said to be the Garbhashaya Dwara Mukha. Vagina can be correlated to Yoni as it is the door for uterus. Yoni is taken among the external orifices. Vagina is also one among external orifices. 4 fascies in Apatya Patha can be correlated to longitudinal and circular muscles of vagina. 3 fascies in Garbha Chidra can be correlated to smooth muscles of the cervix. 3 fascies which help in meeting of Shukra and Shonita can be correlated to longitudinal and circular muscles of the fallopian tube. Conclusion: from the above mentioned information, Garbhashaya can be correlated to uterus by the anatomical position, function, structure, and shape of the Garbhashaya. It can be correlated to uterus. Thank you.
Thank you, doctor. Next, I invite Dr. Sushma P. Patel for the paper presentation. Dr.
Yes,
Sushma.
sir, I'm here.
Okay, doctor. Please share the screen, doctor.
Okay. Good evening, one and all. Today I'm going to present on a topic, understanding the concept of Rukka as Koshtanga and its applied aspects. Content, need for the selection of topic, introduction, aims and objectives, materials and method, discussion and references. Need for the selection of topic. Rukka derived from the root word Rukka Dhane, which means to take. Sushruta has clearly mentioned about the Rukka. He also mentioned the components of Rukka. As compared to other Koshtanga, Rukka is an unique organ of a body for formation, collection, and excretion of urine, as well as purification of blood. According to Charaka Samhita, Ashtanga Sangraha, Kashyapa Samhita, and Bela Samhita, Rukka is considered as Koshtanga. Introduction. Nirukti. According to Amarakosha, Varshati iti Rukka. The word Rukka derived from the word Rishasechana, which means irrigation. Bukkagra Mamsam. This is also from Amarakosha. The Bukka word is also used for Rukka. Rukka is Agramamsa, that is, it composed more of Mamsa. The paryaya of Rukka is Bukka. Aims and objectives of this presentation: conceptual study of Rukka, Upayojita Sharira of Rukka, correlation of Ayurvedic concept of Rukka with the modern concept of kidney. Material and methods. The Utpatti of Rukka. This is from Sushruta Sharira. Rakta Medha Prasadat Rukka. Development of Rukka occurs from Prasada Bhaga of Rakta and Medha. Acharya Charaka has also counted Rukka under Matraja Bhava in Charaka Sharira, 3rd chapter, 6th shloka. Sthana of Rukka. Rukkau Mamsa Pinda Dvayam, Eko Vama Pashvastitaha, Dvitiyo Dakshina Pashvastitaha. Rukkau looks like Mamsa Pindavat and they are 2 in number. One is situated on the left side and other one is on right side. Rukkadvayam, Vaksho Adasta. This is from Charaka Sharira, 7th chapter. Rukka are 2 in number and they are situated below the chest. Vrukkayoho Pashva Sankochaha. This is from Sushruta Nidana. Acharya Sushruta, in the context of Sthana of Vidradi, mentioned that if Vidradi located in Vrukka, there is contracting pain in the sides, that is in Parshva region. This shows Rukka are located on the sides. Akruti, Rukkau Kukshigolakau. This is from Dalana on commentary of Sushruta Sharira, 4th chapter. As per similarity, Rukkau looks like round spherical in shape. Kaleyakam Vrukkam. This is also from Dalana Sushruta Sutra 46th chapter. Dalhana, while explaining about Gurutama Bhaga of Sharira Anga, mentions Kaleyaka as Vrukka, which means Vrukka is Guru, that is heavier than the Anga, which I mentioned earlier in that phrase. Vrukka as Mula. Medavahe Dve Tayor Mulam Kati Vrukkocha. This is from Sushruta Sharira 9th chapter. Medavahanam Srotasam Rukkau Moolam Vapavanam Cha. This is from Charaka Vimana. According to Acharya Sushruta and Charaka, both they have considered Rukka as Moolasthana for Medo Vahasrotas. Rukka as Koshtanga. While explaining about Sankhya Sharira Adhyaya, Acharya Charaka has explained 15 Koshtangas, and Rukka is one among the Koshtangas. Acharya Charaka mentioned Rukkau. That means they are 2 in number. While explaining about Anga Vibhaga Shariro Adhyaya, Acharya Vagbhata explained about 11 Koshtangas, and Rukka is one among the Koshtanga. Rukka as Pratyanga. Pratyangas which are inside the body are again explained and numbered by Sushruta. In that, Rukka is also included. Karma of Rukka, that is functions. Rukkau Pushtikarau Proktau Jatarastha Medasaha. This is from Sharangadhara Prathama Kanda. That means Rukkau nourishes the medas of abdomen. Ahara Jalavahi Siradharau Tila Rukkau. This is also from Sharangadhara Purva Kanda. Tila and Rukkau are base for Aharavaha and Jalavaha Siras. Tila word is synonym for Kloma according to Sharangadhara Samhita. Upayojita Sharira of Rukka. Putti, which means renal cyst. Rukkashmari, which means renal calculus. Rukka Vidradi, which means renal abscess. Rukka Arbuda, renal tumor. Rukka Shota, which means nephritis. Discussion. According to Acharya Sushruta, Rukka is developed from the Prasada Bhaga of Rakta and Meda. According to Acharya Sushruta and Charaka, Rukka is Moolasthana for Medavaha Srotas. According to modern anatomy of kidney, structurally kidney is composed more of fatty layers, that is paranephric fat and perinephric fat. Dalana, the commentator of Sushruta Samhita, mentions Rukkau, that is they are 2 in number and situated in Vama and Dakshina Parshva. Kaviraja Gangadhara, the commentator of Charaka Samhita, also mentions Rukkau and they are situated in Vaksho Adastat. Acharya Sushruta in the context of Vidradi Sthana mentioned that if Vidradi located in Rukka, it does Parshva Sankocha. This shows Rukkau are located on the sides. Kidneys are located one on each side of the vertebral column in the posterior abdominal wall is mentioned in Anatomy of Kidney. According to Amarukosha, Rukka word is derived from Rushasechana, which means irrigation. According to Sharangadhara, Rukkau are base for Jalavahasiras. In Anatomy of Kidney, they are mentioned nephrons are the structural and functional unit of kidney. Series of loop of Henle, collecting tubules and other parts of nephrons are arranged in kidney for secretion, selective reabsorption and collection of urine. From all these criteria, Rukka is concluded as Koshtanga and it can be correlated to kidney by considering its size, shape, location, composition and function. So totally anatomically and functionally, it can be concluded as kidney. Thank you.
Thank you, doctor. So next I invite Dr. Sahana. I invite Dr. Sahana.
Yes, can I share my slide?
Sure, doctor.
Okay. Is my slide visible?
Yes, doctor.
So can I, am I audible?
Audible, doctor. Please
Yes,
start.
you are audible. Please start.
Okay. Good evening, everyone. Myself, Dr. Sahanati, final year PG Scholar, Department of Dravya Guna, STM College of Ayurveda. Hereby presenting on the topic Dravya Prayoga in Vibandha under the guidance of Dr. Prakash L. Hegde, Professor, Department of Dravya Guna, SDM College of Ayurveda. Here comes the content of the slide. The introduction, Nidana, constipation and its causes as is correlated to constipation in the contemporary science, Samprapti and Samprapti Kataka, Rupas and complications of Vibandha, and its general Chikitsa, and Ekala Dravya Prayoga, its formulation, Panchakarma, which can be advised in Vibandha, and its modern management in brief, Pathya and Apatya, and comes to the conclusion. So coming to the introduction, Vibandha can be seen as a Nidana. It's not as a disease can be seen, but it is a Nidana of many of the diseases. So like Lakshana or Upadrava of several diseases. As we know in the classical, Vibandha is not mentioned as a disease. It is a Lakshana or Upadrava of the several diseases. And also it's an improper, it happened due to improper Panchakarma procedures. And it is due to Apana Vata Vaigunya, and its Adhisthana is Purusha Vahasrotas, the Mula of which is Pakwashaya. So Nidana goes like Vegadharana, Akala Bhojana, Akala Vihara, Ruksha, Vishtambi, Gurupaki Ahara Sevana, less intake of water, Ratri Jagarana, Sanniruddha Guda, Vata Dushita, Kshira Sevana, Kashaya Rasa Kshira Sevana, Purishaja Shroto Dushti, Purisha Vegadharana, and Ayoga of Virechana, Niruha Basti, and Anuvasana Basti. So as I said before, Vibandha is not as a disease, as the Lakshanas of particular diseases are Vataja Jvara, Atisara, Purvarupa, Gulma, Purvarupa, Grahani, Vishtabda Ajirna, and in Alasaka, Vibandha can be seen as a Lakshana. Mainly Vibandha is seen in Ajirna, Atisara, and Grahani as a Purvarupa. When we compared to the contemporary science, it is being correlated to constipation and its causes. So constipation is defined as an infrequent passage of the hard stools. Here come the causes. Nidana are poor lifestyles, systemic diseases, anorectal diseases like hemorrhoids or piles or tumors, and structural abnormalities. So here comes the Samprapti, that is Nidana Sevana, which leads to Vata Prakopa, and it leads to Kupita Vata Dwara Pakwashaya, and Mala gets Shoshana due to Vata Prakopa, and it causes Rukshatva, that causes Vibandha due to the Vata Prakopa in Pakwashaya. Here's the Samprapti Kataka. Dosha is Kupita is Vata and Kapha, Dusha is Purisha, Agni is Jataragni, Srotas is Purisha Vahasrotas, Sanchara, Adhogami, Adhisthana is Pakwashaya, Swabhava is Mrudu, Marga is Bhaya or Abhyantara, Sadhya Sadhyata is Sadhya, and Sroto Dushti is Sangha. So Rupas of Vibandha are Anaha, Admana, Udarashula, Shirashula, Utsahahani, and Alasya. So complications of Vibandha are Udavarta, Anaha, Admana, Harshas, and Parikartika, Antaruddhi, and Bagandhara. So coming to the Chikitsa part, mainly Sharangadhara has mentioned 4 main karma, that is Anulomana, Bedana, Rechana, and Sramsana, in which he has quoted a different particular drug which does the different actions. Anulomana, that is Haritaki, Bedana, Katuki, Rechana, Trivrit, and Sramsana, Aragvada. So definitely when it is Vibandha, we can go for a Virechana, classical Virechana. So in that Sukha Virechana example, you can give Trivrit, and Mrudu Virechana, it is Aragvada, and Tikshna Virechana, it is Nuhi Paya. So it is Haritaki, Trivrit, Aragvada, and Katuki. Then we have a reference from different classical textbooks. We have taken from Eranda Thaila mixed with double quantity of the Trifala Kwata plus Eranda Thaila plus Shira. That will relieve from the Vibandha. And this reference is from Madhavanidana, Draksha Swarasa or Ushna Jala or fresh asava prepared with Draksha will relieve Vibandha. And this yogas is being taken from Sushruta Samhita, Ashwadhyaya, in that in Arshas Rogi, when the patient has Arshas, Shunti Churna plus Sharkara should be given as intake. And the Prasanna is a type of Madhya plus Sattu plus Saindava Lavana plus Grita should be administered. Then we have Amla Rasa Phala, any Amla Rasa Phala you can take, plus Guda, plus Shunti Churna, plus Pata Churna should be given as an intake. And one more is Guda plus Gogruta plus Evakshara will relieve from the Vibandha. Apart from Haritaki, here gives special, there is one more reference where Karanja Patra should be fried with Tilataila along with Gogruta mixed with any Yava will act as an Anulomana. So in comes the churna, different formulation which can be given in Vibandha. This is according to, these are the few formulations which I have taken from Ayurveda Formulary of India. That is Mahanimbadi Churna, Lavangadi Churna, Krishna Bijadi Churna, Swarna Patriyadi Churna, Saugandhika Churna, Chopa Chinyadi Churna, Lavana Bhaskara Churna, Yavani Churna, and Vaishavanara Churna, which is mostly used. Highly practiced here, and Samudra Deva Churna, Hingu Vachadi Churna, Navipatikara Churna. Then comes the Vati, Rechana Vati, Vishamushtika Vati, and Kesari Vati, and Shula Kutara Rasa. Asava, the Asava reference is from Sahasrayuga, that is Palasha Pushpa Asava. Panchakarma, which can be administered is Snehapana with Tailo or Grita. Svedana Karma, Niruha Basti or Anvasana Basti can be administered. So when it comes to contemporary science, management of constipation is almost similar to our classics, whatever it is mentioned. So it is a minimizing use of drugs which causes constipation, because many of the modern or any contemporary science, due to long-term usage of medications, will lead to constipation. So minimizing the use of drugs would prevent a person from having constipation, and having the bulb-forming laxatives and rich intake of fiber and adequate water quantity and regular exercises. So when it comes to Patya, Ahara, Purana Shali, Goduma, Mudga, green leafy vegetables, and papaya, carrot or radish, and sufficient much water intake. Vihara, Svedana, once in 3 months when you take a Virechana, which is mentioned in classical, Basti, Vyayama, Chankramana, reduce water intake immediately after food. Apatya, Ahara, Guru Ahara, rice which is uncooked, which is not properly cooked, will lead to Gurutva, it will lead to the Vibandha, and more to have a Soshana with the food which is very much dry, that should be avoided. So Vihara is Ratri Jagarana, where Ratri Jagarana or Vegadharana, Avyayama and prolonged sitting. Ratri Jagarana, due to it leads to Vata Prakopa, and which would lead to the Vibandha. Comes to conclusion, as Vibandha is not mentioned as a disease but as one of the symptom of many or group of diseases, one should treat the main diseases to get relief from the Vibandha. Proper lifestyle would be preventive measures to avoid Vibandha. So many of the drugs which are used here as a single drug herbs which are used, which has a Tikta Rasa Pradhana, which has a property of Deepana Pachana and Lekana Karma, which would relieve you 1% from the Vibandha. Thank you.
Thank you, doctor.
So next, Dr. Tanuja Shivnath.
Yes, ma'am.
Doctor, you are audible. Please share the screen.
Hello, Dr. Tanuja.
Yeah, I'm trying to share my screen. Just give me 1 minute.
Okay, doctor.
Is my screen visible?
Yes, doctor, visible, doctor. Please chat.
Hello, my name is Dr. Tanuja Vyavahari, and my topic is experimental study of assessment of hepatoprotective effect of Haridra grit on isoniazid-induced hepatotoxicity in rats. So these are the contents. First, going to introduction. The initial phase of treatment of TBs consists of 8 weeks of the drug isoniazid, rifampicin, pyrazinamide, and ethambutol. Isoniazid remains mainstay for the treatment of tuberculosis. INH itself is directly bioactivated to a reactive metabolite, which leads to liver injury. Toxic effects of isoniazid can be compared with Garavisha concept of Ayurveda, as it is artificial poison and does not cause immediate mortality. Haridra grit is being used in this study because in previous researches, Haridra shows antioxidant and hepatoprotective properties, and both contents of Haridra grit, that is Haridra and Grita, are Vishagna, easily available, affordable, and included in our daily diet. Need and rationale of study. For drug-induced hepatotoxicity, that is DIH, different reintroduction regimens have been advocated, but no consensus guidelines are available. Hence, work on DIH should be done. Both contents of Haridra grit, as I said before. which are Vishagna, easily available, affordable, and included in daily diet. Hence, chances of side effects are minimized and cost will be also minimized. So, research question will be: is Haridragrit effective against isoniazid-induced hepatotoxicity in rats? Uh, the null hypothesis will be Haridragrit is not significantly effective against isoniazid-induced hepatotoxicity in rats. An alternative hypothesis will be Haridragrit is significantly effective against isoniazid-induced hepatotoxicity in rats. Primary objectives to assess the efficacy of Haridragrit on isoniazid-induced hepatotoxicity, then observation of histopathological changes in liver and biochemical evaluation of toxicity induced by isoniazid, similarly after administration of Silymarin, and then after administration of Haridragrit. Secondary objectives will be to prepare Haridragrit as per standard procedure, to assess the concept of Garavisha and hepatotoxicity as per Summaiyah. Purpose of study: to observe the toxic effect of isoniazid on animal body, treat hepatotoxicity by using Silymarin, study whether Haridragrit acts against hepatotoxicity, compare efficacy of Haridragrit with Silymarin against isoniazid-induced hepatotoxicity. So methodology will be: study design will be experimental study. Study will be carried out in 2 phases: drugs formation and standardization, and then experiment on animals. Location of study will be institutional ethics committee and animal ethics committee, and then the study will be conducted in my college only. Drug preparation and standardization. First is Haridragrit. First Murchana of Grita will be done, then preparation of Kalkadravya, preparation of Haridragrita. Preparation of Haridragrita, there are some references in Ashtang Sangraha and Sharanga Samhita. हरिद्रादिकं पृथक् तिष्ट्वा घृतत्रयं विपाचयेत् तैनेकं घृतं हरिद्रा द्वितीयं नाकुला तृतीयं जात्या कल्कचतुर्गुणीकृत्यं घृतं वा तैलं वा चतुर्गुणे द्रवे साध्यं तस्य मात्रा फलोन्विता. So Haridra will be taken in paste form and Murshid Ghrita in quadruple amount to that of Haridra paste. This mixture will be heated until the water gets totally evaporated. Then the remaining substance will be considered as Haridra Grit. This will be in vivo study. Animal species to be used will be rats. Average weight will be 180 to 200 grams. 6 animals will be there in each group. Number of groups will be 4. Age of animal will be 6 to 7 weeks. Gender of animal 50% male and 50% female. And route of drug administration will be oral route. Inclusion and exclusion criteria. In inclusion criteria, both male and female rats, then more than 6 weeks and less than 10 weeks of age will be selected, and weight will be taken as 120 to 180 grams. And pregnant rats will be excluded. Study design: group 1 will be control group. Hepatotoxicity will not be induced by isoniazid. Then group 2 will be disease group. There hepatotoxicity will be induced. In group 3 will be standard group. Hepatotoxicity will be induced by isoniazid and Silymarin will be given. And in group 4, hepatotoxicity will be induced by isoniazid and Haridragrit will be given. Duration of total study will be 18 months. Dose calculation: rat dose will be human dose into 0.018, that is conversion factor. And doses will be as follow: Haridragrit 0.8 ml per kg and Silymarin 100 mg per kg. The parameters to be used will be SGOT, SGPT, serum albumin, bilirubin, alkaline phosphatase, and histopathology. Same criteria will be assessed for all groups. This data will be presented in appropriate charts and tables. Procedure: 24 rats will be selected by random sampling. They will be divided into 4 groups. Hepatotoxicity will be induced in group 2nd, 3rd, and 4th respectively, with administration of isoniazid, that is 50 mg per kg by oral route for 21 days. Respectively, in group 3rd and 4th, Silymarin or Haridragrit will be given for next 21 days. Blood samples will be collected on 0, 21st, and 42nd day. Then all the SGOT, SGPT, etc. tests will be carried out. After investigation, animals will be sacrificed for histopathology of liver and biochemical examinations. Results, conclusions, summary, etc. will be scientifically documented, and according to the data collected and observations, discussion will be done. These are some textual references. Sayogam channel, etc. are there. Actually, I have collected them from multiple Samhitas. Thank you.
Thank you, doctor.
Thank you, doctor. So next I
Next, I invite Dr. Mamta Devi for the paper presentation. Dr. Mamta Devi, are you there?
Yes, sir.
Okay, doctor. Please share the screen, doctor.
Yes, sir.
Your screen is visible, doctor. Please chat.
So my screen is visible?
Yes, doctor. Visible, doctor. Please chat, doctor.
Yes, sir. Good evening, everyone. Myself, Dr. Mamta. I'm MD Scholar, third year student from Department of Rashastra and Vaishajya Kalpana from Government Ayurvedic College, Patiala. So my topic is thin layer chromatography, TLC. Key concepts are introduction, general principle, TLC technique, and applications. Introduction. Thin layer chromatography, TLC, is an important technique used for identification and separation of mixture of chemical compounds into its individual components. TLC is a form of liquid chromatography consisting of two phases, that is, a mobile phase liquid and a stationary phase, that is solid. Differences in the interaction between the solute and stationary and mobile phase enable separation. So next is principle. TLC technique involves the distribution of component of a mixture to be separated between two phases. The component of the mixture are partitioned between an adsorbent, that is stationary phase, and the solvent, that is mobile phase. Different compounds will have different solubility and adsorption to the two phases between which they are to be partitioned. In TLC, separation of the individual substances is based on their relative affinities towards the stationary and mobile phase. The stationary phase is a thin layer of adsorbent, usually silica gel or alumina, coated on a plate. The mobile phase is a developing liquid which flows through the stationary phase, carrying the samples with it. Components with a more affinity towards stationary phase travel slower. Methods: adsorbent used as stationary phase, that is inorganic. First is inorganic, that is silica gel, aluminium silicate, bentonite. And organic adsorbents are cellulose and its acetate, uh, charcoal and activated charcoal, dextrine gel, and polamides. Solvent used as mobile phase, that is petroleum ether, benzene, carbon tetrachloride. Selection of adsorbents and solvents. Adsorbents should not adhere to the glass plate. Solvent should be high purity, selected based on the nature of the compound to be separated, polar or non-polar. RF value. RF value indicates the position of migrated spots on chromatogram. In TLC, the results are represented by RF value, which represents the migration of solute relative to the solvent front. The RF value is calculated as RF value is equals to distance traveled by the solute by distance traveled by the solvent front. Technique. Step 1. Preparation of slurry. A plastic, glass, or aluminium sheet is coated with a thin layer of silica gel adsorbent, that is adsorbent. Plates must be dried, activated, and stored in desiccator until used. Step 2. Preparation of tank. Solvent mixture should be freshly prepared from analysis. Solvent is poured down side to the of the tank, that is 1.5 centimeter. Technique. The TLC is developed in a chamber which contain the mobile phase solvent, which when the mobile phase rises up, the plate up by capillary action, the component dissolves in the solvent and move. Technique. Individual component in the sample move up at different rates. More polar analytes interact more strongly with the stationary phase, move very slowly up. More non-polar analytes interact less strongly with the polar silica gel and more strongly with the less polar mobile phase, move higher up. Once the solvent reaches the top of the TLC sheet, the plate is removed from the developing chamber and position of the solvent front is marked. The solvent is allowed to evaporate from the TLC sheet as the compound is colorless. It can be visualized by suitable methods: lipids, iodine vapors, amino acids, ninhydrin reagent. Also, manganese activates zinc silicate fluorescent compound is added to the adsorbent that allow the visualization of spots under a black light, that is UV 254 lamp. That lamp is specialized UV 254 lamp. Results of RF value. Qualitative results of TLC expressed as a fraction of 1.0 can be expressed from RF value no more than 2 decimal places. RF value can be used to aid in identification of a substance by comparison to standards. Comparison should be made only between spots on the same sheet run at the same time. Identical substances will have the same RF value, whereas non-identical compounds will differ in RF values. Applications. TLC is used in qualitative and quantitative analysis to separate organic compounds and to test the purity of compounds. This technique is useful for separation of lipids, amino acids, and sugars, etc. It is useful in identification of compounds of a mixture following the course of a reaction. Analysis fraction collected during purification, analyzing the purity of a compound. Thank you.
Thank you, Doctor. Next, I invite Dr. Mahalakshmi Vilagi for the paper presentation. Dr. Mahalakshmi,
Yes, sir.
please share the screen, Doctor.
Yes, sir.
Your screen is visible, Doctor. Please start.
Okay, sir. Thank you, sir. Good evening to one and all. Myself, Dr. Mahalakshmi Vilagi, second year PG scholar, Department of PG Studies in Shalya Tantra. Today I am presenting a paper on the topic Jalokacharana, abyss of parasurgical procedure. These are the contents of my topic. Coming to the introduction, as we all know, Raktamokshana is one among the Panchakarma. In that, Jalokacharana comes under a Shastrakata type of Raktamokshana. And in classics, in Sutras, Sushruta Samhita Sutra Sana 13th chapter and Ashtanga Hridaya Sutra 26th chapter, we get the detailed explanation about this Jalokacharana procedure. Next, coming to the these qualities of Jaloka, the Jaloka which we used in day-to-day life for the Jalokacharana procedure, it should be strong and it should have long body and it should be Shava or Nila in Varna and it should be Vata and it should be collected in Sharadutu and should be preserved in a pot containing lake water added with leaves of the aquatic plants. And the Jaloka which is prepared for the Jalokacharana procedure is medicinalate. And there are two types of Jaloka, that is Sarvisha and Nirvisha. And Sarvisha includes Krishna, Karbura, Alagartha, Indrayuda, Samudrika, and Gochitra. And Nirvisha includes Kapila, Pingala, Shankarika, Mushika, Pundarika, and Savarika. These are the indications of Jalokacharana procedure which has been explained in our classics. Apart from this, there are some other indications like it can be used in coronary heart diseases and in cancer condition for the management of pain and in the field of plastic surgery, skin grafting, and the management of keloid acute pain and in, in the management of thrombophlebitis and Vranashopa and in the diseases of skin, Dushta Vrana, and in vascular pathologies also this Jalokacharana is indicated. Similar to the indication, there are some contraindications also. It includes in case of acute absolute hemophilia and in severe anemia and intestinal GI bleedings, if the patient is immunocompromised, hypotensive, or if the patient is TB positive, pregnancy, and in case of mental disorders during the active episodes and severely ill or bedridden patients, and if the patient is on anticoagulant or during the chemotherapy procedures, this Jalokacharana is contraindicated. Next, coming to the constituents of this leech, saliva. Saliva of the leech contains various enzymes and bioactive substances like hirudin, kallin, hiristasin, and hyaluronidase, and these are having the properties like antithrombin, antiplatelet activation, anticoagulant and antibiotic effect. And the enzymes like iglins and debellins, these are having anti-inflammatory activities, and these inhibit the activity of the trypsin and chymotrypsin and other chemical agents which are released during the inflammation process. And the enzyme like destablishin, it dissolves the fibrin, so it is indeed, this helps in the management of the keloid. And the acetylcholine, it acts as a vasodilator, and because of these properties, it is used in the management of various diseases. Next, coming to the procedure, it can be divided into Purva Karma, Pradhana Karma and Paschat Karma. We get the detailed explanation about the Jalokacharana procedure in Sushruta Sutras 13th chapter, that is Jalokacharaniya Adhyaya. These are the pictorial representation of the Jalokacharana procedure. Next, coming to how these Jalokacharanas helps in the management of the different conditions. Here are the some of the cases in this, how this Jalokacharana helps in the management of the diseases we'll discuss. In the case of Sandhigata Vata, that is osteoarthritis, when you look at the pathologies, because of the interleukin enzymes, there will be destruction in the cartilages. Because of that, patient will be having pain, stiffness and inflammation. As the saliva of the leech contains anti-inflammatory activities, this inhibits the action of this interleukin, thereby it breaks the pathology and improves the condition of the patient. And vasodilatation activity of this Jaloka, it helps in the circulation at the site and thereby reduces the pain. And in Vata Kantaka, because of the bony protrusion, patient will be having pain and swelling because of the irritation to the tendon, like in for the Achilles tendons, and the patient may suffer with plantar fasciitis and all. And this the Jalokacharana helps in reducing the pain, swelling and inflammatory symptoms. And when we look at the Vranashopa or in Vidradi, in Chikitsa of the Vranashopa, Acharya Sushruta has explained the concept of Saptopakrama. It includes Vasechana, that is Rakta Mokshana, and the Jalokacharana comes under this Rakta Mokshana only. So we can use this Jalokacharana in case of Pranashopa for the management, for the reducing the inflammatory symptoms like tubercular, dollar tumor and functional and varicose vein. When we look at the pathology, because of the valvular incompetency, there will be accumulation of the blood along with the toxins like P substance and all, and because of that, patient will be having itching and discoloration, that is the varicose eczema and all. This Jaloka suck the impure blood along with these chemical substance and other toxins, thereby it reduces the edema, hyperpigmentation and link girth and dragging pain. In thrombospleismus, patient will be having throbbing type of pain because of the thrombosis, and the anti-inflammatory, anticoagulant and antiplatelet aggregating activities of this Jaloka enzyme. These helps in the increasing the circulation at that side, and further clotting of the prevent the further clotting of the blood at the inferior hemorrhoidal plexus. Thereby, this reduces the pain. And when you look in case of keloid is a fibroproliferative disorder. In this, by doing Jalokacharana, there is decrease in the size of the keloid because the enzymes which are present in the enzymes like destablishin, these dissolves the fibrin and prevent the conversion of fibrinogen into the fibrin. And vasodilatation activity increases, it improves the circulation at that side, thereby it decreases the itching, and there will be decrease in the size of the keloid and improves the condition of the patient. In case of Dartika, as it is Raktaja Pittaja Vikara, this by doing Jalokacharana procedure, it decreases the Kandu, Shrava and discoloration, and thereby it gives Teja or Kanti to the skin. So it decreases the pain, itching and discharge at that side. In case of Vata Rakta, it is nothing but the Gautri arthritis. In this condition, patient will be having multiple joint pain along with the swelling, redness and inflammation. As the saliva of the leech contains anti-inflammatory activities, this reduces the pain, swelling, erythema at that side, and thereby it helps in the management of Vata Rakta also. Coming to the observation and results, by doing this, we can see the changes after doing one setting of Jalokacharana also. By doing repeated settings of Jalokacharana, we can see the improvement in the condition of the patient. So we can tell that Jalokacharana is an effective treatment modality in the management of many diseases. Coming to the mode of action, it is having anti-inflammatory, anti-metastatic activity, vasodilatation, anticoagulant, anesthetic, and anti-platelet coagulation activity. Because of these properties, we can use this Zelocacharna in different conditions. And coming to recent advances, it can be used in case of dentistry and ENT and in eye disorders also, and it is become more famous nowadays in the field of plastic and reconstructive surgeries. Coming to the complication, it includes prolonged bleeding time, bacterial infection, allergic reaction, and because of the vasodilation activity, patient may land up in hypotension, and patient may have fever, local pain, and itching. Coming to discussion, as leaf chiva contains various enzymes like hirudin, halin, anesthetic compounds, and antihistamines and all, it can be used in various disorders like Sandhigata Vata, Vata Kantaka, varicose vein, Varnashofa, and thrombospasm, keloid, and Vichashika, and many more diseases. To conclude, on the basis of above studies, we can conclude that Jalokacharna conducted in different conditions, it shows marked relief in the management of diseases, and it is a simple, easy, and effective day care parasurgical procedure, and it is a cost-effective, less time-consuming, and localized way of bloodletting to prevent this surgical condition. It can improve the quality of the life by improving the patient condition. Take-home message: Jalokacharna procedure. It's a divine boon to parasurgical procedure. Let invoke it. Thank you.
Thank you, Dr. Mahalakshmi. Next, I invite Dr. Swarupa Sadanand Saraf for the paper presentation.
Thank you, sir.
Yes, sir.
Okay, doctor. Please share the screen, doctor.
Can I share my slide? Hello?
Sure,
Can I
doctor.
share my slide?
Please share the slide, doctor.
Okay.
The slide is visible, doctor. Please start the session.
Okay. Hello everyone, Swarupa here. I am from GSC Nanded, second year PG student from Rognidan department, and today I am going to represent examination of feces in various diseases. Waste products excreted from the digestive tract are composed of water, indigestible residue, undigested food, and food which is digested but not absorbed, bile, epithelial cell, secretion from digestive tract, inorganic material, and bacteria. Actually, normal amount of feces in adult is 100 to 200 gram per day. So let us see use of laboratory examination of feces. Examination of feces is helpful in investigation of diseases of the gastrointestinal tract as follows. Detection of parasite. Stool examination is done for detection of worm and protozoa. Then the evaluation of chronic diarrhea. Chronic diarrhea actually refers to passage of 3 or more loose or liquid stool per day lasting for more than 4 weeks. Acute diarrhea is defined as passage of 3 or more loose or liquid stool per day for less than 4 weeks. In diarrhea, stool examination is important part of laboratory workup. Depending on the nature of information, either random stool sample or 48 or 72 hour sample is collected. Random diarrhea sample can be tested for occult blood, fat, pH, white blood cell, culture or microscopy. A 48 or 72 hour sample is examined for weight, fat content, carbohydrate, osmolality or chemotrypsin activity. Then evaluation of dysentery. Identification of positive organism is definitive in differentiating amoebic from bacillary dysentery. Then bacteriologic examination. Infection by bacteria such as Salmonella, Shigella, Vibrio, Yersinia or Clostridium can be identified by stool culture. Bacterial toxin can also be identified. Chemical examination, in which chemical tests can be applied on feces to detect occult blood, for gastrointestinal tract, excess fat excretion, and presence or absence of urobilinogen. Then we will see what are the chemical examination. Chemical examination of feces is usually carried out for the following tests, that is occult blood, excess fat excretion, urobilinogen, reducing sugar, fecal osmotic gap, and then lastly fecal pH. Test for occult blood in stool, that is presence of blood in feces, which not apparent on gross inspection, but which can be detected only by chemical test, is called as occult blood. Causes of occult blood in stool are the firstly intestinal diseases, which are that is the hookworms, amoebiasis, typhoid fever, ulcerative colitis, intussusception, and the cancer of colon or rectum. Then gastric and esophageal diseases, that are peptic ulcer, gastritis, esophageal varices, and hiatus hernia. Then systemic disorder in which bleeding, diarrhea, and diathesis and uremia are involved. Then long distance runners. Actually, occult blood test is recommended as a screening procedure for detection of asymptomatic colorectal cancer. Yearly examination should be carried out after the age of 50 years. Tests for detection of occult blood in feces, that are many tests are available, which differ in their specificity. But these tests include tests based on peroxidase-like activity of hemoglobin. Tests based on peroxidase-like activity of hemoglobin principle are the hemoglobin has peroxidase-like activity and release oxygen from hydrogen peroxide. Then the benzidine is also highly sensitive, uh, which have a false positive reaction, which are common. And cause of false positive test is indigestion of peroxidase containing food like red meat, fish, then spinach or cucumber. And diet should be free from peroxidase containing food for at least 3 days prior to testing. Causes of false negative test, that is food containing large amount of vitamin C. Then immunochemical test. This test specifically detect human hemoglobin. Therefore, there is no interference of animal hemoglobin, example meat, or peroxidase containing vegetable in diet. The test consists of mixing the sample with the latex particle coated with the anti-human hemoglobin antibody. And if agglutination occurs, then test is positive. Then we will see test for malabsorption of fat. Actually, dietary fat is absorbed in the small intestine with the help of bile salt and pancreatic lipase. Fecal fat mainly consist of neutral fats, fatty acid, and soap. Normally, very little fat is excreted in feces. Excess of excretion of fecal fat indicates malabsorption, and that is known as steatorrhea. It is manifest a bulky, frothy, and pole-smelling stool which float on the surface of water. And the causes of malabsorption for fat is deficiency of pancreatic lipase, deficiency of bile salt, which is biliary obstruction, severe liver diseases, then disease of small intestine, which is celiac disease, Bipolar disease. The tests for fecal fat are qualitative, which is direct microscopic examination, and quantitative, that is estimation of fat. And next is the test for urobilinogen in feces. Specimen should be fresh and kept protected from light. Normal amount of urobilinogen excreted in feces is 50 to 300 mg per day. Increased fecal excretion of urobilinogen is seen in hemolytic anemia, and urobilinogen is decreased in biliary tract obstruction, severe liver diseases, oral antibiotic therapy, and aplastic anemia. And if stool become pale or clay color, then urobilinogen is reduced or absent. Then test for reducing sugar. Deficiency of intestinal enzyme lactase is a common cause of malabsorption. Lactase convert lactose to galactose and galactose. If lactase is deficient, lactose is converted to lactic acid with production of gas, which cause diarrhea, vomiting, and failure to thrive. So Benedict test is carried for reducing sugar. Then next is fecal osmotic gap, in which concentration of electrolytes in stool are calculated. In osmotic diarrhea, osmotic gap is 150 osmo per kg, while in secretory diarrhea, it is typically below 50 osmo per kg. Then lastly, fecal pH. When stool pH is below 5.6, then characteristic is carbohydrate malabsorption, that is lactose deficiency. Thank you.
Thank you, doctor. Next, I invite Dr. Meet Sharma for the paper presentation. Dr. Meet Sharma, are you there? Hello, Dr. Meet Sharma, are you there?
Yes, sir. Yes, sir. Am I audible?
Audible, doctor. Please share the screen,
Hello.
doctor.
Yes,
You are
sir.
audible, doctor. Please share,
Yes,
doctor. Your screen is visible, doctor. Please start the session.
Good evening, everyone. Myself, Dr. Meet Sharma. Today's topic of my presentation is interpretation of Prasaranyadi Tela under the guidance of Dr. Girish KJ, sir. I'm from SDM College, second year PG scholar, Department of Patheya. Prasarani Tela is a preparation used for Vata Vyadhi. In total, there are 10 formulations in the name of Prasarani Tela. Firstly, explained by Sharanga Samhita in Ghrita Tela Kalpana, Sharanga Samhita Madhyama Kanda. The total 8 references are explained in Beshatra Ratnavali, among which 7 are explained in Vata Vyadhi Rogadikar and 1 is explained in Namavata Rogadikar. All the 8 references mentioned in the Beshatra Ratnavali are in the name of Prasarani Tela with different prefix and ingredients. One reference is available in Sahasra Yogam. In AFI, Saranga Samhita's reference is also available. Beshatra Ratnavali, Amvata Rogadikar, it is in the name of Prasarani Tela, while as in Vatavadi Rogadikar, there are it is available in the name of Pushpraja Prasarani Tela, Kubja Prasarani Tela, Tishtita Prasarani Tela, Sapta Shashtik Prasarani Tela, Ekadash Dishashtik Prasarani Tela, Ashta Dishashtik Prasarani Tela, and Maharaja Prasarani Tela. This is a shloka available for Saranga in Saranga Samhita, that is Prasarani Palashatam Jaladrona Pachi, Pada System Srute Grahya Telam Dadiche, Tutsamam, Kanjikam Je Samam Telam, Sheelam, Telam Chaturganam, Tailat Ashtam Anchena, Sarvakalina Yoje, Madhukam Pipli Mulam, Chitraka Sandavacha, Prasarani Devadaru, Rasna Jay Kadipipli, Ballataka, Pushpacha Mansi, Chebhir Vipachare. So these are the ingredients of that are available in Prasarani Tela. Prasarani in that is 100 pala, which is equals to 4.800 kg. Jaladroni, which is 200 liter. Taila 3.072 liter. Dadi is also in same quantity. Kanjika is also equal to Taila and Dadi. Shira, 4 parts of Taila, that is 12.288 liters. Kalkadravya in total of 1/8 of Taila, that is 32. Total is 382 grams. And other than that, these are the other ingredients are available in Prasarani Tela. Method of preparation. Initially, prepare quart of Prasarani Tela using 100 palas of Prasarani Tela and 1 Adroni Jala and reduce it to 1/4. 64 pala of Murchita Tela is taken and Prasarani Quata prepared along with all the kalkas. Kalka dravyas are added and heated in Mandagni until watery content of Quata evaporates. Then Dadi is added, followed by Kanji and Godugda and heated until Siddhi Lakshanas appear. So indications are commonly prescribed in Vatshleshma Vikar, Stamdata in Hanu, Kati, Prishta, Shira, Griva, Kubjita, Gridrisi, Ardita, Khanja and Pangu. There is another reference of Prasarani Tela available in Beshajarat Navali, which says Prasaranya Rasai Siddham Telam Erandam Bibit Sarvadosh Haraschaiva Kaf Roga Haraparam. Method of preparation, according to Beshajarat Navali, it says 8 prasta Prasarani Swarasa added to 2 prastas of Eranda Tela and heated up to Tela Paka Lakshanas are obtained. Doses 1 to 2 Tela Anupan water, milk or water indication kapha rogas. This is another Prasarani Tela reference available in Sahasra Yogam, which says Prasarani Tula Kwate Tailam Prasastam. Excuse me. Payasamam, Divi Meda, Mishe Manjista, Kushta Rasna, Kuchandanai, Jivakaha, Rishwakaha, Kakoli, Yugmala, Darubi, Kalkai Vipacharet Sarvam Marutamya Nashanam. This is a reference available in Sahasra Yogam, and these are the ingredients of it. So these are the researches on Prasarani Tela, a comparative clinical study to evaluate the efficacy of Griva Basti with Prasarani Tela and Nasya Karma with Pranikshira Tela as Pradhana Karma in Griva Sandhigat Vata with special reference to cervical spondylosis. Conclusion. Prasarin Tela is a classical formulation that keeps Vata and Kapha dosha in the balanced state. Acharya Sarangar's reference is one which is widely used. The reference of Sarangar is most common, is almost similar to that of Kubja Prasarini Tela, explained by Vaishyaja Ratnavati, which contains Bala as one of the Kalka Dravya, and the quantity of Shira is available is half of the quantity mentioned by Acharya Sarangar. In day-to-day practice, Tela is given generally used for external uses for the treatment of pain and stiffness in joint, sciatica, rheumatoid arthritis, kyphosis, paraplegia, facial palsy, etc., which helps in reducing the pain, swelling, and stiffness. The Tela is vastly used for Vata condition and also with Vata Anubandha with Kapha conditions. Probable mode of action for Prasarani Tela. The formulation contains certain herbs that are enriched with active components. One of the main drug is Prasarani, known to have phytochemicals such as cetosterol, stigmasterol, iridoid, glycosides, alkaloids, carbohydrate, protein, amino acids, etc. Other herbal contains the phytochemicals such as phallopotannins, cormarins, glycyrrhizin, anthraquinone, amidins, leucoanthocyanins, and isoflavones. These phytochemicals are known to provide therapeutic properties such as antioxidant, analgesic, anti-inflammatory, stimulatory, and properties control problems related to painful and injurious stimulus by sensory neurons. The anti-inflammatory property to provide relief from muscles and joint pain and stiffness. Thank you.
Thank you.
Thank you, Doctor. Next, I invite Dr. Saudi MS for the paper presentation. Dr. Saudi.
Yes, sir.
Please share the screen, Doctor.
Yes, sir.
The screen is visible, Doctor. Please start the session.
Thank you. Good evening, all. Myself, Dr. Swati. I'm from Sri Sri College of Ayurvedic Science and Research, Bangalore. I'm from Department of Swasthavritta. My topic is role of Ayurveda in occupational health of night shift workers. We all know a beautiful quotation that Udyogam Purusha Lakshanam. That is, occupation is an integral part of people's life as it has a great impact on the quality of life. The major portion in our community are the working population, as they spend their 1/3 of their lifetime in their working environment. So it is very important, we, the doctors of healthcare profession, to promote health, prevent disease, and maintain the working capacity of the workers. According to International Labour Organization and WHO Committee, occupational health is defined as the branch of community medicine that deals with the study of health promotion, health protection, and maintenance of degree of mental and social well-being of a worker in all occupations. So, night shift workers are becoming very prevalent due to globalization, social and economic causing, which causes the misalignment of the circadian rhythm and which has a negative impact on the health status of the worker. So in Ayurveda, Nidra is considered as one among the Trayopasthamba. So if one suppresses Nidra, it leads to Moha, Murta Gaurava, Akshi Gaurava, Alasya, Jumba, Angamada, and also causes Vata Prakopa and Rukshata and Vataja Vikaras in our body. The main aim of this study is to minimize the adverse effect in the night workers by using Ayurvedic interventions. So the problems that are faced by the night shift workers are gastrointestinal problems like flatulence, ulcer, gastritis, inflammatory bowel issues. In order to avoid that, intake of ghee, light foods, which helps in compensation of this gastrointestinal problems, and also metabolic disorders like diabetes, hypertension, and obesity. So in such cases, diet and lifestyle modifications can be advised. And in mental health conditions like irritability, nervousness, anxiety, mood disorders, Sattva Jaya Chikitsa and yoga therapies can be explained to the patients. Next is management. Like Nidra Nasha Chikitsa can be applied for the night shift workers in case of Ahara, Kshira Dadi, Shalyana, Goduma, Pishtana, Mamsarasa, Madhya, Ikshu Vikaras, Draksha, Sita, Madhura Stigdha Aharas can be advised. Whereas the therapeutic measures like Abhyanga, Udvartana, Utsadana, Samvahana, Snana, Murda Thailam, Karnapuranam, Akshitarpana, Shirodhara, Mukalepa can be advisable. And coming to the conclusive point, that is the main aim of Ayurveda is to swastasya swastaraksharam aturasya vikara prashamnam. So Ayurveda provides both promotive as well as the primitive services to all the occupational health workers, occupational health, which in turn helps to decrease the intensity of the occupational hazards like physical, chemical, mechanical, etc. So to improve the immunity and overall strength of a person, dietary advices and lifestyle changes can be applicable.
Hello, doctor.
Yes, sir.
Doctor, slide is not moving, doctor.
And now, sir?
Not moving, doctor.
Now?
No, doctor.
Now, sir, at which slide it is stuck, sir?
It is in first slide, doctor.
Beginning slide.
Sorry for the inconvenience. So now
doctor,
is it possible?
Please change the slide, doctor. Turn off the presentation mode and change the slide, doctor.
So just give me a minute, sir. So can you please share the screen, sir?
1 second, doctor. Hello, doctor.
Hello, yes, sir.
Doctor, please check the slide, doctor.
Yes, sir. So can you next slide? Should I start from the beginning or is it fine to continue, sir?
Please continue, doctor.
Yeah. Can you go to discussion slide number 2, sir? Next. Yeah. So on the daily basis, we can follow Abhyanga, Samvahana, which helps to get rid of the fatigue and pacify the Vata and overcome the sleeplessness. And also from Samvahana, it helps in pacifying the Vata and kapha, removes fatigue and soothes the body. Next is the yoga. which helps to tone up the abdominal organs and which balances endocrine system, stimulates nervous and circulatory system, and which helps in reducing the stress. And small stretches and short meditations in between the work hours can help to overcome the drowsiness, fatigue, and physical strains. And also yoga nidra, which is a guided meditation relaxation technique that provides physical, mental, and emotional relaxation. And also it is not like an ordinary sleep, which is higher than the ordinary sleep. Next, sir. Conclusion. Night shift workers are the unavoidable part of many occupations due to various reasons. So the tolerance of the working capacity, diet, behavior, everything depends on the prakriti of the individual. That is by following the proper diet, lifestyle, and regimens which are suitable to a particular prakriti, which helps in preventing the adverse health effects which are causing from night shift working. Next. And then administration of rasayanas also helps in improving the immunity, enhances the working capacity by preventing the ill effects due to working at night hours. And in Ayurveda, it can help the night shift workers in two ways, that is by preventing the adverse health effect and by adopting the sleep hygiene, diet, and lifestyle, and also treating the disorders which are arising from the night shift working. And these are the list of references. Thank you.
Thank you, doctor. Next, I invite Dr. Sujita Aravind Patel for the paper presentation. Dr. Sujita.
Sir, am I audible? Hello.
Yes, doctor. Audible, doctor.
Sir, please can you share the screen for me?
1 second, doctor. Doctor, please start the session, doctor.
Yes, sir. I, Dr. Suchita Arvinda Patil from Department of Kai Chikitsa, going to present topic review on Ayurvedic diet guided by Dr. Hiraman Varungase, Department of Kai Chikitsa, SMBT, Ayurved College. Abstract. Ayurveda has special emphasis on Ahar diet and Anna food as a means to good life, health and wellness. Healthy and wholesome food nourishes the mind, body and soul. Eating a well-balanced diet on a regular basis and staying at ideal weight are critical factors in maintaining emotional and physical well-being. In Ayurveda, diet forms the important component of life as it is included in Tri Upastamba. Ayurveda has given a preview of Ashta Ahar Vidhi Visheshayatan, 8 factors related to method of food cooking, processing, food combination and intake. Viruddha Ahar, incompatible diet. Pathya suitable, apatya unsuitable diet. Any material in the universe according to Ayurveda is composed of 5 basic elements. The Pancha Mahabhuts, namely Prithvi, Aap, Tej, Vayu and Akash. The 3 doshas, that is Vata, Pitta, Kapha, which constituents the body, is also made up of Pancha Mahabhut. Each food article either has dosha aggravating action or pacifying or balancing action on human body. Keywords: diet, pathya, tridosh, viruddha ahar, ashtavid ahar, vidhi, visheshayatan. Next slide, please. Introduction. Living body is principally grown out of food, hence it is vital to test what person is consuming. Diet and nutrition are most important for healthy and equally important in management of disorders. Eating a well-balanced diet on regular basis and staying at an ideal weight are critical factors in maintaining emotional and physical imbalance. Ayurveda specified the characteristics of food in terms of quality, quantity, and time, which vary with age, constitution, digestive power, season, disease, and also from person to person. One has to consume the diet which is suitable to him in all the aspects, and deviation from this may cause disease. In addition to this, wrong cooking procedures, irregular timing, and consuming imbalanced and not following the prescribed rules for preparing, preserving, and eating food may also cause imbalanced health. Therefore, due consideration mentioned in Ayurveda should be given to all aspects of diet planning in the treatment of disease and to maintain the health. Aims and objectives: to study the role of Ahar diet in Ayurveda. Methods and materials. References are collected from Bruhatraya, Laghutraya. Ayurvedic literatures are used in study and various online journals. Shadras. The food contains 6 basic tastes, and taste has predominance of particular elements of Panchamahabhut. Madhur, that is Prithvi and Aap. Amla, Prithvi and Agni. Lavan, Aap and Agni. Katu, Agni and Vayu. Tikta, Vayu and Akash. Kashai Ras, Prithvi and Vayu. Drugs having Madhur Amla Lavan taste elevate Vata, those having Madhur Tikta Kashai elevate Pitta, and those having Katu Tikta Kashai elevate Kapha. Acharya Charak has described Ashta Ahar Vida Visheshayatan, means 8 basic specific considerations regarding food and dietary intake which are responsible for healthy and unhealthy effects of ingested diet. Prakruti, that is original qualities of food. Karan, that is proceeding specific qualities by processing and cooking of food. Samyog, that is food combination. Rashi, that is quantity. Desh, that is place of origin of food. Kala, time factor. Upyog, sanstha, that is rules of intake. And upyogta, the person who takes the food. Diet and mind. Ahar plays an important role in keeping our mind healthy. Considering the effect of food on mind, following 3 classifications have been made. Sattvic ahar, that is ideal diet containing vegetarian, non-oily, non-spicy articles. Rajasic ahar, that is too spicy, too hot, salty, that excites the mind. And tamasic ahar, too oily, heavy food that leads to lethargic mind. 4 forms of food basically Ayurveda describes, that is ashtam, that is eatables, khaditam, that is masticable, pitam, that is drinks and beverages, and lidam, that is licking form. Principles of diet: one should take food in proper quantity, which is hot, anxious, and not contradictory in potency, and that too after the digestion of the previous meal. Food should be taken in proper place, equipped with all accessories, without talking and laughing, with concentration of mind and paying due regard to oneself. The quantity of food to be taken again depends upon the power of digestion, including the metabolism. The amount of food which taken without disturbing the equilibrium gets digested as well as metabolized in proper time. If the food is heavy, only 3/4 or half of the stomach capacity is to be filled up. Acharya Sushruta advocates intake of food which is easily digestible, energetic, soft, and warm to be taken in proper quantity only when one is hungry. Viruddha ahar, that is incompatible food. The food with incompatible or contradictory qualities have poisonous effect on the body that aggravates the 3 doshas to various disorders, that is gulma, fever, allergic dermatitis, eczema, abscess, and other skin diseases. It also destroys strength, immunity, etc. Incompatible food combinations are fish along with milk, milk or milk products with alcoholic beverages, radish consumed with milk, equal quantity of honey and ghee. Rules of eating: do's. The food should be tasty, warm, quality, unctuous, and easily digestible. It should be eaten neither too fast or too slow. Should include all the tastes, that is madhuramla, lavana, katu, tikta, kasha in daily diet. It is best to focus on food while eating. One should eat in comfortably sitting posture. The food should be eaten only when hungry, after the last meal has been digested. One should take food equipped with all the accessories. Don'ts. The food should not be contradictory to each other in action, that is fish and milk together, radish and milk together, honey and ghee in equal quantity. Eating should not be in hurry. It should not be very slow either. Pathya and Apathya. Classically, 6 factors have been described which play an important role in acceptability of wholesome and unwholesome diet. That is Pathya and Apathya. Matra, that is quantity of food intake. Kala, time of drug administration. Kriya, mode of preparation. Bhumi, habitat or place. Deha, constitution of person who has to eat. Desha, that is body humors. Any kind of food article become wholesome or unwholesome based on permutation and combinations of above factors. Disease specific diet, that is in Amla Pitta, milk diet, Indian gooseberry, pomegranate resin, cereals like red variety of old rice, wheat, barley, green gram, small and frequent meals are preferable. Amvat, red variety of rice, barley, horse or green gram, garlic, ginger, black pepper, leaf and fruit of patol, warm water and light diet are beneficial. Madhumeha, seeds of barley, wheat, beans like green gram, fenugreek, horse gram, etc. Fruits of bitter gourd and other varieties of gourd, green leafy vegetables like fenugreek, coriander. Amla, that is Indian gooseberry and other sour fruits. Use of triphala is useful. Discussion and conclusion. Human body requires food to provide energy for all life process, growth, repair and maintenance. A balanced diet contains different types of foods in such quantities and proportions that the need of body is adequately met. Eating a well-balanced diet on regular basis and staying at ideal weight are critical factors in maintaining emotional and physical
Doctor?
well-being. In Ayurveda, diet
Hello, doctor. Please speed up
yes,
your presentation.
yes, ma'am. Last slide. In Ayurveda, diet forms the important component of life as it is included in Trayupastambha, 3 pillars of life. Proper planning and indulging of the diet can maintain our body. Each food either has dose, aggravating or pacifying action on the body. These are some references. Thank you.
Thank you, doctor. So next I invite Dr. Neha Madhukar. I invite Dr. Neha. Dr. Neha. Hello, Dr. Neha, are you there? Dr. Neha?
Yes, ma'am. Am I audible?
Yes, doctor, you are audible now.
Okay.
Doctor, please share the screen.
Yes, yes.
Dr. Neha?
Yes.
Your
Is it
screen
visible?
is visible, doctor.
Yes.
Visible, doctor. Please chat, doctor.
Okay, okay. Sorry for the late. My name is Neha Dutraj. I am from Government Ayurveda College, Nanded, Maharashtra, from Sharikriya department. Today I am presenting Lokpuru Samya Siddhantam. Now, as we know, Ayurveda is an ancient science which had made its existence from divine origin in the form of basic principles, which are practically till now applicable. And now we will see the concept of Siddhanta first of all. That is, Atha Siddhanta, Siddhanto Namasa Yah Parikshakaihi, Bahuvida Pariksha Heturvichya Sadhita Stapatya Nirnaya. That is a subject or concept which is examined by expert multiple times and they put forward a decision which is unchangeable, and that is called as a Siddhanta or Maulik Siddhanta or a basic principle. Now we will see the types of Siddhanta. There are total 4 Siddhanta. So, Sarvatantra, Paritantra, Adhikaran and Abhyupagam. Now, Sarvatantra, which is accepted by universally by all the treatises, such as there are remedies for all the curable diseases. And Paritantra, which is not is universal in nature and is held by only one of the treatises. For example, there is some treatises consider rasa in number 6, and some treatises consider rasa in number 8. Now, Adhikaran, this is Siddhanta which needs to be established by the implication of other proof. And the fourth one is Abhyupagam, which is held up by physician temporary and hypothetically during the debate. And these ideas are unproved, untested. So, for example, proposing that Dravya is predominant, or guna or properties are predominant, or virya is a predominant. So that is not fixed, which is a hypothetical. So these are the 4 types of Siddhantas. Now we will see the main part of our presentation, that is a Lokpurush Samya Siddhanta. यावन्तो हि लोके मूर्तिमन्तो भाव विशेषतावन्तः पुरुषे स्थावन्तः लोके इति बुधास्तेयं दृष्टुम् इच्छन्ति. So the human body is equal to the universe. Whatsoever form entities are in universe, the same are in human body, and whatsoever entities are in human being, those are in universe. That means Yat pinde tad brahmande. Pinda means nature, and pinda means our body, human body, and brahmanda means nature. So whatever is in the nature is in our body, and from what our body is made up of, the universe is also contains that element. So this samya between lok and purush we will see in 2 ways. That is, one is sangatanatmak sadharma and other will kriyatmak sadharma. So sangatanatmak means basically anatomical sadharma. So for that, in Grantha there is a shlok, sarvam idam panchabhotikam asminarthe. That means everything is made up of panchamahabhut, that is Prithvi, Aap, Tej, Vayu, Akash. As a universe is also made up of this panchamahabhut, and human body is also made up of this panchamahabhut. So it shows the sangatanatmak sadharma between lok and purush. Now kriyatmak sadharma, that is visarga adane vikshepe soma surya anilayatha dharyanti jagat deham kapha pitta anilastatha. That means visarga includes destruction, separation, or going away, and adan includes creation, coming together, or addition. And vikshep means circulation, and all these functions in universe are carried out by moon, sun, and wind. So similarly, these functions in human body bears indicated by kapha, pitta, and vata. Now there is a list given which shows the similarity between the lok and purush. There are total 24 examples. Like in nature there is a prithvi, and similar there is our body which is called as murti, in the murti form. And in lok there is a aap, that means water. In our body it shows the clay. For so on, there are 24 examples for that, which shows the similarity between lok and purush. Now the aim of this siddhanta is this purpose of the stating law of lok purush is that function of universe and humans are similar. Since the origin of both is similar, root values are similar, substances are similar, and the retirement path is also similar. So both get restricted in the same similar fashion also. So it is like a guidance for physician. Whenever a physician treating only patient gets stuck anywhere, he should observe similar examples from the universe and try solution to patient's treatment. Not only this, but learning of this law teaches human empathy and sympathy towards each other, as well as towards the rest of the universe. So this is called as a Satya Buddhi also. So this is the last slide of presentation. Thank you.
Thank you, doctor. So next I invite Dr. Preja. I invite Dr. Preja Vijay Kumar. Hello, Dr. Preja. Dr. Preja Vijay Kumar. If you are there, please unmute.
Okay, doctor. Next, I would like to invite Dr. Yogesh Sunil Gaikwad for the paper presentation. Dr. Yogesh.
Present, sir.
Okay, doctor. Please share the screen, doctor.
So the screen is visible?
No, doctor. Not visible, doctor. Your screen is sharing, doctor, but not visible, doctor. Now visible, doctor. Your screen is visible. Please start the session, doctor.
Okay. My topic for presentation is Ayurvedic management of Sheath Pitta. Introduction. Sheath Pitta is one of the disorder which is caused by Viruddha Ahar Sevan. In Vata and Kapha are the doshas which are primarily disturbed due to the Drosh Prakop. Hetu and in combination with Pitta dosh. They create swelling, redness, itching over the skin. Vata dosh is dominant in Sheath Pitta. Sheath Pitta shares similar symptomatology and causative factors as urticaria. The modern medicines provides temporary symptomatic relief and patient have to take medicines for long time, which may have been some side effects. Ayurveda, the sequential administration of Shodhan therapy and certain Shaman yogas quite beneficial. Here we discuss about the easy method for lowering the incidence of Sheath Pitta by Ayurvedic management. In Ayurvedic text, only in Madhav Nidan, Sheath Pitta was explained. In my class, causes for Sheath Pitta are as follows. Lavan, Katuras, Shukta, Arnal, Sarshapati Sevan, exposure to cold environment, wind and water, Divaswap, Asamyak Vaman, Kitdansh and Krumi Sansarga. The samprapti of Sheath Pitta is as follows. Improper earning plus irregular food habits leads to the formation of arm, which leads to vitiated the three doshas and srotorod by Sang and Vimarga Gaman. Those dosha samurchana commencing in Amashay gets Sthana Samshay in Twaka, and due to which the Sheath Pitta causes. Chikitsa consists of three phases. Alpha dosh avastha, in which there is Langhan, Madhyam dosh avastha, in which we do Langhan along with Pachan, Prabhuta dosh avastha, in which we do Shodhan. In Shaman Chikitsa, Parat, Suvarna, Loha, Tamra, Abhrak, Kasis, Gandhak, Gairik, Praval are the major mineral drugs that have action on Sheath Pitta. The drugs which are used are Lagu Suchekar Ras, Arogyavardhini Vati, Haridra Khanda, Mahamanjishtadi Kwat, Eladi Tel locally, Suchekar Ras and Chaturbudh Ras. Shodhan Chikitsa consists of woman with decoction of patol and arist, variation in which we give purgation with decoction of Trifala Gugul and Pipili. These are some of Chikitsa references. Patheya Ahar Vihar, Jeernashali, Jangam Mouse, Trifala, Madhu, Udgayush, Kulatayush, Ushnodak, Karkotak Shak, Karavel Shak, and Mulak Yush. Apatya Ahar Vihar, Chardinah, Ikshuvikarni, Divasopna, Matsya, Purva and Dakshina Disha Pavana, Anupa, Udaka Mouse Sevan, Snana, Navina Madhya, and Atap Sevan. Conclusion. In modern science, there is vast treatment of urticaria, but recurrence of disease is common in very much cases. Sheath Pitta is commonly encountered Twak Vikar in clinical practice. Ayurvedic management given in Sheath Pitta shows significant improvement. Thank you.
Thank you, Yogesh. So next I invite Dr. D. Paragesh. I invite Dr. D. Paragesh.
I think today's presentation seems to be over. Dr. Preja Vijaykumar, are you there? Dr. Priya Bilkhade, are you there? Dr. Anish T, are you there? Okay. I would like to invite Dr. Aishwarya to conclude the session.
Thank you, Dr. Sabale. So this is an official end of Patheya national level paper and poster presentation. So thank you all for joining with us and making this as a success. At this moment, on behalf of Team Ayurapta, I take this opportunity to express my sincere gratitude to our each panel members from my bottom of my heart for the support. And once again, I would like to thank all our participants for the active participation. Once again, thank you all. We'll meet soon.